Welcome to the In Season podcast, rated R for language.
None of us are doctors or neurologists. Things you're about to hear are opinions of people living with epilepsy or seizures. These are firsthand experiences. Epilepsy can cause speech problems, and medications are hard to pronounce, so please bear with me. Epilepsy can cause bad memory, so some stories will be repeated. I'm Pookie. Get ready.
I can hear you.
Oh, I can hear you now, lightly. Oh, really?
Yeah, I can hear you now. I was getting things set up.
How you been,
Hi
Reese?
everyone, it's been a while. Things
Yes,
are
it
like
has.
nuts over here. I'm moving and I had a visitor, and so it's just been everything possibly that, it's been nuts.
Gotcha.
I said,
Hey.
Hi,
Look who's
guys.
here.
I saw the disclaimer. Good job. Good job. All I can do is smile. I'm so grateful. He's not wasting any time. But man, this Xcopri, the titration is making me a stronger warrior. Okay. Yeah. So how's everybody doing?
so far, so good. Yeah, so far, so good. Oh my goodness, my phone.
I feel like I've been away for a while. I don't know if that's true, but that's because I've had a few bad ones. I am moving, maybe that's why, but I had one where I wound up with 2 black eyes.
Oh.
So that was neat. And so I've been wandering around with 2 black eyes. I don't think they're that visible anymore. I think they're almost healed. And I had a couple more since then. So yeah, things are going great. And yeah, thank you.
You look
So,
awesome. I'm
yeah.
sorry we missed the black eyes because you wouldn't show us, but you look awesome today, Reese. I'm happy to
Well,
see.
thank you. Yeah,
I think we've all had.
I had to show my therapist, I think, and who else got to see? I mean, obviously my wife got to see. I felt like enough people got to see. Y'all didn't need to see too.
We
So
love you anyway. We know. We get it. We get it.
I appreciate it.
Yeah. It's good to see you. I've been gone for a couple weeks too. It's like I just kind of crawled into my cave, stayed there for a little while, but trying to get used to Xcopri. We're gonna bring down the Vimpat as soon as my pharmacy releases the prescription because I just filled my Vimpat 200. Now he wants me on 150. And they're like, well, you still have pills left. And I'm like, don't make me do this. I'm just going to call the doctor and let them fix it. So, because I'm not going to fight with anybody, not when it's like, okay, the only reason I'm getting this filled sooner is because it's a different dose. Well, it's a controlled substance. Well, I'm going to exhibit my control. So there we go. I should have that tomorrow. Just went up to 50 milligrams. Angel's at 150. He's way ahead of me. I'm like, oh God, oh this, but I feel better. I do feel different. So in spite of the ick.
I'm glad you feel better. I'm glad you're here.
Yeah, I miss you guys.
Always a warrior.
Yeah.
I was like, Ann will get better. She'll be back.
I'll be back. I'll be back. And I ordered the spinner knob for my lawnmower so I can still ride my tractor and use my left hand when my right shoulder is healing. So we won't tell the doctor, but you know.
Oh, wait.
I'm not telling.
All
Oh,
right, so we'll get
but it's
started.
a really good to get off of the Vimpat because Vimpat plus the Excopri. Once you get off the Vimpat and
Oh.
don't have the salt levels, well, you still have salt levels killing you, but it's not as, bleh, if that makes any sense.
Yeah, it does because it's the vertigo.
Mm-hmm.
And I did the smartest thing was I share my health information on my phone with my doctor. And he sent me a message today. And he's like, "What happened?" Ah, oh, this is what happened. But I think this is why, because Sunday I was in a lot of pain and I was double dosing on my Feco. And he's like, "Well, cannabis and Xcopri don't get along. And because you're on both the Xcopri and the Vimpat, that would throw you off." So he said, "I'm not telling you to stop using it, but now that you know, you got to be careful. And that pain should go away after this surgery. And that's his number one priority is to get me through that and recovering better. But I can't have vertigo. I can't be dizzy. I mean, I'm walking into the corner of the wall. You know what I mean? It's like, whoa, and wall surfing. I call it wall surfing. You know, it's like I need something to hold me up. I can't hang on to the cane. It's just not, this is not happening here. But definitely getting somewhere and very grateful and happy to name the name Trent Tollefson at URMC Epilepsy Center. Anybody in Rochester, he's the one you want. Okay. He's the one you want. This man is not missing a thing and he's watching me like a hawk. I mean, for him to send me a message, I noticed this at 4 a.m. and how did that turn out? I'm like, oh, I kept a bucket near my bed just in case, because I know, what medication changes can do. And I'm so grateful I did that. And when I described what that was like, he's like, okay, that's my cue. That's my cue to lower the Vimpat because that is what does that. And you'll be better off with either none of it or just a little bit. And the X Copri should do it for you. But this isn't fun. I hate this part. Oh shoot. And they're still bugging me to complete pre-appointment. Blah. All this paperwork for surgery is crazy. But yeah, so that's things are going better. But it's kind of funny. I don't know if you guys know what K tape is. It's called kinesiology tape, and people, especially weightlifters, athletes, will use it. It You stick it on your skin, and when it's done right, and because my daughter's a kinesiologist, she brought home some K tape, and we're going to tape my bicep because there's nothing. It is no longer attached to my shoulder. So we're going to tape it up so that I can still keep that muscle moving because the more it's moving, the more tendon we have. And I'm like, I want to scream. And I'm still doing my exercises and crying. I am literally in tears. And I'm like, I don't care. I need this muscle to move because they have to literally pull the whole muscle up to my shoulder and attach the tendons. So I need that muscle to be pliable. So Natalie is like, I don't think I have any at the studio, but I'll go to Target. I'll get some. So she's going to tape my arm up, and hopefully that will help. Helps with the pain. We've done it to my knee. It's pretty amazing. Physical therapists will do it in certain situations like this, but I'm not in physical therapy right now, so I guess I'm stuck with the next best thing that it's like, yeah, she's amazing. So I'm looking forward to that. That'll stay on for a few days. We'll change it, take it off, and 2 days before my surgery, And hopefully that'll give the muscle enough flexibility so that we can pull it up, because now, I mean, I've got pain. The headache is going up the side of my head. I'm like, 10 days, guys, 10 days. So I was mad cranky. I mean, I couldn't bring that here. But we're getting there.
Are they
Yeah.
gonna give you like that tape that they use for athletes, the one that helps like with pain also? It's like,
Yeah, that's K-tape. Yeah, that's
okay,
exactly what she's got. And she's
man.
gonna, it's gonna be crazy because supporting a shoulder that is no longer attached to part of your arm is a challenge. But I don't even know. She said what she was gonna do, and I'm like, I don't care. Just do it. She knows what she's doing. Just do it. But it's like the wrong muscles are working to move my arm. My elbow hurts, my hand. I'm like, I can't. I just can't do the headache anymore. So we're going to try to relieve some of that pain so that when I do my exercises, I'm not feeling like I want to throw up, those spontaneous tears. It's like, no, I am not sweating, just my face. Okay, it's just my eyes are sweating. Okay, that's it. But yeah, mm, I'm not backing down on this, and I know it's funny because Jeff was like, "Oh, this is brutal. You got to rest that shoulder." I don't know how to do that. Okay, I really don't. Um, Especially when the shoulder contains what are called accessory breathing muscles. The only way to rest it is to stop breathing. I'm sorry, but I'm not doing that today. So we'll do the K tape. And there's Jeff. Yes,
Hey
there's
guys,
Jeff. There's Big Jeff. Hi.
Hey, brother Jeff.
how you doing?
Doing
Right.
okay.
So far, so good. How about
Good.
you?
I'm only I've got a day full of meetings. Just finished a meeting and then I have to go to the chiropractor. So I'll be on for a little while, then I'll be on later.
Okay. Chiropractor, you lucky guy. You lucky
Right.
guy. I can't do that
Lucky.
anymore. Yeah, I can't do that anymore. What?
I'm basically going to him to get a script for an MRI for my
Oh,
Mm.
hip.
really?
Yeah, my
Oh,
hip and my one of my my knee replacement is probably dead. So I think it has to be replaced again.
oh, geez. Oh, geez. Haven't done that yet. I've had two
Yeah.
reconstructions. There's nothing
Well,
left
hey,
to.
while we got Jeff here, let's have you answer the first icebreaker. And
Okay.
that is, what do you think makes these meetings productive?
The people.
Okay.
I mean, the people make it productive. Everybody contributes, except me. Um, and uh, everybody's concerned about everybody else. And it's the people that make this special.
All right. Next up is Toaster. What makes these meetings so productive?
I thought you might have forgotten I was here if I just stayed silent. But no,
Never gonna happen.
what makes these productive? Well, I mean, yes, definitely the people, but it's also the stories that you get. I mean, just listening to Annie, it's like, holy shit, if she can do this, I can too, type of stuff. Listening to stories that's like, oh, Pookie wandered off. Oh, yep, I've done that. I don't feel alone. Um, there's actually the I went to get an SEG done once, and there was this guy who had just gotten his resection done, and he was up and walking around, and then every once in a while, nurse would come get him, put him back in his room. Then 10 minutes later, he'd be back in my room. We'd be having grand old time. We were watching the Jimmy Buffett concert. Um, and my mom said, if you had friends who have epilepsy, things would have gone a lot more smoothly. We would have known a lot more because I learn from you guys every day, and it's yeah, it's the stories and the people.
I've had experiences, and I'm sure you guys have too, in the hospital where people don't know things about epilepsy. You know, I've gone for my MRI and people have been like, "Wait, what's that thing in there?" And I'm like, "That's a shunt. They put that in there when I had my fucking whatever surgery where everything went wrong. You don't know what a shunt is? You're the doctor." It,
Oh,
what?
that's terrible.
I don't understand. And like,
Was it a
hey,
nurse or a doctor?
I'm I don't remember. I'm the one with the neurological condition. I don't remember, but you know, it, it it's we have to teach all of our doctors about our condition every time we meet them. So it's nice to talk to people who already know.
All right. And what do you think makes these meetings so productive?
It's definitely the
Oh, I asked you.
mutual.
Shoot.
What? What's the matter? Oh,
Did I ask you first?
no,
No,
no, I
Jeff went
didn't.
first.
I was
Okay. All
just
right. My
gabbing.
bad.
It
It's definitely the mutual support because we understand each other and we have no doubts that what you're telling us is true. We don't have to defend ourselves. Um, we don't have to prove anything to each other. We can just say, "This is my story. This is what's happened," and we get it because we're part of that story. We've experienced some of it, and then having everybody, literally all I have to do is reach out and say, "Ouch, I need some support." And you're right there. I took a few days, well, felt like a few weeks off. And yeah, but I was still talking to Angel. I was still trying to stay in chat. I stayed off of Reddit because I was definitely being followed. I don't know if you guys saw that new epilepsy group, Focal Aware Seizures. Um, it's an interesting little Reddit that,
Did not see that.
yeah, you should look at it. I think there's maybe, I don't know how many people, 6 people in there, and they have 4 different account names. But yeah, um, so I don't know if it all came from all of that or if there was, I do have a couple nefarious stalkers that I really suspected that's what happened, and I don't know. Um, I don't know. It's just I'm glad that's over. We covered all the bases. This is a podcast. This could be recorded, and I don't know. I guess I thought everybody understood that too. It was just kind of crazy, and
I don't have to say it anymore.
now I know I love that.
Unless you really clicked agree without reading, I don't have to even bring it up anymore.
Yeah, it's right there. You said yes. Okay. That's the disclaimer. Nobody in any state can fight with that now. So it's like, okay, you're being recorded. But that wasn't enough for some people, I guess. I don't know. I don't know. Um, but whatever all that was, I'm glad. It looks like it's over. I don't know about you guys, but I did have some people on Facebook following me around. And I got some weird things happening on my Reddit. I keep getting new account names on my account that I'm not putting there. And I'm like, what is going on? So I don't know how to fix that. Yeah. But other than that, things are fine. But yes, definitely the mutual support, the mutual understanding, the snickerdoodles and brownies. All of that. All that.
What was I gonna say? I was gonna say firstly, I can't find the focal aware thing, but
Okay, let me see what I can find.
and I was gonna also say your name did change a couple times last week.
Yeah,
I couldn't
yeah.
figure out if it was you or someone else. 'Cause
I
I
can't
forgot a few
either.
names.
Yeah, half the time it's like, oh, and it just changed again. It's like I don't even know who I am anymore. But
All
it's
right, that
weird.
focal aware link is in the chat, and I'll be right back.
Yeah.
Unrelated to this group, but I had thyroid cancer, and before you get your thyroid removed, or no, not, it's not before you get your thyroid removed, it's after you get your thyroid removed and they verify that it was cancerous. They have to do this other wonky, I don't even know, radioactive thing. And you have to prepare for that for like 2 weeks with like this crazy diet. And it's not vegetarian, it's not anything specific. It's just a wild diet that everything is out. You basically can't eat anything except vegetables and just like these but only specific kinds of vegetables. It's a weird diet. So you basically can't eat anything. You're just a rabbit for 2 weeks and it's terrible and you're miserable. But I found this recipe where you could make these like shitty, they weren't snickerdoodles, but they were these, I think they might have had peanut butter in them, but they were just these nasty, they weren't cookies, but just like baked something, some kind of thing that I was so excited about because, yeah, imitation cookie. That's a good way to describe it. And they were disgusting. Like any other time, I would have been like, what the hell is this? But during this time, I was like, oh my God, this worked. This came out. This is the greatest thing I've tasted ever in my life. And my wife tried them and she was like, these are disgusting. And I was like, yeah, I believe you, but I love them and they are my favorite thing ever right now. And please give them back to me. And I just think that's very funny.
Okay, love where this one's starting off. Already got plenty of conversations going on favorite snacks and everything. Somebody's saying here, is it weird that I'm smart even though I have epilepsy? Big long story, but that basically sums it up. Just saying that they were going to get checkups every 4 or 5 months, like twice a year. And the doctor always gave them the impression that, expect your mental capacity to decline. And this apparently who posted it was 14 years old at the time and was really not looking forward to that happening. The comments assured them that epilepsy is different for everybody and definitely get a new doctor, I would say, because if any doctor ever gives you the impression that you're not going to be smart because of epilepsy, that's not somebody on your side. Did this ever happen with you guys? What do you think?
This has
No.
not happened to me. I have only had epilepsy for a short time, but I will say I am terrified of this. So, anyone who's had epilepsy for a long time, I would love to hear about not only what your doctors have said, but what has actually happened.
Wait a second. What
I
about Mark? He's brilliant.
We can ask him again when he gets here. What about Toaster?
Um, what I would say is intelligence and knowledge is two different things. Like Annie just said, people tell her that she's smart all the time. She is smart. She's you're smart as you're sharp, real sharp. But there's a difference between smarts and knowledge. And my neurologist has basically told me deep seated, there's soft memories and hard memories. Hard memories of how do I fix or how do I do this? And things of who the hell Margaret Thatcher was. Um, it's two different things. Knowledge and smarts are two different things. Um, and it's often confused because, well, we are all brain damaged. Our pathways are not clear anymore. Definitely not. So we are very good at rerouting, but there's still but the degradation that still happens. Things that you used to know, you might not know anymore, but you're still smart. And guess what? You hold in your pocket this wonderful device. My friend Annie told me about this. It's a supercomputer that you sit on and it tells you the time. It's called a phone. The internet has saved you many times. I mean, many times before. If you just be smart enough to use it. Okay, I'm done.
Hey, Angel.
Yay, I remember to turn off mute now.
I forgot the icebreaker. What do you
What
find
do you
most
think?
productive about this?
What hold on. Let me what I think makes these meetings productive. Well, one is just being around all you guys and hearing your stories and stuff of how you battled through epilepsy and stuff, and like the different things you experienced that I didn't know that was involved with epilepsy that I also experienced, and that was very good. Like, and two is just, I think, sharing it with the world, like getting it out there and letting know that others, you're not alone. And I think that's what makes these things most productive.
Right. I got some right here. Says, is there something I don't know? Okay, so I have a sister, 28 years old. She has epilepsy and she's had it for a number of years now and seems to have a consistent issue with not taking our medication, forgetting to take it now. And she seems to have a consistent, oh, I'm reading the same line, forgetting to take it or right out refusing to take it, which of course results in eventual seizure. At first, she was claiming she was forgetting to take it, which was understandable. Sometimes you forget. I forget to take my medication sometimes too before I leave for work, despite it being my usual routine. Then, then when she kept having them, we kept finding out she wasn't taking them at all, as in she wasn't just forgetting. The reason really was we found out because the medication was not found to be in her system after a doctor performed a test. After that, my mother tried to make sure she took her medication, and for a while that worked. But now my sister has become fed up with being reminded after a few weeks. I walked into the living room and my sister suddenly grabbed my attention. I looked over to her to see what she's holding, two pill bottles in her hands. Looking rather irritated, I was confused, but then she started explaining She claimed that epilepsy and neurodivergency, which I looked up, and I'm unsure of whether that statement is true or not. And she wouldn't be taking her medications anymore because they were eradicating her. It was rather concerning to me, considering epilepsy can be fatal. Sure enough, after refusing to take her medication, she had another seizure just a week or two. I just thought I would share this because I'm curious if anyone else has had this experience with a sibling or another family member or a friend. Please just feel free to tell me. I'm deeply concerned that doesn't start taking her epilepsy medication seriously, that she may not come out of her next seizure. Also, please feel free to correct me if I'm wrong about anything, because there are some crucial information I'm missing here. And I don't know a lot about epilepsy aside from knowing what to do if she has a seizure and the type of seizure she has. They're tonic-clonic seizures, also known as grand mal seizure. Pretty much. What should they do when you have a sibling who's not taking their medication? And that's a shitty day. You got to worry about someone not taking it because they don't want to. I take
And
mine.
Sounds like on that one.
yeah,
Go ahead, Angel.
any seizure could be your last.
Yeah, I take my medication because I don't want it to be my last.
I responded to that, I think.
Yeah, you
I
did. I was gonna wait until we get other responses.
Okay.
Get to
I
yours.
couldn't remember what I said though, but when you were reading it, it's like I know this one. Okay.
um, we don't have any siblings. We're all the ones having the seizures. But in the comments, someone says our daughter, wife, and I lost our 25-year-old daughter in April 2021 after returning from errands. We found her face down after a seizure that had caused cardiac arrest from the position she'd fallen over. Her breathing was minimalized from that. I'm stating this because after her passing out, we found piles of her medicine throughout her bedroom. We assumed she had been taking them and been taking her pills for months, only to discover the identical situation you're feeling too. Now, being that she's an adult, realistically can't force her to down them down her throat as much as I wish I could. With that, a conversation perhaps discuss the outcome that could resist in this behavior and possibly counseling. Find out why she refused to take it. I hate taking my medication, also epileptic and ADHD and antiphospholoid syndrome. So I take a lot of shit every day. I understand for the most part what she's doing. Though regarding the medication, it is overwhelming. The side effects, the memory issues caused by pretty much everything and every medication that treats epilepsy combined with seizures that also affect memory. It's all cumulative. You love her dearly, and that is beautiful. Yeah.
That's well said. Trying to get to the root cause is the best way to do it.
Yeah, I was thinking, are they asking this person why not? It didn't say if they asked her why not. And another comment says she needs to see a psychiatrist. Or OMG, I'm so sorry. She's convinced herself of something very dangerous. Try contacting her doctor and ask them for advice. And then there's Toaster's comment. It says, okay, let me break this down the best I can. Yep, goldfish memory sucks. I forgot my morning meds all the time before my mom made a sign that says, take your morning meds. I put it out at night when I take my nighttime meds. Then I am unsure if I took the morning ones. I look for the sign. If it's still up, I take them and then put the sign away. If the sign isn't there, I assume I took them. Epilepsy in itself is not neurodivergent, but there is large percentage of those who are. They're also in overlap when it comes to how much stimulation we can take, if and that makes sense. Wait, she's refusing to take them, eradicating her. Okay, some meds do feel that way, make you into a zombie, but why wouldn't you tell her doctor to change her meds? Here, when it comes to when it comes to what to do when having a seizure, seizure safety school. Oh, you linked it. Seizure safety school. Is that a story you wrote?
Yes.
So I don't know if this is going to be helpful at all, in addition to Toaster's comment, but I feel like I already forgot the specifics of the question because I'm still working on my medication, so my memory's bad right now. But there are a lot of things you can do to help remember to take your medication. And there are also a lot of things I wanted to say about why you should take your medication. So, first of all, I have my pill box that is it has morning and night every day of the week. Hold on, my computer's doing something. Okay. We're good. Fill it up every week, take it every day. Then you know if you took it or not. Great stuff. Regarding whether or not they want to take the pills or fill up the pill box, I gotta be real with y'all. I understand feeling like you don't really want to or care. I've been there. I think that seeing a psychiatrist is not something that people should feel embarrassed about. I think that everyone should see a therapist at the very least. That should be a just a general thing. And a psychiatrist should be a thing that people are less ashamed about. As far as people's feelings about whether or not a seizure is the last one they ever have, the thing that brought me to think about it differently was, what if it's not your last, but it's your last as you, if that makes any sense. Seizures affect your brain. They can change your brain's abilities. And yes, any seizure can be your brain's final seizure, but any seizure can also be your brain's final seizure's ability to do XYZ. So when I'm feeling like I don't care, I don't want to deal with this, I don't want to take these pills, I don't want to have a million doctors, I don't want to do this, I just remind myself I don't want to be a vegetable either. That's the biggest thing. So if this is the best that I get, then I'll work with it. That's what I tell myself. That's all I got.
That's the best way to make it through. Still sounds like you're trying to stay positive for the most part.
That's what I was gonna say. Staying positive. the best part about it.
Yeah, I almost forgot my pills until like right before the podcast, and I'm like, oh, I didn't take my morning meds, but I did wake up late, so
I got
So
one here.
Angel, what Angel was saying about these Excopri, since so many people are taking more medications, this new one especially. Has anybody's doctor ever put a plan into effect of like getting a baseline of blood work, just kind of running a TBC before and then maybe 3 months into titration or when once you started the new meds? Toaster.
So I was on the drug trials for Excopri, and the types where you didn't know if you had the real drug or if you had a placebo. I'm quite sure I had the placebo. Um, because after the trial, they put me on Excopri, and things were totally different side effect wise. But during the trial, they would have me take blood tests every 2 weeks. They were mainly looking at my liver, the liver, whatever they use for help you figure out what's going on with your liver. Um, but yes, there is a noticeable drop in your sodium intake. Potassium, I don't remember. I just remember the sodium.
How long did it take for that sodium drop to take place?
Well, now that is the interesting thing, because I was on Vimpat as well, and that one also drains your sodium. So I don't know if it. And that time was very weird
So you
because
had
I
no way
had,
to pinpoint which pill did it necessarily.
yeah, because during the trial I stayed on all of my other medicines, so they had the right baseline. I wasn't weaned off of Vimpat until after the trials were done.
And chances are you say you had the placebo?
Yeah, chances are I had the placebo.
Okay. So even if blood work changed throughout the trials, it wouldn't have necessarily been able to blame on Excopri.
No, but my doctor
Gotcha.
does want me to get blood tests every 6 months still, because Excopri can damage your liver. So you gotta just make sure you're doing good.
That makes sense. All right. Sorry for interrupting.
I got another post here. Well, it says having kids while epileptic. 29-year-old female was diagnosed with epilepsy earlier this year. Before the diagnosis, I was anticipating one day in the near future having kids with my partner. I always thought I'd have one or two before my mid-30s. But then I got the diagnosis after years of my symptoms being brushed off by doctors as anxiety. And now I'm second guessing whether having kids is even in my best interests. I've been seeing my brother and friends with newborn toddlers, and I'm worried that not only would a pregnancy be hard for me, but the newborn phase sounds like it would send me into a seizure with how little sleep new parents get. I normally get focal awareness seizures, often clusters, but have had two tonic-clonics in the past year, which is what I finally got my diagnosis for. I'm wondering if others have been in the same boat as me and decided to have kids, how it worked out, or if you decided to not have the kids after the diagnosis and why. I guess I'm looking for other perspectives because my boyfriend is confident and would like all of it to work out, but I have my worries about my health and whether that will be negatively impacted by my ability to be a mom. I cannot be a mom, unfortunately, or it might be fortunately. Yeah, fortunately, I can't become a mom, but moms, I think we got a few moms up here today. Um, hmm.
I'm positive the tubal ligation was voluntarily performed on the second C-section because I didn't want to have any more children on, because of the epilepsy. I didn't like how I was having more seizures, and it just wasn't conducive to, raising the family and getting pregnant again. So the epilepsy did have something to do with my decision to not have any more children, but it definitely didn't stop me from the first two. I mean, when it comes down to it, children do sleep, especially in that nice newborn stretch of the first few months. There was 12 months for both of them, and it's not about not getting sleep, but get it when you can. So if that tends to be a trigger, then make arrangements. It might be even more important to have somebody checking in, cameras, whatever support system that you feel comfortable with. You can definitely make arrangements. You're pregnant for a long time before the baby actually gets home. What do you think, Toaster?
I wasn't diagnosed until after I was already pregnant, but I did want a second child. That didn't end up going anywhere, but I did decide to have one. I decided that, well, you see, my dad has a neurological issue too. We have no idea what it is, um, but he gets migraines, massive migraines, and for a long time he wondered, is her epilepsy because of me? And blaming himself, and finally he just asked me. And the thing is, I may not have gotten my epilepsy from him, and if I did, so what? But I got the strength to live through my life from him. I got how to live and all the little things that make a person, if that makes any sense. So kids want your presence most of all, no matter what form you can give. They understand, they roll with it. When I tell Jeffy I need to lay down, he goes off and he does something else. It is possible.
And since you weren't diagnosed when you had kids, how was that?
I had at least one seizure during every pregnancy, but they went unrecognized. In all reality, I was diagnosed in 1968, but the clinical diagnosis didn't come until 2007. So my kids were born 82, 84, and 91. My last pregnancy, I seized during the delivery because my son decided he wanted to stay with mommy and he would not come out. His chest and shoulders were bigger than I could, and it was too late for a C section. And the things that they had to do to me are unmentionable and put me into a seizure, which they said was the best timing because the doctor could reach his hands up in there and pull the baby out. So I'm glad I don't remember that part, but I do remember them dislocating my hips to open the pelvis. So that's when I said, okay, no more. The marriage broke up then, and I had a tubal ligation because I said, I never, ever want to do that again. I love the three kids that I have. I'm proud that I brought them here and that they did the best with their lives. And I'm just happy to say I'm the one that brought them here. But no, after the third one, no. I knew. And it was one of those weird things. It's like we know there's something wrong. And when the doctors keep telling us, "Oh, you're fine, it's nothing." And then they see those things and they still don't diagnose you. I had an obvious epileptic seizure during that delivery, and they ignored it. They didn't report it, they didn't start treatment, they didn't do anything. and that was in 91. So, they said, well, the
That's how I
stress,
got my diagnosis.
yeah. And they said, well, the stress of the delivery, this, that. And I'm like, I don't get it. Okay, you're telling me I had some sort of seizure. I was told when I was a kid that I had epilepsy, so I don't know what's next. And it took a couple more decades to get there. But as far as having kids, I guess it depends on your epilepsy, your medication, the support that you have. Um, but yeah, it wasn't so much the newborn phase that got me, it was the toddler phase. Okay. How many times I was tempted to duct tape my kids to a wall. Okay. We'll just leave it at that. My daughter's sitting right over here. She was jealous of her sister's curl because Natalie has perfectly straight, beautiful silk blonde hair. But her sister has these little waves. And I think Natalie was they were maybe 3 and 1. Okay. And all of a sudden, the baby comes crying. I didn't know what happened. And there's Natalie. This is mine. I saved that little curl for decades, okay? Just to keep reminding her that you were so jealous as a child that you cut your baby sister's hair off, okay? It was not the newborn phase, it was the toddler phase. And then the teen years. I don't know how I got through that with 2 teenage daughters. Um, yeah, I don't know. My son was the one that witnessed more of the trauma from the epilepsy because it had ramped up just before that official diagnosis. And the hardest part was mom didn't come home. Where is she? What's going on? And after a few times, he figured it out. Just call the hospitals. Just call the hospitals before we freak out because if they didn't call us, um, whatever. And that's how he would find me. And that's traumatic for a kid. But for those reasons, I would hesitate having kids if I knew it was going to be that hard on them. And this hard. I mean, my daughter watching me yesterday morning, I was so sick. I have not been, it was like food poisoning sick. I was like, what did I eat? What did I do? I'm looking at everything and I'm like, oh, it was the weed. Okay. I'm okay. I did that to myself. And my doctor agreed, but he's like, you don't have to stop taking it. Just be careful. This pain's going to go away. Just be careful and do not mow the lawn again. And I'm like, I have somebody's got to do it. He's like, well, how long does it take you to do your lawn? About 2 hours. How much of a lawn do you have? About a half acre. Oh my God. Do not do that. You're not going to be doing anything until fall. I said, good. I'm looking forward to picking up the leaves with that mower. Okay. I don't have to lift a rake. I just have to put the bagger on my mower. I'm happy with that, you know. But, he's like, no, no. And I would highly recommend doing something where you're not using that left arm for at least 6 months. Not like that. And I'm like, well, okay. Okay, I'll do my best, but I don't want to re-tear that tendon because then, who knows. But my epileptologist was lecturing me about mowing the lawn because he's like, well, what are you going to do this week? What's your plan? And I'm like, well, I'm doing this, this, and this. He's like, no, what else are you doing other than laundry? Well, I have to mow the lawn, but I'm going to wait. No, you're not. No, you're not. Uh, I probably will. I'll get what we used to call them necker knobs. It's the spinner that you put on the steering wheel, and I'll put it on the left so I don't have to use my right arm. And I'm like, I can do that. I can do that. But yeah, But as far as having kids, if I knew it was going to be this hard, I wouldn't have. But I'm so grateful that I have these wonderful people in my life, and it was fun. But had I known, I think I would have reconsidered. I mean, my first pregnancy, I think I was just in my second trimester, and my husband worked second shift. So he came home around midnight and found me on the stairs, face down. And yeah, and it was like he just kind of he took care of me, but we never really told the doctor. We never said anything because who knows. But I would be very careful. Um, yeah, especially with medication. You don't know what that can do. But yeah, I would know what kind of advice, to give. It depends on the every individual is different, you know. I mean, yeah, I can still mow my lawn every now and then, but I don't think I'd want to put any more kids through this.
Just drop it and stop thinking about the lawn for a while.
I can't. I'm out here looking at it and it's like, oh shit. I'm seeing things. I don't want these dandelions going to seed or the crabgrass because that's what I'm trying to get rid of. And you got to mow it to get rid of that. So, ah, you know, it's my fun.
I'm sure you'll come up with a plan that is safe for all your limbs,
I hope
and
so.
as in somebody else helping.
Yeah, I hope so. We'll come up with something safe. I think the necker knob is yeah, the steering wheel spinner. I couldn't find it on Amazon because all I'm thinking is necker knob. And I'm like, whoa, that definitely dates me. Okay, but yeah, I'm gonna put that nifty spinner on my tractor steering wheel.
There you go. You're
And
smart enough to come up with it.
you said with the thing about your daughter cutting your other daughter's hair. My daughter did that to my son, and he had dreadlocks, and they were like maybe like a foot long.
Oh,
Yeah, she was cutting them, and then she took them to her mom, and then her mom said, "Where'd you get those from?" And she was like, "I got those from my brother." And she said when she started walking down the hall, she sees dreads on the floor leading to the room he was in.
oh no. Like he
Yeah,
was like he was running from her.
they
Um,
were like 4 and 5. So she said they were playing barbershop, and that's up.
oh no. Cut off
Yeah,
his dreadlocks.
he's been wanting them back, but it's such a long process to deal with it. When you're born and just get them going, it's good. But
Yeah, yeah.
start over
That
now at 13, 14. Sorry. Um,
oh, I know. It's funny what kids will do when they're young like that. It's like yeah, playing barbershop. No. She wasn't playing barbershop. She wanted the curl. She wanted that. And still, I mean, I have the same hair. I can curl it, I can style it, and an hour later, you can't tell unless I use a half a can of hairspray. And it's just not worth it because, God forbid, I smoke a cigarette, my head's going to go up in flames. I'm not doing that. I did that in the 70s and the 80s. I don't need any more hairspray. Okay.
um, Another thing is like you guys didn't worry about the whole time. You guys didn't have that worry that I could fall at any moment.
Didn't have time for that.
Yeah. I didn't even think about that. And I mean, I'm thinking about it now because my neurologist just made a big issue of it. Um, but I didn't think about it then. I mean, I fell up the stairs, I fell down the stairs. I blacked out in the kitchen. I had some strange things happen during my pregnancies. And, I had a seizure in a chiropractor's office because I was in so much pain. We thought, okay, we'll see if we can fix this. He did the adjustment. I'm laying on the table and my right side went rigid. And he turned, and he looked and he told my husband, he said, she's having a seizure right there. And yeah, yeah. And it's like, I've been having them all my life. They just got more obvious and easier to diagnose later. So, yeah. But I'm more worried about falling now and after my surgery. That's if I fall on that shoulder, it's over. It's I'll be like Jeff. I'll be getting a shoulder replacement, and those are the most fragile, complicated replacements for a joint.
You got a
And
body cast.
I don't know what they do. Do they? I don't know. Please don't say that, Pookie. Tell me you're joking.
I
Okay.
don't know what they do.
Yeah. No, my baby boy was in a spica, a body cast when he was 5. I don't know. Oh, yeah. No, I'm not going to think about that yet. We're going to fix it. I'm going to be fine. Therapy starts 2 weeks after surgery. I'll cry. I'll scream. I'll complain, but I'll get better. Much better than this. Ooh.
Angel, did you have something? I seen you with your hand up. I'm sorry. We went into deep conversation.
Oh yeah, you asked a similar question, but I was just gonna ask, with the pregnancy for the mothers, like, was it rough with the medications, even though, like, if you were on Keppra or lamotrigine and stuff like that, that was supposedly safe for the babies, like, was it a rougher pregnancy?
I didn't believe them, so I took less meds. The first pregnancy was a carbatrol extended release. I just took half the dose. I think they had prescribed. It was like 100 milligrams twice a day, and I went to half dose. No complications or side effects in a 14-year-old. And the second pregnancy was on Keppra and a benzo. I got off of that small dose of Fycompa, I think it was, immediately, and that would have been probably 8 weeks or so into the pregnancy. Had a couple bad ones because I, pretty much stopped cold turkey, and that was just a bad idea. But other than that, it was down to 250 milligrams of Keppra twice a day for the 10 months after that, and so far no developmental delays. He's 4, and so far so good. Definitely felt
Was
like the
there
medication wasn't doing shit though.
was there a specific seizure? I mean, specific pregnancy where which one did you have more seizures having? I mean, pregnant with?
That was my third.
The ones which I'm on.
Your
Yeah,
third was the
Yeah, I
worst?
think it was.
Yeah, it was my third. I was 30 years old when he was born. So I was, I mean, they don't consider that a high risk. Um, but I think after, yeah, I think my brain was just trying to tell us something. And, it's like they couldn't knock me out to do what they had to do. So my brain did it. And, you know, but yeah, they knew it was an epileptic seizure because everything went tonic, and it's like, well, this isn't going to help. So yeah, a deeper cut and reach in there. When the doctor explained it, I'm like, you know, I had dairy farms in my family. And when you say something like that to me, it just totally creeps me out because there's things you got to do to cows when they don't complete their birthing process. And
I've seen it.
yeah, I'm like, moo. I just felt like I'm like, you literally had to reach up in there. And he's like, yeah, I had to get my hands between his legs and pull him out. And when we figured it all out later, he was post mature. So there's this stuff called meconium, which is their first bowel movement. And he had that in utero. So it was in his lungs. So his chest, well, his chest diameter was almost twice his head diameter. So we needed a little bit of help. And yeah, that was a scary birth. But I had a couple seizures during that pregnancy and then that last one. I'm not surprised. You know, that kind of stress. I mean, just thinking about it, I get the heebie-jeebies. It's like, oh my gosh. Um, yeah, I had to have a couple surgeries after that just to put me back together. Um, but hey, you know, I'm good. I, I made it. But I think it was the third one. The first one, that one surprised me more than anything. Um, and what I never will understand is how is it that medical professionals were watching this happen? They said what it was. They knew that I wasn't being treated and did absolutely nothing. So, yeah, in that decade of having kids, I would have thought that one of them would have said something. But, you know, things happen when they're supposed to happen. That's all I'm trying to believe, you know. But yeah, it was definitely my third. And that, I will never forget that one. He's my one and only son. And that's what I call him, my one son. And I'm so grateful he made it because he almost didn't. But yeah.
That's brilliant. That's brilliant. What you say?
About the seizures, with which pregnancy was worse? Do you know why?
The worst injury, fall down 2 flights of stairs, happened on a second pregnancy that ended in a miscarriage. The third one, though, definitely had more seizures throughout. But I think with Talia, I had one tonic-clonic every trimester. But with the third, it was two. It's safe to say it was twice as many. But they were less severe at that point because RNS was already in. So, you know, it was still progress.
I'm so sorry you guys had to go through that. I couldn't imagine. But one of these comments in the having kids while epileptic, one says, I was on 16 plus, oh no, I was on meds for 16 plus years before getting pregnant. I immediately went off them. When I found out, I was fine, seizure free for the next 3.5 to 4 years. Through 2 pregnancies, only several months after my second was born, did I seize again? I haven't been seizure free for more than 3+ months since. I quit driving 9 years ago permanently. I've been driving on and off for the previous 6 months, 6 years, and finally gave it up all the way. My kids have grown up knowing mom has epilepsy. They've seen me seize multiple times. They were in vehicles when I wrecked, likely due to seizures. They understand, and we figured out ways to get around without me driving. It's not easy. It's not been easy, but we managed. I certainly would never make a different choice. I think I would have made some different choices if I got to one back, but one more comment says, I'm also 29 and I wasn't diagnosed until I was pregnant at 26. Turns out that I've been having focal aware seizures for 10+ years, thinking they were panic attacks. When pregnancy sent me into 3 tonic-clonics, and now I've been diagnosed with treatment-resistant epilepsy. I would not change anything about having my son, and it was the best choice I made. Though I really, really pissed me off epileptologists by breastfeeding, pumping for 8 months and refused to stop. But it was really important to me. I have an extremely supportive husband and village, which I believe helped a ton previously. Previously, I personally would make an appointment with a high-risk OBGYN discussing things. They can be extremely helpful. What is an OBGYN? That's a long abbreviation for something.
Please tell me you're joking, Pookie.
Is it like LOL, 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 LOL?
Are you
You don't know
joking?
the abbreviation for the lady doctor?
Oh, that's abbreviation for a doctor?
Yes.
Obstetrician gynecologist.
I thought it'd be like DR and then some other stuff, but say that again. Opposite what?
Obstetrician gynecologist.
Oh, okay. I think I heard of it before. Um, yeah.
The obstetrics part is all about pregnancy, childbirth, and postpartum, and gynecology is female reproductive system outside of that. So diagnosis, treatment of all the lady parts. So the thing that Allison says now in the chat that her son has autism and he's on Dilantin, and she's saying that she doesn't know how she can trust the doctors, just trying to reassure her that it doesn't make a difference. But I would have a problem trusting the doctor too, especially just based on you know your child best. If you see, oh, okay, she was on Dilantin during the pregnancy. Okay, I misunderstood. But yeah, I mean, you know your child best. If you see something that is noticeably wrong or they're falling behind and not meeting those milestones that you're expecting, don't give up on getting a diagnosis or establishing some kind of therapy or something they can go to. Because doctors might try to blow it off, but you don't have to.
Not only that, but remember, kids ebb and flow when learning anything and everything.
I got something else. It says consistent seizure once a month. Hi, team. 25-year-old female, and I've had epilepsy since high school. I was on Depakote first, which was really successful. Stopped the seizures. I didn't have any for like 7 years. Since I'm at an age where I started thinking about pregnancy, I've been experimenting with non-harmful drugs. I've been making some progress, but every time I think of I'm improving, I get a seizure. I just had one. It is also a consistent one, once a month. I'm wondering what is happening in my brain during all the days that I don't get a seizure. Is there a reason why consistently it's once a month and not like on fatigue or other reason basis? Why is my seizure on my cycle? I also read the menstrual cycle could play a part too. Thanks a lot. I almost forgot it was a female until she said cycle.
Catamenial epilepsy.
Well,
There you are.
it's very nice that Pookie is not gender biased. I appreciate that.
Right now, my memory will come back. I've been through this 6 times. I'm sure I'm gonna remember some of these things. The OB, I
No,
thought it was just
no, I
OB,
wasn't
but
saying
then
that in a bad way. It's
yeah,
good.
I was
It's
thinking
good
some of
that
these things I should know.
you're not biased. Um, I just want to put out there that there is a ton we don't know about epilepsy. They don't know jack shit about a lot. So there's that. And there's even more we don't know about women's stuff because no one cares. So there's that. So where they meet, there is, I am sure, very little. So who knows?
Yeah, I can agree with that. It seems like doctors never really know what to test for to even start on figuring out why something happened.
Yeah.
But
But I'm
there's taking
thinking,
notes.
yeah, because I don't believe I ever experienced catamenial epilepsy. But who do you talk to? Do you talk to your epileptologist? Do you talk to your gynecologist? Both? Um, because that might include some hormone therapy. So, how I guess what I'm asking is, what do I tell people when they ask, what do I do? When you discover that you're having these seizures only once a month in a certain part of your cycle, that says a lot. And my daughter has a studio for women only, and she's a strength trainer. Uh, I mean, everything, weightlifting, functional fitness, which is what keeps me moving. But she studies all of those things. And, we were talking about the raging hormones during our cycle. And there's times, some women will have more seizures during a certain hormone level. So tracking that is one thing, but who do you talk to? Do you just tell your epileptologist? It's like, yo, I noticed that, during ovulation or during this phase, this is when, you know, I don't know, ladies, who do we talk to?
Whenever I mention it to the neurologist, they say just be ready. Don't plan on going out for those 3 or 4 days a month. And that sounded so, yeah, I think that I heard that from a male and female neurologist. So this is another example of patients having to take initiative for their own
Yeah,
care and well-being and bring it up to the medical professional who's supposed to know more about hormones and what they can do and which ones to track. And, not to mention, who knows if all this like sodium and potassium and things disappearing from the medications might not make some of those other hormones pretty extreme. I mean, I think we can all agree it's about balance
right, right.
between, blood levels and hormones and everything. If anything is out of whack, then we definitely have a lower threshold for seizures.
So I want to go back to something. I did. I have heard of um, OB. I thought it was just OB. I've been told OB. I've heard that a few times, but I didn't know what the GYN meant. I've heard people say I'm going to go to the OB. So you got me there, Reese. I should have known that, maybe just the slightest bit. But I've always heard it just be I'm going to the OB, not the GYN, and I still forgot what the specifics were to that, what you said earlier. It'll come to me, maybe, maybe not. Um, but yeah, sorry to keep this in the catamenial part, but it made me want to ask something else. Um, about the time of the month thing, is it like specifically like you guys are stressing or you guys losing too much blood that time of the month, or is it just it's just I'm having this time of the month? That part I didn't understand. Like what specifically causes that? Or is it for everyone who has to go through that time of the month? I might need a doctor. A female doctor. Come on, females. I really don't understand it. Like, does everybody go through this? Well, I
No,
mean, female wise.
no,
So it's like specific. Uh,
yes. It's a unique form of epilepsy, just like any other epilepsy, like Dravet's or Dunes. Um, it's just a very unique form of epilepsy. And I remember Dr. Rovner, my other favorite neurologist, he said it's literally a phenomenon. And it doesn't always occur during menses when you're bleeding. It depends on the part of the brain that's affected by the particular hormones. And the hormones for a woman change almost on a weekly basis during the month because you have like the post menses where the uterus is rebuilding that lining, and then you have ovulation, and then you have what's called the egg drop. It's I can't remember the name of it, where that egg goes through the fallopian tube, and the hormones are different so that that egg can be fertilized. So, and then the hormones change again when it isn't fertilized, and it's time for you to shed that lining and go into menses. But not everybody has the seizures at the same time. Some will have them on ovulation. Some will have them on, during menses, or during that. And I know there's a name for it. Natalie would kick me, but during that time when your uterus is rebuilding that lining, um, all the hormones, your hormones are constantly changing, And it just depends on what part of the brain is being affected by those hormones. And it makes it that much more difficult to diagnose and manage because it's so multifaceted. But catamenial epilepsy, like you said, Kate, they just say, just keep yourself safe for those few days. That's really all you can do. Um, but I want chocolate. But yeah, I saw that chocolate cake. I want chocolate. But yeah, I don't completely understand it, but I get where it's coming from because my seizures were more noticeable during pregnancies than they were any other time. Um, and I started with just focal seizures that were almost unnoticeable, but during those pregnancies, and my doctors told me then, it's the hormones, you'll be fine, and they weren't going to put me on medication during a pregnancy for sure. But it's all based on the changing hormones, progesterone, estrogen, they're superpowers. And, you start, when they start changing, your brain responds. So if you're susceptible, yeah.
Did daughter tell you that some women can lift like superheroes during that time?
She can. She can. She's under
That's
five.
brilliant.
She's under 5 foot tall. I call her my tiny ninja because she
Oh,
did what do they call it? An Ironman marathon.
wow.
And just yeah, I still get goosebumps watching her jump over. I have pictures and videos watching her jump over this flaming column of yeah. She had to get a running jump and she's not even 5 foot tall. And she cleared those flames like they were nothing. And her dad was there and he's like, you should see these people watching her. This is the best part. I love watching this, but watching the people watch her because she is a tiny ninja. And I'm 4'10, I think she's 4'11, but she can deadlift twice her weight. And
That's
yeah,
amazing.
and she's a personal trainer. So she does it right and she can teach you how to do it right. And resistance training and weight training is a woman's best friend for preventing osteoporosis. So keep that in mind. And I can't lift much, but where are they? I do have tension bands, um, which I'm not supposed to use right now because that thing. But yeah, just something this simple and doing this, and I'm actually activating some of my pectoral muscles that are
Stop
supporting
it.
my shoulder. I'm not going to
Don't do
stop.
that.
I'm not going to stop.
If something snaps on camera,
It already
we're not going to be
did.
happy.
I thought I told you guys what happened when I went to see the surgeon. He said this is once in a lifetime. He ruptured the tendon because it was so frayed. His thumb went right through the tendon when he was manipulating it, and he just did one of these. He's like, all right, yeah, we have to reattach that. So yeah, I can't make it any worse right now. And
Talk about timing is everything.
the only thing that gets worse is I don't know if you can see the lump through my chub.
Yes.
See the lump?
Yes.
Because this bicep is no longer attached to my shoulder. It is only attached to my elbow. There are two tendons. I tore one and he accidentally tore the other. So that's when it was like, okay. And the muscle instantly like curled up. So that's why we're going to tape it to give the muscle a little bit of a break so I can keep moving that muscle because it has to be supple and flexible next week so we can pull what's left of that tendon back up, or we're going to have to take some of it from my hip. I don't want to do that. No. So, yeah, we also talked about the There's synthetic tendon and cadaver tendon. I have some of that in my knee. So we're ready for whatever. But I can't make this any worse. My rotator cuff is fine. The tendons are already popped off, Kate. It's already disconnected.
So cool.
That's why I'm like, so you're telling me I can't make this worse? Well, but you can fix it when I get there. So I'm still going to mow the lawn. And that was the orthopedic surgeon. But the epileptologist is like, no, you're not. I don't want you doing that. You shouldn't be driving anything. And I'm like, dude, chill. It's a lawn tractor. Well, okay, but I don't like it. But it's I think I know enough to be careful. I know when I'm feeling kind of funky. I've parked the mower a couple of times, cleaned it off as if I'm going to put it away because I'm not sure, you know. But after an hour or so, I'm okay. I'll go back out and finish. But it's been crazy hot and humid here and no rain. So the grass is barely growing. I could skip it until probably next week, Tuesday, and get it done. But yeah, I can't make this much worse.
Come on,
It's
you guys just spray something for the crabgrass and please put it off.
Yeah, I was looking at that. I was. I have a half acre, Kate, and to put down what's called a post-emergent herbicide will cost me to do it myself over $500. I can have,
Ouch.
yeah, I can have what's the lawn company, whatever, green lawn, whatever. They can
Yeah.
come in and do it for 7. So I'm like working this out with the homeowner. And I'm like, if you want it done, I'm going to have to ask you to get it done because, you know. So, but that doesn't stop it from growing. Um, so I still have to mow it. It's not a big deal. My daughter keeps saying, "Oh, I'll drive the mower." I think she's maybe gone 500 feet so far. She's yet to drop the deck. She hasn't done any of that yet. And she's like, I just don't feel comfortable. Well, neither did I. And I'm gonna make you do this just in spite. I'm gonna make you do this.
Well,
And we
whatever
have
takes place, you will save your receipts.
yes, yeah, whatever I do. But the crabgrass is gonna keep growing, everything else is gonna keep growing. I have to keep it. I take pride in my garden, but this year you can tell that I haven't been out there. My neighbors have even mentioned it's like, what is going on? Well, you see, I kind of messed things up for myself for this year, but I should be fine for next year. Um, yeah, getting more
Well,
attachments.
I took pride in my job, and they
Same.
haven't fired me, but they've completely squeezed me out, so I'm not doing anything that matters anymore.
Yeah.
So that's cool. I mean, I I didn't want this to just be a Reese complains session, but
You're in a safe place, love. Get it out.
Yeah, we're here.
they I don't want to give the specifics because this, goes online. But I'm not doing what I used to do anymore. They pushed me off the team, and now they're
Mm,
just trying to give me small projects so I have something to work on, and I'm just doing tiny things that don't matter, and I'm just feel like crap.
Yeah, I get it. And I don't want to make this sound dismissive, but hey, at least you're still working at some capacity. But I get it. It's like I want to be back to what I was doing, but I know myself, I could never, at least not now. I could not do what I used to do. And especially nursing. Um, yeah, I don't think I could have been doing that. But going to something different is as minimal as it sounds. A call center for when they were creating Verizon from Southern Bell and GTE. We had all those customers that had to switch over to Verizon. And we were giving away free cell phones, all this awesome stuff. And first I was customer service, then I was team lead, then I was manager. I moved up pretty fast, but now I don't think I could do it. We were, I know this is off topic. We were at Harbor Freight last week, over the weekend, and this guy came in with a product he wanted to return. And he was giving the cashier a hard time. And we backed off because we weren't going to leave the store and leave her without some support. And so we all backed up into the store just to hear this out and make sure she was safe. I commend her. I would have lost it. And it turned out that he purchased the item online. He wanted to return it. He got the refund and was told to return the product to a physical store. But he wanted another refund. And he was like, how could I have returned it if I still have the item? And this was his third attempt at doing this. And this woman was handling this situation so calmly. I was like, no way, no way. I would not be able to do that. I was so impressed. And I realized I was doing that every day. I was dealing with people who were screaming at me every day. Never fazed me then. But now, I don't think I have that kind of calm anymore. I was like, we all wanted to grab him and drag him out of the store. He was just being a total ass. But yeah, I wish I could go back to work, but I know that I can't. Um, and the closest thing I'll get to driving again is my lawnmower. Okay, so
But that is Anne's prime example of the perfect rationale, like way to still see the positive side, appreciate what you have accomplished and what you can look forward to, so you don't even have any time to focus on the negative and feel all those boohoo feelings.
yeah, been
Another thing
through
about
that.
those catamenial seizures, I don't think anybody ever told me until I asked the OB, if I'm living with another female, why do I have more? I feel like my threshold is lower when she's on her cycle. And they said, "Oh, you never knew that? When you live in the house with another female, that actually influences your hormones as well. Same thing, an estrogen progesterone thing.
Hmm.
So that's something that I think anybody with catamenial seizures should be aware of.
Wow.
Because, like you said, it doesn't happen a lot of times actually during menses. It could be any one of those other weeks throughout the month that,
Yeah,
just depending on what side is, what part of your brain is weak, might be more likely to have a seizure."
yeah.
I
I
got
don't
another
think.
question for the ladies. The ladies other than Anne, um, when she was speaking, um, being that she's a boomer, did she teach you guys? Did you learn anything when she was talking? Something you did not know that she said. Did you learn anything from an OG?
The different stages of menses. I didn't know the egg. I thought egg drop was like a disease. I didn't know that was part of what she was talking about. But hey, everything has to take place. So thank you for shedding light on that, and in a
Okay.
way we can all understand.
Okay, because I was thinking I learned a lot, but I was wondering if you ladies had took in anything that she said because I learned a lot. So Yeah.
This is
Yeah,
why I
no,
want my
I
daughter
didn't
here.
know
Yeah.
that either. So thank you.
Okay. Um, I got something here. It says newly diagnosed need advice on JME Kepra, driving restrictions and what comes next. 27 years old, and I was recently diagnosed with epilepsy after an abnormal EEG, and doctor suspects it's juvenile myoclonic epilepsy, abbreviation JME. But I haven't had a full evaluation yet, just the EEG so far, and they're scheduling an MRI before my next appointment to get a clearer picture. I likely had this for years, maybe 7 to 10 years, but I didn't realize the jerking twitches I was experiencing was a seizure related. I had frequent myoclonic jerks, mostly in my head, left arm, and left leg, especially when I'm tired. But I've never had a tonic-clonic grand mal seizure, and these jerks never happen when I'm waking up. They just started me on Keppra, not sure if the exact dosage yet, but everything I'm reading while online and side effects, especially mood and personality changes, has me a little worried. If you've taken Keppra, I'd love to hear your experiences, positive or negative. And if it had issues, how have you managed? For anyone with JME, do you go years without realizing your symptoms were seizures? Have you ever had tonic-clonic seizures eventually, or has it mostly stayed myoclonic? What medications worked for you, at least the side effects? What were your driving restrictions like in your state or country? How did you handle transportation in the meantime, and how long until were you at clear to drive again? I live in a state I legally can't drive until I have seizure free for 6 months straight, and that's probably affecting work and family life. I work tonight. I work night shift, and reliable transportation is a challenge. My job might move me to the day shift, but I'm in limbo right now, trying to figure out how to manage everything. I would really appreciate your answers. Um, Personally, I don't drive or have JME. Um, yeah, I haven't had myoclonics that I've picked up on yet and put together the pieces. I've had some seizures that have some unexplained reasons that I got to talk to a doctor about. But so far, I was having focals and tonic-clonics. So, anybody else having myoclonics? I've had some jerks that were bad, but they rarely happen. I've thrown some grease across the room on accident. Yeah.
Anything that's happened on mine, I don't remember myself, so somebody else has to tell me that I was walking with something when it happened and that maybe didn't drop it, but it looked like that arm went out first and ended up throwing something. But I don't really have jerks outside of when the seizures already started or if it's a cluster.
I've been told to have jerks when I was younger, but I was already unaware. So, the only ones I can think of is when I'm about to go in the clusters, and yeah, I'm spraying the nasal already. I'm not waiting for them to start.
You can nasally
And
him yourself.
oh yeah,
Hmm.
trust me, Pookie, you do not want to experience 6 hours.
Uh, didn't know that. I have some, but they expired in what's it called? May.
Yeah,
Had them for
I think
years.
I think they can refill them or
Uh,
something. I heard something. It's
Being
like
that I
they,
don't necessarily have auras or anything that picks up on me having a seizure, um, that's why it's still sitting here because
yeah,
I can't do it to myself. And
yeah. I think you can take them back and or send them back to the company or something like that. I was told something.
okay, yeah, I've had these a few years, so that's why they're sitting around. And did you have something to say?
Not really, but I was wondering if you have any rescue meds at all, like that somebody else could give you, or because I know you don't get,
Somebody like
or
who?
like even just an Ativan, but you don't even know when you're having your seizures. I feel lucky, right? Angel, I really do. I feel fortunate that I have a warning before those awful tonic clonics will hit me. And I haven't had one of those for quite a while. But yeah, I mean, do you have anything? Or, and would it matter because you don't have the opportunity to give it to yourself?
Right. I have nasal in, but you can't do it yourself when
When you're
Yeah.
out? Yeah, yeah.
hands
And
don't even want to do that. But I found some.
When
I was
I
reading
think it was
something
the
just
first.
a few days ago,
Oh, I'm sorry.
and oxycarbazine. Ever heard of that?
Oxycarbazine is one of the family of Tegatrol and stuff like that.
Why do I have
You must
it?
have-
It looks like it is available in an immediate release and an extended release form. So maybe that could be a, maybe not a rescue med, but that makes a difference. Depends on what kind you have and see if you can go back to notes from the visit when that was prescribed. That might tell you something.
I'm just wondering why I have it, and yeah,
check the date on it. Maybe you
oh,
were.
the September 2023. I definitely don't remember that. It says discard after 2024. I don't even know why I have this. Then some Kepra from last year.
Yeah, I would just discard the Tepra.
This one's from 2023, and this one's from 2024. Yeah, they both expired. Can't you take those to like CVS where I got them from? I think I seen this bin that said something like return pills or something, but I'm not sure.
Yeah, yeah, they have those bins there. Or you can also take them. I don't know because they told me when the bin is full, you can also take them to the police station.
I don't like going to the police station, so that's
Yeah,
out.
I'm like, I'll just wait till the bin is empty next time I come to pick up my meds.
Yeah, that is on my favorite list.
yeah,
Um,
we have them any hospital that has a pharmacy, which means every single hospital usually has a drop-off bin. So I that's what I do here. And a couple of years ago, I was hanging out with my neighbor and I ended up having a seizure. But before that seizure, she had all kinds of stuff she wanted to get rid of. And the next day, I was going to the doctor who was at the hospital. I'm like, well, give them to me. I'll take them. She had hydrocodone that was like 8 years old. I'm like, just flush them. But okay, I'll take them. So I had them in my pocket. When I had my seizure, the
Oh,
EMTs are calling me Gabrielle. And I'm like, what the heck? I'm coming out of this seizure and I have no idea who they're talking to. And well, why did you have this medication in your pocket? And I'm like, oh my gosh, that's not mine. And they were like, well, we're going to have to report this. And my friend said, this is what happened. She's going to an appointment tomorrow. She can put them in the drop off bin. They took them for us. I'm like, I'm not going to use these. I can't take these drugs without the help of an epileptologist that I trust. Um, so grateful now. But they thought that she was giving me her stuff and I was abusing the drugs. No, I was going to take them and throw them out. But they did it, whatever they did. For all I know, they went home and went on a bender. I don't know. But I know I wasn't planning on taking them. But our hospitals here all of them have a drop-off bin. So I don't know why you can't just take them to pharmacies here. But Pookie, you got lots of drugs you haven't tried.
Yeah, I got a lot of pills over here because
I see that
I
stacking
have
them up
problems with my hip as well. Yeah, from the car accident,
from the
from the
car
hip.
accident. Yeah, dude.
But I don't like taking pills, so I take the ones that I have to take, and these are just stuff that wasn't mandatory. Pain pills and sleeping pills that don't work, and I don't even know what Prilosec is for, but um, yeah,
Holy shit! It's time to get rid of that.
right. Ibuprofen. I got so much ibuprofen. I know. I hate taking pain pills, so
I don't.
Prilosec is
I
for
don't even.
heartburn.
I just fight through it. Oh, that's what they gave me that for.
I don't even touch pain pills with my seizure meds.
These.
Yeah, and I have to. I have to. Next week,
I know you have to.
yeah,
Yeah.
I had
Okay,
my
yeah, these are still
toenail
good pills.
had my
Thanks for
toenail
pointing that
pulled
out.
out, and
Mm.
my doctor gave me hydrocodone for the toenail, and I'm like, I don't know about this, and yeah, so I had to call my epileptologist. I'm like, how do I do this? Because this pain is real. Okay, it's like dropping a can of crushed tomatoes on your toe. That's what it feels like. So I had to have some pain medication, and I didn't want to take it, but I needed them. And I have to confront the same thing next week. So we're talking about what kind of pain medication would be better than hydrocodone or safer. So, but yeah, I hate taking pain meds. It's like, just get me a bottle of bourbon. It's just as dangerous, but I'll enjoy it more. I'll just be happier.
I can just lay down and smoke, and it usually goes away.
Can't
Because
I can't do that on Xcopri anymore.
you missed it last week. I
Oh,
was going through some issues.
yeah.
Yeah, um, I had to get up and walk away several times.
Oh,
I couldn't stop my eyes from watering like I was crying. Kate, explain because you were here when I was going through that, right? Um, Brandon, see you. I couldn't do it. I felt like giving up.
Yeah, so not to remind everybody, but I can't give you any specifics on like how many times you walked away, but that's definitely what started catching our attention was when your expression. Your expression just didn't look the same. And that's when you did kind of come back and tell us that something happened and we were all just watching out. Everybody was typing in the chat, and I think Sailor Mom was probably the first, or maybe Sia was the first one to actually call out to you during the meeting, but you're
I think
doing
when
with
she
all the
asked me that, am I okay? I said no. Um,
yeah.
yeah, I finally kind of understood what that impending doom feeling was. That's what I think I was going through. It was like,
Oh,
feel like something is going to happen. Why is nothing happening? And why do I feel like this? And should I leave? And I was going through so much at the time. And I think I know what an aura is. Is that what an aura is? Because I don't know what I was going through.
it
And
sounds like it.
yeah.
yeah, I felt nauseous and I was just like, what is going on? I kept going out of there to go figure out what is going on. And I don't know why I even left the room, but I was just walking in and out of the room. um, but
Yeah,
I went and
same
got
here,
this
Pookie.
and yeah, I was like, let me make a call. Let me go get a pen because I didn't have weed and this helped. And as soon as the nausea went away, I was back. Go ahead, Toaster. You were here. Can you explain? I think you were here. You're on mute.
Mute toaster.
Oops. That was an accident. I was on Reddit. I wasn't in the chat that day, but I remember you saying impending doom. It's like the sky, Earth, universe, all of its array is going to just go poof. And worse, it's going to come down on your head. That type of feeling?
Yeah, it felt like something that was obviously going on. In the part about the obviously going on, I think I was more irritated that I could not figure what's going on. That was the odd feeling, like what is going on and not knowing what is going on. And I started sweating and having hot flashes. I couldn't sit here
That's
anymore. I kind of
hugs,
walked
brother.
away.
Hugs,
Yeah,
little
I was
brother.
feeling all clammy and stuff, and I was like, "Yeah, something is going on. Time to walk away."
That's when you need a rescue med, like Ativan. That's when you pop an Ativan under your tongue,
Yeah.
bro. Even if it
Or you
isn't
pop
a
your
seizure.
nasal.
Yeah, yeah.
I think
That
the weed
very well.
helped. The weed did it for me.
That's good. That's good. I have to be careful. I'm still token up, but oh, I
I
don't
don't have any problems with weed and Xcopri.
know. Well, I'm
No.
still titrating.
And my
So,
neurologist does know.
yeah, so does
So,
mine.
yeah,
Yeah.
okay.
And he's like,
Mine is
well,
fine with it.
yeah, he even knows I use psilocybin. And
Oh,
yeah, very curious guy. He's like, I want to know more. So I gave him the links to the people who helped me with all of this. And they're called Unlimited Sciences at Johns Hopkins. And they're sponsored by Realm of Caring. And they study cannabis and psychedelics and how they can be used. So, it's
that's
like,
awesome.
trust me, I will not take too much of anything, especially after yesterday. And he just started laughing at me. And I'm like, that's not funny. Okay. And it just made him laugh more. And I'm like, okay, I'm hanging up now. And this is one of those things where it's like I feel so much better with this doctor because he's real. He said, well, you do what you want, but I would definitely avoid that pain. I'm like, I guess I have to choose between the pain. Do I want my shoulder hurting or do I want to be puking? Um, yeah, yeah. I don't want to throw up like that again. Oh God, no. The worst hangover of my life. Okay.
Okay, sorry for being such a bad host. I was going through something. Um,
I got something lined up here. It matches up with what we were just talking about. Somebody saying, how long do your clusters last if you don't take your rescue meds? So this person's doctor, they says, my doc is forcing me on a benzo break because my FAS clusters started happening weekly after a bad change of SSRI and my clonazepam wafer stopped working at 2 milligrams. So now I got to toughen the clusters out alone. It's been 5 hours, then 4 hours sleep. Then they started up again after an hour of being awake. I was hoping sleep would stop them. Apparently not. How long do clusters last? Wow. So is anybody else hearing like the doctor's trying to kill them?
no, a doctor. Yeah, I don't have a neurologist right now, but my doctor, he's pretty nice. Pretty cool dude. He's funny. He's really funny. Really, really funny. Um, yeah.
Okay, so this person's doctor might actually be telling them to stop taking the meds for the right reason. If you just think they're not working. But for somebody to not have any rescue meds and they definitely are having clusters, that's where it sounds like that doctor stopped short.
When you said
Because
pills not working, I had those pills that my doctor gave me for sleep and they weren't working. That's why I stopped taking them. So I mean, I understand if you got something, you're just taking the pills, just getting the side effects basically. It's not doing any good for you. I'm not suggesting anyone stop taking their pills. Let me throw that out there. I'm not a doctor.
and you speak for us all. One of the comments is saying mine would last about 30 seconds and then go on for 2 days. They'd go away for a month or two and then repeat. So maybe some people really do just live with these clusters. 30 seconds at a time, but for 2 days,
Right, twin?
that's
Yeah, what was your
stopping you.
longest cluster or prodromal phase? If it's more than 24 hours, they call it prodromal.
Okay, so what if I had a day that I don't remember?
I don't know. You could have had a seizure in the morning. I don't
No,
know. That could have been a focal
no,
cluster.
but I left, and I remember that. So that's what I'm trying to see, like how long could that be? Because there was parts of the day where I was cleaning up and bits and pieces I don't remember that. And then I remember showering and I remember everything during that day being like, why am I doing this? Where am I going? And yeah, I remember going to the street to the curb out front and then I remember coming back. I remember passing the driveway right here to come back. Uh,
Huh.
yeah, and then someone else told me that day or whatever. He told me that was the day I walked in the store and I was kind of just walking around the island in the store until he said, "What's up?" And then he said, "What's up?" Is when I said, "Shut up." And then I walked out. I don't remember any of that. Um, I remember the walk back though, because he also told me what I was wearing. And that's how I remember that. And I remember some of that day just being weird, like, what am I doing this for? Why am I cleaning up and changing clothes and I mean, cleaning up is normal, but I was getting dressed like I was going to a concert or something. And yeah, didn't go anywhere but to the smoke shop and didn't get anything because I don't remember going there. Um, so yeah, I don't even remember the reason I went there just to look at stuff.
Yeah, so take
Yeah.
notes. That might help if it happens around the same time of day on a future date. Try
Yeah,
and
that's wild to
correspond.
me that it's a whole day, but I have had one experience where I talked to someone. That sounds dramatic. I got up out of bed and went to the bathroom, and then went to my roommate's room and said hi to my roommate, and then went back to bed. That's the only time I've ever gotten up and walked around. So, like, having a whole day of that and walking all over that, I can't even imagine. Because it's wild to me that I even did that much walking. So, I don't know. You're impressive.
Yeah, plenty of fun.
Yeah, my longest cluster, it was 6 hours. I my baby was one, like going towards the two, and she woke up in the middle of the night. It was like 4 a.m. and I gave her milk that was in the fridge, and then I put her in her playpen, and I was getting my wife's stuff ready for work. And next thing you know, I can't control my body or anything. And I just start seizing and seizing. And they tried, like, my wife asked me, I couldn't answer. I don't think I remember if I could answer anything, but she asked me if I'm okay or something. And it just went on. Like, I know they eventually got me into a bed, but yeah, I know they tried to give me my bin pad again and stuff, and it was just like it wasn't stopping. That's when I first started clonazepam. They had to give me the dissolving pill to stop it. Like,
Oh, yeah.
she actually had to feed me.
Oh, wow. Yeah. The Ativan. I know. I had to have a friend take care of me for like 3 days after. Yeah, I had an L. It was one of my LTMs. I was in the EMU, and they kept coming in. Did you feel that? Did you feel that? How are you feeling? And I'm like, I have never. It was like the fifth time I did one of those, and I'm like, I'm okay. I'm just feeling, just like it's one of those days. And when they finally said, you've been having like low grade focal seizures for 32 hours. And I ended up going into the TC, and then I went into status. And the only thing I can say that was good about that was it happened in the EMU. So, but that was like, now I know what that feeling is. And I'll get like the mood swings or almost a personality change sometimes. My son and his girlfriend, they know my brain better than I do. You know what I mean? So it's like, yo, where's your medicine, mom? Because they see it before I feel it. But I didn't even recognize it until after that EMU. I'm like, so that's what this is? It's not just me being moody and I need medication for some mental health issue. No, this is your epilepsy. Oh,
Yeah.
oh, good to know. But yeah, I see Allison was asking, I didn't even know what it was until it happened in the EMU. And I can't, you know
Yeah, my
how, like at the
first
moment,
vocal
yeah,
aware, I didn't know either. I was like,
yeah.
what the hell is going on?
It's like, what are you guys talking about?
But
Why,
did the memory loss ever kind of help the diagnosis for you guys? Because I think that's what led the doctors to help me understand what focal awares were. Because even though the cameras, whoever was around would say that I was only out of it for a few minutes and pretty much came right back, that would wipe out 3 hours before that. I would, still think it was like 7 in the morning, and turns out it was late morning.
oh, yeah,
So yeah, and I think that's what led them to the hippocampus too, saying, because I told them so much about memory being an indicator of what kind of seizure I had and how bad it was.
yeah.
And
And where too,
yeah,
that makes a big difference. Yeah, no, my memory didn't have anything to do with my diagnosis. It was the clinical, yeah, the stuff that they saw in the EEGs. And yeah, I'm like, I learned so much from those. As much as I hated them, I learned a lot. And that one was probably my best. And that was with my best doctor too. So, but yeah, with the memory, that's a different part of your brain too. Yeah, you're in deep, Kate.
Even
and
know
that's
how it
why they
all
put the
works.
rods and not the surface electrodes.
Yep.
Today has been a rough day for me. With all the work stuff, I've just been having my spiral personally, and it got me to realize that I don't really have any memories around the seizure that gave me the black eyes. I don't remember the seizure itself. I don't remember coming out of the seizure. I don't remember directly after the seizure. I'm not sure
You don't know what
where.
you were doing before the seizure.
Yeah,
Yeah.
I'm not sure where my memory comes back really after that seizure, and so then I started freaking out and having a panic attack, because I don't know. I don't know. And yeah, that's I have a lot of memory issues, and I don't know if they're just around seizures or if they're in general. I just, yeah, today's been a rough day.
when you say like your memory stuff, it made me like think my memory is really bad too. But there's certain things that can make me remember stuff, and it's like when someone says something else. Suddenly, all of a sudden, I'll remember something I had in common, a story that I had in common to do with that. Memories come back easily like that. But for some reason, when I try to think of what happened, I'll be thinking of that for days and weeks. And then someone will be like, "Oh, well, we went to this store," and I was like, "Oh yeah, that's what the memory was. I went to that store and I seen that you were talking about already. And earlier you asked me, and I said no." Yeah. So yeah, that's how my memory works, Reese. So you're not alone, Reese. Memory is just
Yeah, no, they have this weird program that they're working on, like a school somewhere near one of the hospitals near where I live that they had me work with that is involved with people who have epilepsy, and it was supposed to help with memory problems related to epilepsy and coming up with strategies to help with them. But like all the strategies were just like writing a million things down and repeating things over and over. And it's like I could have thought of that, you know. And it's not like they're saying they were going to tell me things that I couldn't have thought of, but it's just, I'm just in this place where I'm like feeling weird and concerned that I'm having so many memory problems like this when I'm this young, and I'm just scared about if it's the medication or the epilepsy itself or this cyst. I don't know what it is that's causing it, and I don't know if there's anything that I can actually be doing to fix it. I don't know. Um, I don't know. But for what you said, I can be talking with people and they can bring something up and talk about stuff, and I'll just be sitting there like I don't fucking remember. So that's where I'm at.
um
Accept the bubble headedness. As soon as you can accept it and laugh at it and find people around you who will laugh with you, you got a good support system.
okay. What you said when people ask you, you won't remember. Mine isn't usually when someone asking me a question, because if someone asks me, I'm not gonna remember right then and there. But when someone else is talking about something similar, that's how my memories come back. Because I'd be like, oh, I have something similar that's happened like that too. But otherwise, yeah, if you ask me or if I'm trying to remember it, it's not coming to me. It'll come to me when I remember something similar to that, or been to that store, or been in that car, or whatever the case. But
Yeah, it's just Toaster, you make a good point, and I need to get there, but I'm having a hard time.
Oh, oh,
someone
oh,
told
I'm
me try
working on
wait,
it.
wait,
Sudoku.
wait. I need to continue. Don't get me wrong. This fucking sucks the entire way. And it's so bad that you're going through this. Going through a move. I just got done with that. And holy shit, is it hard. That plus you're going on another surgery? That's just even tough tough times don't last, tough people do, and I know that you're one of the tough ones.
It means a lot. That really
You've
means a
proven
lot.
that so far. That's for sure.
My gut is to say no, you're wrong, but it means a lot that you say that. So we'll see, I guess. I mean, I'm doing what I can. So
Right, I got something here. It says, "What can you tell me about nasalium? I've never heard about it until today. I sent my neurologist videos of a seizure earlier today, and in addition to doubling my lacosamide, I was given a prescription for nasal spray. The regular cost alone will make it will make you take a step back. It requires prior approval at Medicare has it for a reason Medicare has it for a reasonable cost. My pharmacy does not have it in stock. That was my first known seizure in over 4 years. Scared to hell out of my husband, and it was suck ass that day. Can someone help me? Um, yeah, can someone help me? That's all there was. What can you tell me about nasalium? Never tried it, but I can tell you that it's white and
It's a
comes in
benzo.
a. I can tell you what the packaging looks like because I have the packaging. But anything else past this, I have nothing for it at all.
Be prepared to have somebody else to administer it. And if it actually works to stop the seizure, then just keep telling yourself it's worth how much it burns and everything tastes bad after for a while. But
Yeah.
otherwise, you would have been having a bad one. So just be prepared.
Yeah.
It will make you really, really, really tired. Just like the rest of our medicines. But
I thought this is like bring you back. It makes you tired.
Doesn't do that to
no, it
me.
makes
If I have one of those on the second seizure, because sometimes I've been trying to tell everybody not to give me the nasal M unless it looks like it's going to be a cluster. So I blame the sleepiness on the seizures. I don't think it's that's
That's interesting. It says do not test or prime before use. Interesting. Okay.
yeah.
Any bad nasalium stories?
No.
Any good nasalium stories?
Well, I was saying I think I felt my first aura in the chat earlier. Um, it feels like a what you call it, like electrical activity going right here through the middle of my head, and it goes all the way through like I can feel it touch my spine, and I'm like, that feels vaguely similar to the cluster I had, my first cluster, the 6 hour one. And I'm like, I was aware during that, and I do not want it. So, boom. I rather save myself that trouble of going through that than face that, you know, put that trauma on other people.
Angel, I think you're frozen, or is it everybody? Can everybody hear me? See me?
we're good. Angel
Did
was
I
gonna say,
breeze?
yeah,
They
I can hear you,
hear
but we
and
can't see anything.
Right. I got something here. It says Kepra. I just started Kepra 2 days ago. Half a tab twice a day, 500 milligrams in total.
Okay.
Anyway, I keep seeing people making vague posts about how terrible Kepra is, but when I ask details, they don't answer. So, someone please explain. Should I be worried about this pill? I had to switch from lamotrigine because that was giving me a bad rash.
Keppra is the go-to medicine.
Gold
And
standard.
yes, the gold standard. And honestly, I think there's a reason for that. Maybe I've just not met anyone who has had good experiences on Vimpat, not Vimpat, Keppra. So that's Angel's connection is being sparky. And now I've totally forgot where I was going. Oh
Kepra,
yeah,
your
the Keppra.
experience.
Yes. The worst thing that I ever did in my life, I did when I was on Keppra. I was put on Keppra um, soon after my youngest son was born. My oldest um, s- stepdaughter was probably about 15, I think, and she was helping me. I would not have survived without her, which is terrible in and of itself, but I will also blame that on her father. Um, but we would not have survived without her help. She was helping me. We were doing something in the kitchen, and I remember just getting angry. It, l- Hulk smash type of thing. Just literally turned green, and I shoved her. People who have met me know that I am someone who really, there's a reason why I love this group because you're online. When I actually do hello, you're right there in front of me, I am terrible. But this gives it gives, I don't know what it is. It's just a veil that I can just, it's great. And I'm going off on a tangent again. I'm sorry. What was the question?
Kepra,
Deborah. Oh, oh yes, 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 my daughter. That that was the worst thing I ever did was push her, and it was on Capper, and soon after that it was changed. Don't ask me what because I don't remember that part.
I don't remember my Kepra stories because I was 16 or 17, somewhere around there. Angel always tells me his Kepra stories. He didn't like it. He got off of it.
Yeah, I remember the end specifically. I know they pushed it up. I kept having seizures, and they kept pushing it up. They pushed me up to 4,000 milligrams a day, and I just, it was so hard because I was working in a warehouse, and it was like you could feel, I knew it was, I'm like, I knew there was anger building in me, and I'm like, why is there anger building in me and stuff? And I didn't know why or anything. And there was like, if I had my Galaxy Note from then, I probably could remember all my notes that I put down from when I was taking Kepra. But yeah, and then I think when I started having like health problems besides my seizures, I was having, I was trying to figure everything else. I was having seizures and everything, and the doctor just wanted to keep raising levels, and it wasn't working. It wasn't holding back seizures. They were coming back faster and faster. That's what I like, look, they're coming back faster. they're ramping up. The Kepra's not working. It's like it basically raged off, I guess. And he referred me to my current neurologist, which I like.
All right.
Turns
So
out it makes
glad you
all the
found that good one.
difference to have doctors you like. There were times when I was like, I don't care. They just prescribed stuff I need, whatever. But turns out it really matters. I had a few doctors who I didn't like, and that was problematic. But the doctors I do like, having a psychiatrist you like, holy shit. My current psychiatrist is insanely good compared to my old ones. My old psychiatrist, I mean, I know this isn't about psychiatrists, but I'm just saying, like, holy shit, when you have a good psychiatrist, that shit's insane. So, yeah, good doctors. Wild.
So some specialists you want to get along with more than others, especially the ones that aren't like physical symptoms you can prove and not deny. So this one is Allison's post about Kepra. When I first started, my head felt so clear. It was amazing, but it did start to creep in over a couple months. Some people are right away rage, and some people are fine for life on it. For me, it wasn't like normal anger. It was a head pressure rage I couldn't control at all. If you're not hot-tempered like that to start with, then it's the Kepra. I felt anger and slight annoyances that normally wouldn't even bother me one bit, and I'd completely fly off the handle. I learned quickly when I felt the pressure rise in my head and my neck get hot, I had to back away from a situation immediately, even if it was something really mundane. Multiple times I would back off and run to the bathroom at work when a customer says something that looking back wasn't anything out of the ordinary at all. Thankfully, I had a coworker know what was going on and took over. Of course, there were irritating customers like always, but even the nice ones just asking questions that were tiring to me. I had to depart. I yelled at my kids so much. One has PTSD from it, and we are doing therapy. Now, if I raise my voice even a little bit, he's scared. This was all only over a year on Kepra and its sister med Briviact, which helped the pressure and rage lower but didn't go away. I would say watch for situations like that. Try to discern between fatigue or rage if you're feeling grumpy. Some are grumpy on it. Some people do get tired on it. I actually felt energized, but not necessarily in a good way. Looking back, I was an anxious wreck. Just keep in mind how many are doing wonderful on it and how many has been their life-saving medication. I would say if you tried Briviact and didn't do well, then you likely won't do well on Keppra either, as they do operate the same channels of your brain. Thank you, Allison. Hey, Brandon.
Hey everyone, how's night going? Or day going? I don't know. Whatever time it is.
Let me go to the question before you start, Brandon. Man, that's why I should hurry up. Go ahead, Brandon.
We'll start with the icebreaker for you.
Yeah,
What do you find most appealing about this group? Or what's the most productive thing? That's what it was.
Most productive thing? Well, the knowledge and I guess also just spreading the knowledge. For me, that's the most productive thing about this. It's like I know sort of what my triggers are, and like I have my stuff pretty under control. So I just want to help other people.
Yeah, you're the Kepra success story. We were just talking about Kepra.
My like space bar temporary unmute is acting up. But yeah, I definitely had my moments when I first got on it, but now that it's been like 2 years on it, my body's leveled out, I guess.
Okay, that's what made me remember now. The lady was saying that she was yelling at her son and she was getting angry and stuff like that. I'm glad I didn't have to put my kids through that. I didn't have kids at that time. But I still might have had kids. But yeah, that I didn't yell at my kids. And
I
that could be traumatizing. I can imagine.
I will. I mean, okay. I've always had a little bit of an explosive personality, and that I've already had to sort of manage. So I think that's what helped is I was already working on, you know, that part of like what was going to be worse with Kepra. Um, and there are still times where I do like just start sort of yelling. But I've learned to only do it in certain moments where I'm sorry for my cats, but occasionally my cats get yelled at because I'm working with kids all day and I can't yell at them. So I bring those annoyances home. And so my cats get the brunt of it. Um, but usually it's just me in the other room, like just kind of yelling about something. But I don't take it out on people. I just sort of I need to get it out. And usually I'll go to the soccer field and just absolutely kick a ball within an inch of its life.
Um,
Yeah, I can see how those thoughts are pretty hard to suppress after a whole long workday.
Yeah, and I mean those aren't my kids, so it's like I'm sure it's a different dynamic where like Kate, you like obviously have had to reprimand your kids over stuff that they've done, and you do have more of like like the control aspect of being like their mom is like they do have to listen to you at the end of the day. But well, yeah, no, I know. But with me, it's like these kids can be absolute shitheads
And they
all
know
day,
it.
and they know it because they know that I'm at work and I can't do anything about it. And then at 3 o'clock, they get picked up and they get to go have the rest of their day, and they don't have to see me until the next day. And it's like, oh, I just want you to leave sometimes. I want it to be 3 o'clock.
Yeah, at least there's definitely no pressure of, somebody coming back and saying PTSD if you got to take a break with those kinds of misbehaving ones.
Yeah.
Yeah, but I
So
know all
there's
the other kinds of pressures. I've got a couple friends in the kid, I don't know what to call it. One of them's
And
in school, the
child
other's
education.
yeah, What age group do you
8 to
mostly
13.
work with?
Well,
What?
so it's during the summer it's 8 to 13, and then during the school year it's 11 to 12 because we work with fifth grade.
Oh, that's like right when they're like prime.
Well, and it's funny because in the state that I live in, all the fifth grade classes are in the elementary schools. Now, where I'm from in Mass, it was 1 through 4, 5 through 8, 9 through 12. So it was like 4, 4, 4,
Oh,
which that just made sense to me. But with Rhode Island, they do fifth grade in the elementary schools, and then they do 6, 7, 8 for the middle schools. There was one middle school that had a fifth grade that we went to, and those kids were clearly like a different breed because they were surrounded by the 6, 7, and eighth graders. You know what I mean? Where the kids who are in the elementary school who are in fifth grade, they end up being like, they already feel like they're top dogs, but they haven't been exposed to like the the older kid mentality yet.
Yeah.
So we have a little more control. We didn't even finish that program at that school. They were horrible. We couldn't do it. We were like, yeah, these fifth graders are like more like seventh graders who don't want to be here.
I can't even imagine. My friend who does actual school, the other friend does like baby, like toddlers essentially. But my friend who does like high schoolers, I'm like, I don't know how you do it. I could not. Like I could not. And especially me with the possibility of having a seizure, like I could not. Like dealing with their bullshit and having a seizure, like no. So
I have noticed that a lot of teenagers, like, yes, they can come off like, they have not a care in the world, and they don't care what you say, etc. If you can find a moment to really level with them and like let them know, kind of like, look, I am trying to help you, you need to let me help you, though everything can go smooth if we work together. And if you can have that moment with a lot of teenagers, they will respond well. And if you have a good group of kids, I wouldn't even be concerned if I had a seizure, because if they knew about my condition and they knew what to do, because obviously I would, fill them in, sort of thing, if they were old enough to be able to do anything about it. Um, I would fill them in what to do, and I feel like I could trust if I knew the group and had a good conversation with them about my situation and their situation and everything. So
yeah.
Hey, it sounds like your students are definitely learning a lot from you.
and now I'm trying to get away from that. Weird.
It makes me think about how difficult it is to find any situation where people respond correctly to you having a seizure. Like, even in a hospital, I've had a seizure where I wasn't supposed to, and people swarmed. Like, I was trying to get an MRI and I had a seizure, and people swarmed, and it's like my wife was just sitting there like, they have epilepsy, chill. And everyone like freaked out, and I didn't even get to get my MRI. I had to like reschedule it because they hurried me to the ER. And it's like, I didn't, I was just sitting, like, it was, I just, people don't know how to deal with people who have been diagnosed with epilepsy. Like, I, there was nothing that, there's nothing to do if a person has regular seizures and hasn't fallen and like injured themselves. I didn't need to go to the ER. And when you're out in the world and you have a seizure, people freak out because they're like, why is this person seizing? And that's annoying, but at least you're out in the world. You're not in the hospital where doctors should understand that it's fine. I mean, it's not fine, but like they don't need to rush me to the ER. Like it's so frustrating. So I don't know. I don't know what that situation would even be, if you would be even allowed to make a an agreement where you wouldn't have to be taken to the hospital if you had a normal seizure. But it's
Hey, it depends on convincing those who are going to be around you. Yeah, everybody who's going to be in a position to rush you to the hospital needs to understand that they don't have to and exactly why.
Yeah. And it makes you not want to go anywhere without someone who knows you and understands you. Because if you're by yourself, there is the risk of that happening. And it's
You should
it's just an ordeal.
you should get one of the bracelets
Mm-hmm.
that
Yeah.
that I thought that when Pookie went to go touch his screen that he was actually raising up his wrist to show his bracelet, but he was.
Hey, whatever helps to remind us, though.
Oh yeah, Angel. There we go. Angel's got one.
There you go.
Bracelets. Oh wait, I want to see. Hold on. Yeah.
Well, it's useful because you can put a message on it, so it's not just your personal information and like a emergency contact number. You can actually put the message of don't 911 unless, or just some kind of message.
No 911, no hospital,
Yeah.
whatever it takes. Like they can still call an ambulance because when people have called the ambulance for me and I didn't need to go to the hospital, I told them like I don't need to, and they were like, okay, we don't need to take you to the hospital, but we can still check you out.
Mm-hmm.
And they're not even asking for your like your information when they do that. So there's no like charge for it. Like you're not going to get like a health insurance bill because the ambulance checked you out. As long as you make it known to them that you don't want to go to the hospital, they can still check you out. It's just the ride. Literally, the second that you get in,
because it costs
they start driving. It's literally like once you get in and they start driving, that's when you get charged.
Good to know.
There you go. How did people handle seizures? Oh, actually, Lufa, the icebreaker. We didn't get you yet. Oh, maybe not the best time. Anyway, how did people handle seizures before modern medicine? I've been hearing someone talk about putting. Okay, go ahead.
I'll be right here. It's Taco Tuesday. We're going to the store.
All right, enjoy.
Go ahead, you guys, but
We'll be
guys,
right
I'm gonna
here.
take you with me.
All right, get me some tacos.
Enjoy.
No, I want
Nachos.
tacos. What the hell, man?
There you
want some
go.
nachos?
We all have tacos tonight.
So this one is saying, okay, heard someone talk about putting peanut butter on your tongue or something. Just wondering if any holistic treatments actually work. If it's going to pay for a holistic doctor, but it's expensive. I honestly want to cure this because I'm tired of any side effects. Also, one of my first bad seizures was because I smoked weed and crashed a car. I see Epidiolex. Has anyone taken that? And this one is saying that before modern medicine, epilepsy was handled by putting people away in an asylum and lobotomies. I would say that still happens.
Well, it was a big shift from you're seeing God to you need to go into an asylum.
Yeah. I don't think
I remember
there
when we looked up
really
the
is
history.
a holistic solution because there's so many different types of epilepsy and you don't know where it affects you in the brain or whatever. Um, like I think it works better. Seen and read it works better for children, but as adults, there really is no holistic as much as I wish there was. There's stuff, holistic stuff you can use alongside of it, but yeah, I recommend staying on your medicine.
I I wonder if it works better in children because their brains are still developing, so it kind of their brains will just form different pathways instead to sort of counteract. I wonder if that's why.
Adapting works way better earlier in life for the brain for sure. Yeah, it says the first medication that was actually effective for epilepsy was phenobarbital. Potassium bromide was the first effective epilepsy drug, not as effective as phenobarbital, but effective nonetheless. It was discovered in the 19th century by an obstetrician. So an OB actually came up with the first one, according to this post, who thought masturbating caused epilepsy. He was taking potassium bromide himself. I'm not sure what for, maybe for the sedatives. And he noticed it made him impotent. He then administered it to 15 of his epileptic patients. It stopped the seizures in 14 of the 15 patients and went on to publish his findings in The Lancet. Unfortunately, potassium bromide can have nasty side effects and it's difficult to dose due to its long half-life. No, never would have expected that. Yeah, they just
Did
keep
you
going
say
on and talking
basically
about
he can
history.
die from masturbation?
He said that apparently that's what he thought caused epilepsy. I don't know how that led to phenobarbital, but that might have had something to do with one of the first effective drugs coming from an OB.
Wait, but he tried it on himself?
Yeah, and that's what this post is saying. They don't know what for, but it caused impotence, so he ended up, kind of suffering the side effects.
Oh. He wanted them to stop masturbating, realized that the drug made it so he couldn't get hard, and then was like, "Oh, this is perfect. I'm gonna give it to them."
Oh, I thought that meant he was just like emptied out. Okay, never mind. I didn't know what that meant. Okay.
No,
Now on the other
impotent is like it just flapping in the wind.
Okay, good to know. Now this one here. Why is there such a stigma around epilepsy? A lot of comments on this one. Few people surprised when I told them because I guess some people think epileptics are cognitively impaired. You guys ever get that vibe that somebody has to find out you have epilepsy and then they talk to you different? Some other
Yeah,
people are saying, oh, go ahead, Dan.
I had that happen a couple of times, and I think the most revealing was when it happened in the beginning of my relationship with the cannabis community. They didn't realize I was a patient as much as an advocate. They're like, "What do you mean you need this stuff?" Yo, I have epilepsy. And some people instantly changed. Others, they were like, "Okay, um, you're not any different now than you were yesterday, but now that we know that, if we see anything wonky, we know." You know what I mean? But there were those other people that were like, "How can you be doing this if you have epilepsy?" The ones that didn't want to believe that I even had it. And then those that believed that I did not have the cognitive ability. Um, Actually had a doctor say that. And I'm like, yo, okay, you know, I get it. You want to talk about my cognitive ability before doing any cognitive testing? I'm going to judge you first. and then we can move forward, you know. But yeah, I've had people instantly change, but it isn't, I can't say it isn't common. Um, it wasn't too common for me. There are a few things that go on in my family that I can't change because they've made up their minds. I'm not going to fight to change their mind. I have nothing to prove, you know. But yeah, some people would be like all of a sudden standoffish, or they didn't want to hang out anymore because they were afraid. And I really truly believe um, a lot of this is their fear of what they might see. And that's understandable. But yeah, I've had it happen. And yeah, I don't even want to, yeah. And that doctor did
Yeah,
it
that's,
on a video call. Yes.
oh, wow.
I know.
So it sounds like a lot of people just base your condition on whatever they might have heard from other people. You know, if they know somebody else with epilepsy and assume that everybody's photosensitive and let those stereotypes take over.
Yeah,
Yeah.
right? Yeah. Yeah,
Yeah,
it's
I think
like
that's the
that.
biggest thing that we can push with the awareness is that epilepsy is unique for everybody.
Yep,
Yep.
it
It's a
is.
thumbprint.
And it is
All right,
scary.
now we got Lufa back. Oh, go ahead.
And it is scary for the people who are around when it happens, you know, like
Mm-hmm.
we we do kind of look like we're dying if we have a TC, you know, and that's not our fault. And the people around us, like, hopefully can understand. Um, but yeah, we just have to kind of remember that it's not our fault. And people also need to remember that, like, everybody's different. I think a lot of the confusion about it also stems from the fact that no one feels like they know anyone who's epileptic, when in actuality, you probably do. You just don't know it.
Yeah.
You know, and then there's the media aspect where all you ever see on TV and in movies is the full TCs. I forgot it was even in it. My girlfriend and I were watching the second Avatar movie
Yeah.
the other night, and one of the characters has epilepsy, um, and she had like a seizure underwater. And I was like, well, it's good that they're throwing it in there. I just, you know, I wish that they could have shown it not as just a crazy one, um, so to speak, or as a TC, so to speak, um, because that's the only way that people recognize it.
And somebody's saying that they literally had someone speak louder and slower to them after they told them. Also had someone once say, "Yeah, I heard epileptics can be unreliable in a really nice way, as if it was a symptom." Yeah, it sounds like the most discrepancies come from the workplace. Anytime a manager doesn't take you seriously because of this medical condition that's never even necessarily affected your performance. Yeah, that's rough. So, Lufa, now that you're around, that icebreaker today is what do you find most productive about the group?
Productive about the group?
Yeah, like what's the best part, basically?
I don't know. I feel like I learn something new every day. Like every time
Nice.
I learn something new that I didn't know before, or something different that I didn't know before. Expand my horizon so that I can bother my mother with facts that she doesn't care about.
Absolutely. And the more we repeat stuff, it makes it easier to remember and maybe even remember when we want to.
Yeah.
Does anyone else feel like their epilepsy is no big deal? There are a lot of posts here with people afraid for telling their jobs, people who fear they'll get fired for revealing, or have spouses that don't want to be with them, issues with their friends. It sounds so horrible to me that even that all of these people are experiencing truly gut-wrenching things that nobody deserves, especially people with epilepsy who live having to manage a constant increased amount of risk of dying every day of their lives. And all of these discrimination fears have never been afraid of or considered they could happen or experience them. So I'm left wondering is if there's something wrong with them, or no, if there's wrong with me. Am I missing it? Am I an outlier? Is discrimination this common? Is it where I live where people just don't have problems, don't make posts? So this person just sounds like they think they're really lucky and want to hear somebody else out there who says their epilepsy hasn't really messed with their lives. I think this is more about the adapting. Take it for what it is, do what you can to control, and in the meantime, that doesn't mean you have to give up on everything that you were doing. What do you guys think?
I guess I can repeat what I said the other day. Like because everyone was saying that I was sort of the most independent, and it's just about seeing what you can do, and if you can't, don't do it. But you've got to try. Um, and if you want to stay independent, you've got to just try your best. And if you need help, it's okay. You're doing your best, and you are living with something that sucks. But yeah, just I don't know. It doesn't have to take over your entire life for some people. Obviously, some of us are worse off than others. Um, but yeah, just try and live your life normal and see what you can do and appreciate every moment, every day.
That's good
Cookie?
advice.
Cookie
All right,
has
let's
his
let Cookie finish that
lemonade.
bite. Yeah, but he just took a bite, so I was gonna finish that. Yeah, a lot of people are saying that they know they're lucky that epilepsy's not on the worst end of the scale. So basically, always remembering that it could be worse.
Absolutely, absolutely.
You guys can hear me?
Yep, we can hear you. How's that
Yep.
taco?
All right, I got one. It says mushrooms. I'm in a school of horticulture, and my classmates brought up lion's mane for my cognitive issues. Apparently, it helps memory, anxiety, and depression, hyperactivity, and decreases brain fog. I struggle with these issues, and I know a lot about other epileptics. But has anyone ever tried it and had any luck? I'm seeing mostly positive results regarding hyperactivity and the brain fog. I'm also very interested in trying other herbs or fungi that happens to help with epilepsy symptoms. So if anyone has any recommendations, drop them here.
Mark was going off about lion's mane mushrooms the other night. We need Mark.
Yeah, I think
I've
I read
done,
that post.
yeah, I've done lion's mane. I really should be taking it every day. Um, I can honestly say that it does have an effect, and it is one of the best mushrooms. That is not a psychedelic mushroom. That is a highly nutritional, highly beneficial. So yes, and one thing that I will forever be grateful for is my sister got lion's mane and made crab cakes because I can't have shellfish. And she found a recipe using lion's mane mushroom. And she made these crab cakes that tasted like they were full of lobster. And I was like, I can't even describe what I felt like for like 3 days. I'm like, I should take this stuff all the time. And we made a habit of having it. And it's like, I was amazed. It's worth it. You can buy it as a supplement. Just be careful. I would rather go freeze dried. A great place to ask those questions. Again, Realm of Caring. They support and sponsored Unlimited Sciences, they are an organization with Johns Hopkins studying psychedelics. So that's a good place to start for information. But lion's mane is a highly beneficial. So is Reiki, and they don't have to be psychedelic to be beneficial. So yeah, I fully support. I wish I could grow them. I can't cultivate those things. They're tricky. All mushrooms are very tricky to cultivate. I'd rather go out in the field and see what I can find on the cow pile.
This
You know,
where we start. Is this where
yeah.
we start talking about using lines made with sardines and stuff?
Well, if that's what you're into, but yeah,
No.
I haven't done the sardines yet. I'm working on it. I I used to eat anchovies right out of the can. So, but sardines still have all the bones. Also, did yeah, I don't know. I'm thinking about it because I know I need those omegas. But yeah, lion's mane and sardines with a little bit of yogurt. Where's Tom?
Yeah, I'm glad.
Annie,
Remember
how do you
Courtney,
eat
you're the
those?
one who said put the cottage cheese with the sardines, making yogurt basically.
Yeah, yeah, yum. Um, yeah, and you can get lion's mane. Well, it depends. Like right now, our farmers markets have them right now. Um, I found them at um like the Asian food stores, places like that. Um, yeah. Phew. Oh, phew. Ah, that time of year. But yeah, I don't know how to cook them. I think I know you have to cook them before you eat them. Um, oh, my doctor is bugging me. This man never stops, I'm telling you. Damn. Okay. But yeah, I love mushrooms. I'm not gonna lie. I'm not crazy about button mushrooms, the ones everybody eats from the store, but you give me a portobello or Reiki mushrooms or lion's mane, I'm in. Um, but yeah, you know, it does a lot for the nervous system. I know there's a few people in a group that I'm in that have Parkinson's. And not only do they use psychedelic mushrooms for the tremors, they also use lion's mane and Reiki mushroom for the nervous system, kind of like we use before.
Once again, more useful information. Thank you for that. Help with insomnia. So my biggest trigger is lack of sleep. Yesterday was my first day of school for my senior year in high school. I'm typing this at 2 a.m., but I'm a huge insomnia and I can get away with staying up to 4 a.m. in the summer if I don't work the next day. But I can't do that because I have school. Unfortunately, I can't miss a day. See, I have a sister who I have to drive to school. Issue is the drive is 15 minutes one way. I also don't want to come off as a slacker or anything like that to my parents or as if I'm trying to skip school, but I don't know how much of an extra dosage I can take before it becomes a health concern. Take 500 milligrams of Keppra, but RN, I've lost count. Oh, right now I've lost count how much melatonin I've taken. And I don't know if I can overdose on the melatonin. Honestly, I don't want to learn that lesson the hard way. So any advice? So the melatonin's a sleep aid? You guys know?
Yeah, melatonin's been a sleep aid.
Yep.
Okay. I'm surprised they don't have the dose listed on, whatever the prescription is.
I'm
Or if
also
it's an
surprised
over the
that they're
counter thing.
driving.
Yeah,
Property, my sleep aid.
that's
It's like their parents can't really come at them for being a slacker when it's like you're the one, your parents are making it so that you have to drive your sister, but you shouldn't be driving. So
because somebody else is saying that Keppra is kind of a low dose. Just 500 milligrams a day is not usually any higher than from what I remember being the starting dose. So just tell your doctor, be honest. I had to, and what my neurologist told me is with seizures, it's better to get something for sleep than to be sleep deprived. And CBD. Yeah, and then the fact that the melatonin isn't any kind of natural supplement isn't a reason to, or is a reason to try to not take any more of that if you don't have to.
like they need to really work on trying to get their sleep schedule on a schedule because Yeah, when I was in my senior year of high school, I could also stay up till 4 a.m. if I didn't have, anything to do the next day. Do I do that now? Absolutely not. Um, but I don't know. It's like if you try and swap back after the summer, it's going to take a little bit for your sleep cycle to adjust as well. It's not like you can go to sleep at 4 a.m. every night and then expect to be able to go to sleep at 10.
So a routine has a lot to do with being able to fall asleep.
Also, I don't know how
Someone
much
else
time
asking.
their bed when they're not trying to sleep. I have noticed that is a huge thing too. If you're not going to sleep, don't get in your bed. Then when you get in your bed, your brain is like, okay, sleep time.
There you go. The tossing and turning can actually do a little more damage than you realize.
Oh no, I meant like when people will just like sort of hang in bed all day watching TV, but not trying to go to sleep. And then nighttime comes and they try and go to sleep, but their brain isn't associating the bed with sleep anymore. Like I only ever get into my bed when I'm going to sleep. Otherwise I'm on my couch or the kitchen or outside.
What are things you've learned about life from having epilepsy? Curious what you think. Any solid life lessons, or is it just? Yeah, I'm not even gonna read that last part. Go ahead. What have you guys learned about epilepsy that actually helped with life? I would just think it's problem solving. When something unexpected happens, you figure out that plans go to shit on way more than you want to imagine, but you got to figure out a way to make it work. What about you,
Adapting.
Ann?
Yes.
Oh, Angel, okay.
Yeah, adapting to everything, especially during like the pre 2010 years, I would say 2010, before when it was pre existing conditions, adapting to new jobs and everything. It was just like, okay, we gotta adapt. You gotta adapt.
Yeah, like I'm just annoyed with the parents, for not sort of helping out more, especially with like if he's talking to Reddit or if they're talking to Reddit about medication problems. Like, well, have you talked to your parents? Because I don't know if you're 18 or still 17, but you like you're a child. You definitely should be talking to your parents as well. And if they know, that will help because maybe you won't have to drive your sister to school. You can both get driven because you shouldn't be driving. And I appreciate that you can, but it's not safe for you.
100%, Brandon. I don't think anybody with epilepsy should be driving.
My
But that's
dad
just my
does.
view.
My dad drives everywhere. I don't even fucking know.
Yeah, with his sister being, especially that he's driving his sister to school, that's kind of an indicator that his parents maybe don't recognize the severity of it. But once diagnosed, stuff like that definitely has to change as soon as possible, anyway. So the thing about life lessons, we talked about problem solving. That somebody else said, if death is anything like post-ictal amnesia, there's nothing to fear. Yeah, after seizures suck. Okay, this one gets metaphorical. A beautiful, fortunate breakthrough. And infinite but comfortable darkness is such a beautiful way to put it. I feel the exact same thing. Yeah, I don't really get that one. Okay, what about? Can't see the forest through the trees. This is my first post in this community, so allow me to begin by saying hello, thank you. 41 years old, diagnosed with epilepsy in November of 24. Had never had a seizure before then in my life. They hit fast and hard, clusters of 2 to 3 tonic-clonic seizures at least once a month. Later developed focal aware seizures about just as often. I'm a father of 5, young men ranging in age from 22 to 8. They and my wife are my entire world. I live to take care of my immediate family as well as extended family. That includes blood and adopted. I have until the end of last year been gainfully employed since 14. After being diagnosed with this disorder and suffering the lasting effects, I was unable to return to work. Now in this state of limbo with very few options, I find myself a bit lost and unable to see the next steps. If anyone has time or inclination to leave me some advice, it would be greatly appreciated. Diagnosed later in life does sound harder to me. Just not expecting to have to adapt and change so much.
It's really good that I mean, it sucks that their youngest is 8, but it's good that they do have older kids who can help out, you know, while they are going through this change in their life and figuring out, what the next steps are. It seems like,
Oh, but right at the beginning of their life, those boys are probably just starting their careers or maybe getting out of the house for the first time, and
yeah,
I could never stand to ask them to drive me around.
yeah. Well, I mean, I like helping out around the house for stuff, like
Yeah, that's true. Stuff that
if
wouldn't put them
like,
out.
yeah, you're not trying to like put them out, but it's sort of like, okay, I need you guys to help pick up some slack, like taking care of the 8-year-old, for example, a little bit more, when I'm not feeling so great. Stuff like that can really help out without causing like too much strain, I guess. I don't know. If you have 5 kids and a wife, it's like that's a pretty big support, I guess.
Yeah, that sounds solid.
Yeah. It's gonna be manic around the whole house though. Like they're still gonna be all trying to like deal with dad's condition,
And
like
40,
trying to
41's
learn.
not that old, which sucks. I mean, he's saying later in life, but 41, it's like you still got a lot of life left.
Yeah, there is a lot of life left, but it's still like Rick will probably be like the perfect example of this, that he started his seizures later, whereas like me, I started as a teenager, you know. But
Yeah, that's a good
it's
example.
it does like uproot your whole life, and for some people that I've read on like the Reddits and stuff, they really have to change careers because they can't do what they were doing anymore because of epilepsy.
Yeah.
Yeah.
And I wonder what this guy's job was. He said he's been in the workforce since he was 14, which is
Yeah.
now I'm like, okay, one, where does this guy live? Was it legal that he was working that young? I don't know. But
I didn't
but
even think of that,
clearly,
yeah.
I mean, clearly this guy's a hard worker.
Maybe he was
And
a
I
mob
planned on
boss.
staying that way.
and wants to stay that way. So I think that that's going to really help him. Because it's when you start to get stuck in that mindset of like, well, everything's over, can't do anything anymore. That's when things start to go downhill, and you can't let yourself get stuck in that mindset. So hopefully, you know, hate to say, pulls himself up by his bootstraps because that phrase just we all hate that phrase as people who are not rich, but hopefully he's able to sort of pull himself up and keep it on going and figure out his next steps. And we're here if he needs help. Exactly.
Join the epilepsy universe.
So somebody else here is questioning about puking after focal seizure and sleep. Anyone else ever throw up after nocturnal seizures? I never get that nausea, especially after focals. No, I don't want to eat, but I'm far from nauseous.
Yeah, I don't want to eat after a seizure.
I don't know if it was because of a seizure, but I've thrown up in my sleep and it was not good. I'm not even sure what it was, but it was horrible.
So this post is describing it as I woke up around 3 or 4 in the morning, fall back asleep, have a vivid dream with intense emotions, wake up at 7, feeling groggy, sweaty, tired, and sick, and eventually throw up. It can happen a few times a month.
That happened to me the other day, but I didn't end up throwing up. But I woke up at like 4 to go to the bathroom, went back to sleep, woke up at 6 or 5:40, felt off, um, and felt like I was gonna puke. Like I did get, like the sort of, oh, you know, um, but I managed to hold it back. And after like 5 minutes after that, like my body sort of relaxed, and like the sweating and nauseousness went away. But I don't think I had a seizure. I don't know. I think
Might have
I
been
think they
some
just have
oral or
like an acid reflux thing or something. I don't know.
That's what I was thinking. I thought it was maybe like an acid reflux thing, but you said it didn't. You didn't actually throw up. Lucky
Well,
you. It came out of my nose and everything. I was laying on my back.
okay. Um, so I told you why I had to start dissolving my pills, because
Yeah,
I would go to take my pill and it would get caught and I would throw it up.
you got
Um,
that gag reflex problem.
yeah, exactly. I gotta work on that gag reflex.
I understand them. Yeah, I don't know about chopping mines up. I thought about it, but I was like, last time I put one inside of a Sprite top, how it dissolves, and it dissolved all
Oh,
weirdly.
dude,
Um,
I literally will fill like up to like here in a glass with not like boiling water, but like hot water. Um, and then break the pill in half, toss it in, and then I use a chopstick to sort of just like bang bang on the two halves, and then I swirl it around, and within like 3 minutes or something, it's completely dissolved in the water, and you can do it. You don't have to do like a tiny bit of water. You can do a big amount.
okay, I got something here. It says Keppra side effects. I recently got diagnosed with epilepsy, and I'm on 500 milligrams twice a day, so 1,000 milligrams in total. Does the tiredness and anger ever go away? And I'm struggling to get out of bed some days, and I feel myself being more irritable. The anger isn't the bad. It's more just internally thinking, will this person go away? And things like this. But the tiredness is killing me. It says question, but basically they're asking, will that go away? The Keppra at that stage, I didn't know. I need someone else to explain.
It does. You also have to. I'm saying it again. Like with the routine, um, you like if you are forced to get up and you can just keep yourself moving, then the sleepiness like doesn't hit as hard. It's just when you stop moving and you sit down, that's when it can hit really hard. So
Do you
just
need naps?
huh?
Do you need naps?
Do I mean naps?
Yeah, do you like need a nap every now and
Oh,
then?
do I need naps? Sorry, I thought you said do you mean naps? So some days I do. Like yesterday, I took a nap for an hour from like 6 to 7 ish. But I didn't like need a nap before that for like another like for like a week prior to that. But then like I don't know, a month and a half ago or something, basically every day I got home from work, I was taking like a 30-minute nap. Um, so I don't know, it varies. It's up and down with the naps, but for the most part, as long as I keep moving, my body won't shut down. You know what I mean?
Mhm. Yeah, to add on top of that, like even with dose changes, your body's going to need time to adjust to the doses and everything or new medications. And for me, once it finally adjusts to that, the tiredness will probably become less and less. Right now, it's been harder because I've been on a titration of every 2 weeks, so I can't adjust to the levels. But yeah,
Also, make sure you keep eating. I feel like a lot of people forget about that because like they'll go, "Oh, I have no energy," and it's like, "Well, what have you eaten today? A bagel 8 hours ago." And I'm like, "Well, okay, here's what we can do to solve this. You need to eat more and eat properly. Give yourself the tools to have energy. Don't just go, oh, it's the meds taking away my energy." Like, well, yeah, like the meds aren't helping, but you're not helping yourself.
Yeah, like I got tacos. What made me hungry is just thinking about Taco Tuesday, just the thought of cheap tacos today. Since I ate, I got myself a treat and I got some donuts. Um, yeah,
See,
I deserve them.
you got your protein, and now you got your sweets, and like you're filling your body.
Reward well deserved.
Thank
Don't
you.
you sometimes feel like you don't want to share your side effects with that the medications cause? I don't know what label to put on this. I've had epilepsy for about 10 years, but I still don't feel comfortable when I tell someone about how my memory and concentration have been affected by the medication. I often feel like when I tell someone this, it's like giving them a free pass to justify whatever I do or however I feel is simply a side effect of the epilepsy or the meds. This happens often with my mother. The truth is, I'd rather someone think I'm stupid because of my poor memory or trouble concentrating than simply assume that every aspect of me is a result of epilepsy and medication, racing my personality and character. So at least being stupid will be part of me and not part of epilepsy. Okay, this person definitely needs help. A reminder that they are more than their epilepsy. And that might not be reinforced by everybody assuming that whatever's going on is naturally a cause of that, but it's hard for a lot of other people not to use the chronic condition as a go-to.
Yeah, I've been told stuff all the time. Oh no, your memory is bad. You don't remember this. It's your epilepsy. Or you don't do this because it's your epilepsy. And there's so many reasons, so many things from people who don't know anything about epilepsy besides what they see on TV. Yeah, yeah, been there. Don't worry about those people. Stay hydrated. And yeah, take your pills. It's the best advice you could ever have is take your pills. It's necessary. Or you can go and just learn what it is like to not take them. That's no fun. Okay, you got any want to read those responses?
Yeah, the whole first thread on here is I tell everyone all the dirty details, but I'm a woman in my 40s, so I'm in my give zero fucks era. And the reply to that is I'm a 56-year-old male. All my fucks departed 20 years ago after my stroke, and any residual jumped ship 5 years later with the epilepsy. I'm more medication than man at this point. And somebody's saying, oh, I hope you're healing through honesty and acceptance, sending a hug, and I hope all the jokes make it easier. But yeah, I think that it's hard to not take those that you actually care about more seriously when they don't see you as the same person anymore. But that definitely is easier to clear up with age.
I got some. It says lost and confused. on what's happening. I had my first seizure June 2023. I was on vacation in India and hadn't slept well. Then the mix with the heat and exhaustion, it triggered a seizure. They gave me some medicine there, and when we left India, we stopped thinking about it so much. Then I had my second seizure in November 2024. I stayed up all night to do a lab report for physics and went to a class and had a seizure. This is when I first put on Keppra. So for clarification, before I took Keppra, I had very clear causes of both of my seizures after taking Keppra. I had one in December 2024. We assume this was triggered from me not eating much that day, but that's not really out of the ordinary. Then I had another one in March 2025, completely unexplained, and then most recently in May 2025. After the December one, I was bumped up to 1,000 milligrams twice a day. It's starting to have a real effect on my mental health. I've lost most major forms of independence, and every time I have a seizure, I lose more. The year I have to be seizure free before getting my license back resets. I'm just really confused the cause of how it feels to take more medication and take more medication often, and it's still happening. Anyone can help me provide information would be appreciated. This says it's a newcomer. Brandon, you just got diagnosed 2 years ago, right?
Yeah, it was like 2 or 3. I'm losing track now.
You could totally relate to this person, like all the way. Like they're taking Keppra and it's been 2 years.
Wait, what was the actual question? Sorry, when it goes on for a while, I can forget, obviously, but
yeah, basically they're taking Keppra and he's been 2 years in. There's some unexplained seizures. Why are they happening once or twice and so close, or whatever the case?
oh right. And at the beginning they were saying they had their first one in India after not getting good sleep and the heat exhaustion and stuff, and then the sleep deprivation. Well, they know their triggers, that's for sure. Like their triggers are they need to sleep more and watch the heat, make sure they're staying hydrated and stuff. Yeah, I mean, it's good that they had I mean, it's a weird thing to say, but it's a good thing that they had the same trigger at each of their first 2, and it wasn't random, I guess, because that means that they know what to watch out for.
Yeah,
obviously, there may be other triggers, but they like as long as you know about one, well, 2, I guess, because let's just lump in the heat exhaustion and dehydration as well, because I'm sure that didn't help. Because actually my first seizure was I wasn't getting a lot of sleep, wasn't eating that much. It was like 95 degrees out, and I was super stressed because I had given one of my other counselors' backpack to a parent, thinking that it was her kids. And luckily, she lived like I could see her building. So I raced up there trying to catch her, called her like a million times. I'm freaking out. He needed to go to his other job. And so I was like trying so hard. I called her a million times, sent her a bunch of texts, left a million voicemails. And then finally she gets back to me. I bring it back down to my work, hand it off, and then like within 3 minutes, I had a seizure.
Yeah.
Angel posted a picture in the chat of his medication so you guys can see the size of those pills.
I know he was holding them up on the screen, and I was like, I see you, I see you.
They're like those sweet tarts. Like you seen those size of those sweet tarts before? They're as big as those. I'm like, oh god.
Yeah, they're as big as them, but you can't chew them and like they're candy because they taste disgusting.
Exactly.
Oh, here's what you do. Here's what you do. You take a bunch of sweet tarts and a pill, and then you shake them up in your hand, and then you just go, oh, and just chew all of it.
My pills say do not crush, chew, a few other things, or cut. But here's one. It says having a real hard time accepting having seizures. I'm a newcomer. I'm currently in a hole in my brain where I keep trying to convince myself that my seizures are fake and that on my subconscious level, I am faking them. Makes no sense, but I do have OCD, so that could be a factor. I got prescribed Keppra today and my PCP by my PCP, but I'm still yet to see a neurologist, so I'm scared and doubtful to take it since I'm currently afraid I'm somehow faking my seizures. Any advice or wisdom? Um, Sounds like this
Um,
person wants to have PNES.
well, even PNES, no seizures are fake, you know. It's it's hard. It's hard. And it takes some time adjusting. Like it's going to be whether you get diagnosed with PNES or uh, epilepsy, you're going to be in denial for a bit, but eventually it's going to be some time and you'll get used to like it. I don't know how PNES works with epilepsy. I mean, with seizures, if that can be cured or anything. But with epilepsy, it's different. It's for life.
So, James, welcome back. We have an icebreaker today of what do you like best about the group? What do you think is most productive?
Hey, yeah, good to see everybody a little bit later. Actually, yeah, I started working again today. So, but yeah, I don't know, since I've only been here a couple weeks, but just talking to other people who have the same issues that can actually kind of understand how I feel, not having to try and like use so many comparisons or different things like that, if that makes sense. Like, it's hard to explain having a seizure to somebody that's never had one, right? You have to try and explain, like, oh, it was like maybe this one time you might have had this certain situation happen to you, whereas with all of you guys, it's like, oh yeah, I had another seizure, so this is sore, this is sore. You guys already know what the hell I'm talking about, and I don't have to deep dive into a super big comparison or something like that. So I guess just being more open and you guys listening and everything, that's for me has been the best part of the group and everything.
Okay, glad we could help out. About can medication worsen your epilepsy? This question isn't for more intense cases, I guess. It's more for those who have seizures pretty infrequently, 5 to 10 times a year or less. I only have focal awares, and when I've had years where I can have up to 10 or more a month, I seem to be in a more dry spell. I had 3 recent obvious seizures in the last 2 weeks, And while I'm still in the testing phase with none happening on EEGs yet, when I described my symptoms to my doctor, they decided to start me on medication. I'm planning an EMU stay in December, but my worry is if my brain gets accustomed to the medication, then I take my final dose the day before as instructed. Will those be legitimate seizures, or will it be only because of coming off the meds? Also, I've read on the subreddit that people have had their epilepsy worsen after starting the medication, missing doses accidentally, like focals progressing to generalized seizures. My focals are decently manageable. Granted, this year, though, them being bad is what led me to finally start looking into answers. I'm worried that by starting medication, it will put me on a path I can't go back on. Am I already on that path? I don't think it's too late for this one. I'm really happy to hear someone actually asking the questions before they let themselves get dependent.
I don't believe that, you know, your seizures can technically be worsened because we never know when a clonic will trigger or anything. But there is chances that medications, like your body does become tolerant to it, or you might be on, like the doctor might put you on the wrong medication. And yeah, it might not hold back any seizures at all.
Yeah, I had mentioned the other day, the reason that I was switched off of taking phenatonin was because I was at the highest dosage that they were allowed to prescribe. But anytime I had done a blood test, they always tried to tell me I wasn't taking the correct dosages. I was skipping stuff or something. It was always low in my blood, in my blood system, despite me. I never missed a dose. I was at the highest that they would prescribe to somebody, and it would still show up as low in my blood system. So just each that's a hard question to answer because each medication does something different to each person, for each dose. So I wouldn't say necessarily it was causing more seizures. I was just, by the time I was kind of on the end of it, it probably wasn't, helping out as much as it was to begin with. So that might have been why it was I was having them more frequently versus when I first started it. Because I was on that one for, I want to say, 8 to 10 years. I don't remember exactly because I've been on so many different ones now at this point. But yeah.
Um, Kay, you want to go through some of the comments on that post, or you got something else? I mean, I got something else if you don't.
Yeah, we've got a couple more. I mean, these comments are pretty much saying the same thing. It looks like for sometimes yes, but if it happens for one medication, there are lots of options to switch to. So it sounds like most of the suggestions are saying to do what the doctor tells you, start the medication, but don't be afraid to bring up any concerns of side effects, because that's what a lot of people are blaming the worst case scenarios on. They're just assuming this is the one thing they can do and living with the misery it causes without asking about it. And a lot of other people later, diagnosed later in life have the same questions. This guy's saying he's 66 and had a couple tonic-clonics in the last year or 2 years. The doctor's telling him to take Keppra, go figure, and he just never wanted to start it. Quit alcohol, became a regular at the gym, made some positive changes, but decided not to start the meds. And hey, if I could go back, I would try something like that.
I got something here.
Yeah, I've been.
Oh, go ahead, James.
Oh, I was just gonna say, yeah, I've been begging to, try and get off the Keppra, go as low as I can. Like I mentioned before, it's been about a month now. I was up to 3,000 mil every evening, and now finally I've stepped down to 2,000. haven't noticed a huge difference, but at least if I can keep stepping down and eventually get off that damn pill, I would be over the moon.
Try some of this. B12 by Nature's Made. It's the gummies. Try them out.
I
Shout
do
out to Nature's Made.
I do have that, and then I have one of their like multi gummies or whatever. So it's got B12 and bunch of other different, I don't know, medical words. I don't know what they are, but a bunch of other stuff in them. And yeah, I take that as well.
What are you doing? What you got?
Pick them up at Costco.
I believe in them, man. I just wouldn't got some more to keep the stock up. Shout out to Nature's Made.
For your car?
They work though. I haven't had a focal since I started taking them about 10 weeks ago. A little more than that, maybe.
Nice.
Oh yeah. Shout out to Nature's Made. I got a post right here though. It says, is there any way I can prevent my seizures? Unfortunately, I had a seizure after a whole year before without having any. I was supposed to be taking Keppra twice a day, but I was only taking it once a day, and I was feeling great until this seizure happened. My Keppra levels are normal. I wasn't stressed or anything, and yes, I know seizures are unpredictable and unexpected, but I feel like the doctors were blaming me in a way. Anyways, the main thing I want to know is there a way I can prevent it when I feel it's about to happen? I know some people say there's nothing you can do to prevent seizures, but if you're feeling those little symptoms or hints before this, what do you try? I know alcohol has helped me, not fully, but has helped. Rubbing alcohol, not drinking alcohol.
Wait, how would that work? How would that help? Like, in what form would they be using that for it to, like,
I have
like
no
just
idea.
smelling it to like wake them up or something? Like, what? I'm confused on that one. I'm not trying to be a jerk. I'm just
That was it.
legitimately asking.
You're not being a jerk. That was it. What helps?
Because that's kind of interesting. I was gonna say otherwise, maybe just a rescue med would probably be better rather than
So
rubbing
for
alcohol. But
context, that also says for context, I have lupus. So if you know lupus, if I
oh,
stress my body, it feels like doing whatever that day. It will cause inflammation and flare-ups. So sometimes the inflammation can cause a seizure. Took my meds 3 to 4 times a day for 3 years. But yeah,
In the
I don't
words
know
of
about.
in the words of Dr. Gregory House, it's never lupus. No, but seriously, it sounds like this person has a lot more than just like epilepsy or just seizures that they're dealing with. If they have lupus, it's like their body's going through a lot. So I'm curious to see what the side effects of that medication are combined with everything else.
Yeah, their body's under stress alone.
Are there any causes to lupus?
No, that's an autoimmune disease. It could be genetic. It could be anything.
One of the comments here says the easiest way to prevent your seizures is to use the medicine as prescribed unless conditions worsen. The easiest way to cause a seizure: do not use medication as prescribed. When I get the slight baby feelings of my TL seizures, if possible, I will go somewhere and be alone. I'll breathe 4, 4, 4, 4 seconds in, hold your breath for 4 seconds, and then breathe out for 4 seconds. Also, just getting away from whatever stimulation can stop them for me. Last night, scrolling through Reddit was making me feel like that. I got off my phone and Went to bed, no seizures, and here I am again. One more comment. It says, every case is very greatly. Every case can vary greatly because each person is unique. Unfortunately, treatments often rely on generalized knowledge and techniques. In my experience, I avoid alcohol, consume caffeine only in moderation, rest as much as possible, maintain stress-free like lifestyle, exercise daily, monitor and control my diet, and identify and avoid personal triggers. While it can be challenging, it's most important to know yourself better than anyone else. Most importantly, find a skilled neurologist and remain consistent. With treatment, I experienced in AEI and, for lack of a better term, developed epilepsy. So far, I've had it short, controlled auras, which seems to have some improved since adding Excapre to Keppra that I was already taking. Are all the like, what do they call it, cocktails different for each person?
It seems like they usually have more AEDs than benzos.
What's an AEI?
AED, the anti-epileptic drugs, that's in like the other class of medications. It's less concentrated and usually less side effects than the benzos. I usually see benzodiazepines as like more those are the ones that they call like Schedule 4s and 5s, controlled
Yeah,
substances.
in the last post, he said something about AEI. Hey, Mark, how you doing? Icebreaker today is I like the hair.
Thank you.
Icebreaker today is what's it called? Kay remembers. I forgot.
Okay. Icebreaker is, what is your favorite part of this group that makes it so productive?
Favorite part that makes it productive, or it seems like those are not necessarily the same thing. The favorite
All
part
right, go with productive
or
then.
the productive.
Yeah, what's the most productive part of in season?
Um, I mean, just learning about how different seizures can be between individuals and stuff. Not even just like absence seizures and tonic-clonics, but there's a whole gamut of brain wonk that really was not explained before starting the epilepsy journey. So yeah, it was pretty cool to hear about everybody else's experiences, not to
Yeah, plenty of us love learning.
yeah, yeah.
Good one.
Yeah, I got something here. And welcome. How you been doing?
Thanks. Been good. How about you guys?
All right. I like the hair.
Thank you. Yeah, I kept getting all like down and everything, so I just kind of get it up out of the way. The scalp feels so much breezier now. It's nice in the Florida heat, but I feel like I gotta sunscreen my scalp when I step outside. It's so short now. So there's like a balance between the cooling effect of having no hair and the sunburn on the white boy scalp. I gotta find that happy medium.
For some reason, like, unless the sides of your head are crazy like pale, I don't think that it's going to change much based on your overall skin tone. Sorry, bud. You may live in Florida, and you live in the sun, but I got more of a tan than you up in Rhode Island.
Am I frozen?
Nope, you're there.
Okay, I didn't hear what Brandon just said. Oh, my internet connections are unstable. I don't know. Somebody hogging the bandwidth here.
Oh,
Oh,
I
we
was
still got Netflix open. Hold on. I'm gonna just shut this down. Sorry, what? Something about a pale scalp?
I
Something?
was jokingly saying unless like the sides of your head are wildly like whiter than your face color, I don't think it's going to really make much of a difference because you live in Florida and you're in the sun. I live in Rhode Island up in the north and my tan is like this right now.
Oh yeah. I mean, I live in Florida, but I stay in the cave. Like this mood lighting you see is my existence. I only run it.
Oh, there he goes again. Yeah.
Yeah. One
I
thing
was
I
going to
was gonna
say,
say.
I've always loved Mark's mood lighting, the purple.
Oh
I've always,
yeah.
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 Um, Pokey, what's up next, I guess?
I was gonna say James, the jacket. James,
Yeah, what's up?
the jacket kind of stuck out to me. You went to church?
Oh no, it's the first day of work at school. Like I said before, I dress a little like 1800s ish. So I got my vest, my pocket watch, chain, and everything. So this is just kind of how I normally dress. I put the little pocket square in, just be a little bit more fancy since it was the first day back at work. But I'm just
What what do you
I'm
teach?
odd. I'm odd like that.
Nothing wrong with that. Everybody has.
What was it that you teach?
I know I wish I could, but no. I'm just there a couple hours a day, yard duty for like recesses
Oh,
and
so you wear that
lunches.
for
Uh,
your hard duty?
yeah, yeah. It's just kind of my norm. I mean, this is just what I wear to go to the grocery store most of the time. It's just my normal. Like I said, I'm odd. That's just my style. But yeah, I'm there a couple hours a day. I try and volunteer for stuff. You know, if maintenance stuff is needed. You know, there's like the book fair each year. I help out with different some of the sports teams. Um, you know, and stuff. The
What's
yard
the
duty stuff. I
what's
need to
the
be
age
there for a
range?
certain. I'm sorry.
Or what's the grade range?
Uh, Elementary school. So for here, it's kindergarten to fifth grade.
Got it.
Um, for out here in California, or at least the area I'm at.
Gotcha.
So yeah, the yard duty stuff I actually get paid for, but a lot of the other stuff I try and keep it, you know, volunteer work, so that way no one's truly really relying on me. So if I'm not feeling well, I have a seizure or something, I have to call out last minute. It's not, you know, no one's really like completely banking on me, you know,
Yeah,
being there doing that, you know, that thing.
gotcha.
So
Yeah, that makes sense. Cool.
I got something. It says can't open eyes during focal. When I'm having a focal seizure, my eyes forcibly close, and I get a lot of face movement, especially around my eyes. If I try to open my eyes, it's like pushing against a wall. I can't get them open slightly, but then they force shut again. It's so uncomfortable. Does this happen to anyone else? Um, I don't know because what about the focal I had when I wander off, or is that even a focal? Because I don't remember if my eyes are open when I'm walking around wandering. That's a very good question. Are my eyes open when I wander off during my wandering seizures?
I know when I go wandering, my eyes are open because I've wandered with an object of whatever I'm carrying or doing, and I put it somewhere. So I wouldn't be able to do that with my eyes closed. And I mean, the focal awareness, maybe for you, it's just starting to wipe the memory out. So that's what told me that
Maybe
when I
just
was,
sort of
when they were
abstinence
getting
seizure.
worse. Yeah, it could
My,
be.
my focal awares were mostly like just staring at stuff. And yeah, but like staring at something and I can't get my attention off of it and I can't do anything else. Those are my focal awares, which is really weird. Yeah. Yeah. Anybody else's eyes closed? Is that a thing?
Yeah, that happens to me. And same thing with the like sort of twitching, like facial tics, kind of around my eyes. And I will feel like even with my eyes, with my eyelids closed, it's like, when you can kind of like look around even with your eyelids shut. Um, and if you're looking at someone's eyes like that, like you can kind of see their eyes moving under the eyelids. Have you ever seen that?
I imagined it.
Yeah.
Okay. So it's like that, but the I like what they said about pushing against a wall because it feels like that when my eyes are closed and I'm doing the twitch like with my eyes, where it does feel like my eyes are trying to like punch out from my eyelids. And then like around my eyes, like in this area, like I'll have like sort of like kind of like those sort of
The
movements.
orbital areas.
It's just like like my face is just like tensing up and like sort of twitching a little bit, kind of like this. And my eyes are like back and forth, trying to like punch out from my eyelids. Those
Okay,
usually
so
only
the
last like,
facial muscles as well as
yeah,
the
it's like,
eye muscles.
well, it's nothing down here. It's all like the muscles
But
around here. Yeah.
okay.
Yeah. But yeah, those only usually last like 2 minutes, maybe 3. And I just need to sit, but I can't open my eyes.
Do the triggers change the seizures for anybody? Like depending on the what the trigger is, what kind of seizure you have?
Um, no, because I usually can't figure out my triggers, but that's interesting. Like I was thinking, like, what if I would have had one from the lasers at the concert, and then would have been have harder if it was a seizure from sleep deprivation. You mean like that type of different?
Yeah, because I know the only one that I know will happen for sure is if I stop taking the meds, then it's definitely going to be a TC about it. But other than that, it's all up in the air, whether it's that time of the month or just less sleep. I mean, less sleep for more than a week at this point because I'm down to 5 hours now and it hasn't caused anything. But time will tell, depending on the trigger. I wonder if it is different for other people.
Kate's joining me on that 5-hour gang.
Yeah, and like the 8 hours once a week, totally covered it for the last 2 weeks now.
One of the comments here.
It's not ideal, but it works.
Yeah, and I still have more energy. Feel way better.
There's a comment on this can't open eyes focal. Says that actually happened to me the other night, but it wasn't a focal. I smoked too much weed apparently and greened out. It was no more than I usually smoke, but I had a cluster of seizures early in the week. So I think it was just me with too much for my brain, for what my brain is currently. So I went into greening out, and it flowed right into an aura, and I legit could not open my eyes. It's one hell of a seizure or an aura.
So were they aware and they couldn't open their eyes?
Yeah, it sounds like it.
That would be terrifying.
We keep getting like the weed questions, or like we keep like bringing up weed questions. I feel like we need to compile all the answers that we've come up with and put out like a master list for people and just like post the link to it
Just
or
yeah,
something.
just do one vid on the podcast specifically about it, and then just get it all out of the way and done with.
I mean, it could be a very short video. It's not the weed.
Yeah, exactly. But people are gonna have more specific questions. That's all I'm saying.
Here's one that says, "Why do paramedics call everything panic attacks?" Why paramedics didn't understand that I had a seizure, not a panic attack. Around midnight, I was on the street next to my boyfriend's workplace when I started seizing and I dropped. One of my boyfriend's colleagues run to me, and luckily a neurologist walked there. What was the chance of that happening? The neurologist knew from the start that it was a seizure, and my boyfriend told them when he got there, I'm an epileptic. When I was cleared up, I also told them that I guess they don't believe me because I quickly cleared that up. Almost no postical phase that hits me later on, and there no liquid came out of my mouth. Kind of argued with them a bit when I had another seizure on the way to the hospital. I hate that I call every seizure just a panic attack. I had a panic attack a few years ago, maybe, and this was actually a seizure. I was not diagnosed back then. I don't know. Am I just ranting?
They had an actual neurologist there when it happened who said that it was a seizure, and but when they got to the hospital, they still didn't believe that it was a seizure.
So it sounds like
this is ridiculous.
Yeah.
I don't know anything about panic attacks, so forgive this question, but when people do have them, do their bodies also
convulse?
Convulse and flail around? Is that common with that too? Like, why would they?
No, it's not.
Usually
I have
muscle
a
tension, right?
I have a panic disorder due to my PTSD and anxiety. And a panic attack is very different from an anxiety attack, which is very different from a epileptic episode.
That's what I always thought as well. So I just
Usually with panic attacks, you're hyperventilating, you're shaking, but you're not convulsing. You might pass out because of how much.
I didn't hear that he said that. May have like slipped it in passing, but
Well,
yeah,
no, that's awesome that your sister is an ER nurse, because that means that you have another person who is experienced and able to help you if need be.
Yeah, she's not just an ER nurse. When she goes in, they make her the charge nurse, so she is like the ER nurse. So I'm in good hands when I go over and spend the day at her house.
So this one can get some input from everybody. Feel free to trauma dump if you like. Has epilepsy ever ruined your relationships? This person says, I think my partner is getting annoyed at me talking about seizures and having to make appointments at the hospital, not being able to go out and do some things, etc. I feel dreadful about it. Let's start right from here. All right, Angel, you first.
Let's just say I'm going through a divorce. That's anything. But yeah. Yeah.
Okay, moving up. Okay, go ahead.
I think my wife got real tired a few years ago because my mom showed me a text she sent saying she was tired of like saying I wasn't even doing this stuff, but whatever. But saying, I was demanding like all these hospital, like taking my trips to the hospital and stuff, and picking up my meds. And I'm like, I'm using telehealth.
All right, James, how about you?
Yeah, I don't know if you were here or not. I kind of went through my my ex-wife and how that went, and some of the things that she said to me, and kind of put my epilepsy on me. Um, and yeah, if you were there, it still gets me kind of emotional. I prefer not to repeat it again. I'm not really ready yet, but yeah, it was definitely something that heavily weighed on my divorce back in 2017.
So, I mean, have you come to terms with actually managing your epilepsy and being able to I look forward to moving on in a sense?
Because of how, oh, wow, my bad. Sorry, I forgot. I was so sorry. I'm so sorry. So sorry. Don't do that again, Pookie. Anyways, Panic Attack will have you, um, God damn it, Pookie. Fuck's sake. Um, you're hyperventilating and shaking and usually crying and you can't get out words and you're not foaming at the mouth, but you got, yeah. Anyways, let me continue changing my freaking shirt as I was going to do. Um, yep. I thought that was just asking me to start the video so it would record, not actually turn on my freaking video. It's freaking scare me with that. Why would you do that to me?
Lufa, when you do
Yeah.
have
Oh,
panic attacks, do you get like the muscle tension? Like, do your muscles sort of tense up
Yeah,
really?
yeah, your
Okay.
muscle tense up, but it's different than a seizure.
No, I know. Yeah.
And it's
I
also different than an anxiety attack. People
yeah.
also will say panic attack and anxiety attack, and they'll be like, "Oh my God, I had a panic attack," but that's actually an anxiety attack. A panic attack is it stems from a panic disorder where you kind of in the moment think that you are back wherever you were panicking before. And a lot of times people will go into like a cradled up position in a corner or in a closet or in a bathroom or in a tub, anywhere like dark and where no one can come from behind them, because it's almost like you're reliving a moment. So it's not epilepsy, it's
Yeah. Yeah. No,
different.
I asked about the muscle tension specifically because I don't know if you've seen Ted Lasso, but Jason Sudeikis' character in the show has panic attacks, and when it was happening to him, like he would do yes the like curled up thing, but it would when it would start, and I was wondering about it because I wanted to know how accurate they were portraying it. Um, where it like he would start hyperventilating, but his fingers would sort of start clenching up like this. Um, and yeah, so when I asked, I knew it wasn't like full body, but just like, is it like, do you get that sort of
Yeah,
like,
like you're like a lot of people will like cradle themselves almost, or like clench their fist or start smacking their head even, um, uh, or start slapping themselves, just to try and like almost get yourself out of it. Um, and so a lot of those like involuntary but voluntary movements can happen. I call them involuntary but voluntary because there's a difference between like your body sending a a little lesson down to your hand and you throwing everything up in the air versus like you having a panic attack and trying to slap yourself out of it or clenching your fist up because or like scratching at yourself or digging your nails into your skin because um you're trying to do anything you can to really get yourself out of that moment. So it's like you're not noticing that you're doing it. Um, you're just kind of subconsciously doing it. Whereas with a seizure, that's a whole other thing. So I think people oftentimes mix up seizures and anxiety and panic attacks. But there are pretty distinct.
Probably more if you have an aura. Somebody's saying here they've been epileptic for 10 years now. They have left temporal lobe epilepsy the past year or so, noticing that they hear, struggling to hear people correctly or hear them at all, especially in a busy room. I asked people to repeat themselves up to 3 times. Anybody else had this problem? And the first response is that that's my aura. My hearing turns into like an echoing room until the reverb gets so much I can't distinguish the original voice. Is your speech okay? If they try talking during an aura, it comes out like unintelligible. I was a teacher and parents' evenings with everyone talking in a hall, but it became a nightmare even when they were fully controlled. Yeah, so that's kind of another reminder that auras are definitely seizures too.
Oh, hell yeah. I'm in the mood for cake. Oh, let me get back to
Donuts will
this.
do the trick, right?
Um,
Get yourself a nice cup of milk and have it with the donuts.
the donuts, I got my fix. I don't think I'm in the mood for them anymore. It would just look good on a shelf. Anyhow, how to cope with the fear of the next seizure of a friend or a family member. For the people that know a friend or a family member with epilepsy, how do you cope with the fear of them thinking that the next seizure is right around the corner? I've got a dog with epilepsy. Mornings are the worst. I go to sleep scared. I wake up flinching at every move she makes. I'm kind of driving myself crazy. How do you cope? It's a dog though. How would you? I don't have a dog. Actually, it's not necessarily my dog, but how would you guys deal with that if your animal was having seizures?
I guess I would treat it the same as if a friend, because it's like exactly what it is, your pets are your friends.
Yeah.
Um, where it's like you can only do what you can do and you can't, I don't know, you can't lose your mind over it. If it's gonna happen, it's gonna happen. It's not your fault. Just be there to help when it does, if it does.
Can
Yeah,
animals
yeah,
get kept a rage?
that would be sad though.
Yeah. Can they take
Yeah,
pills for that?
well, they definitely, yeah. When pets have epilepsy, they absolutely need to take pills. Actually, my friend sent me a link for a cat that was up for adoption that has epilepsy a few weeks ago. And like one of the things in the description was needs to be given a pill 3 times a day. Um,
Ugh.
and also can't live in a house with other cats. And I was like, okay, sorry, yeah, this is an immediate no for me, because I am working and also I have 2 other cats, so I will not be able to take care of this cat as much as I would love.
Yeah, the the pills that my vet gives to sedate my big cat Poofy before bringing her in to do anything are um, gabapentin. That is a close cousin to um, pregabalin, which is the one of the two AEDs that I'm on. Um, so I mean, they're sodium channel blockers and stuff. So they're basically the same meds uh, that I get. my cat gets when she needs to calm down. So, it's it's a fight though. I wouldn't want to give my cat a pill 3 times a day, every day for the rest of her life. That is a fight that is not, I don't know, but if she was having epilepsy, if she was having seizures, I guess maybe what kind of seizures? If they were just absent seizures, then I would, you know, I would,
I
I
doubt
don't
animals
know.
are diagnosed in
Yeah,
that
it
kind
would
of
be
detail.
interesting though. I wonder, how would you know if your cat is having absence seizures? It just
And
stares off into space even
yeah, I
when
was
they're
just about to say
not seizing.
anybody who has a cat knows that
Both
you will
was
look
there.
over and just see them going like this at the wall for like 5 minutes. So it's
Yeah, I
are
mean,
you looking
maybe
at
there's an
ghosts? What are you
epidemic of
doing?
undiagnosed epilepsy in domesticated cats.
But then
Maybe
you
we
give them
need,
a Kepra and they'll like scratch the shit out of the wall.
Will they have Kepler rage?
They take Kepra. They do prescribe animals Kepra, phenobarbital, and like he said, the gabapentins and zonisamide. Yeah, they take a lot of the same stuff we do.
I wonder what the dosages would be, like how many milligrams. Because obviously, like body weight and stuff. So it's like if it's a cat, it's probably like what, 10 milligrams of
My
like
one,
it.
my mom's one cat has to get gabapentin all the time because she has tried to take out the vet several times, and she's had to write a sorry note to the vet for taking out the vet.
that's,
She usually has to take gabapentin, but she had now learned the taste of it, so she
oh,
can't get anymore. I don't know the milligrams, but she's a big girl. Um, she's a big girl. Um, but yeah, my mom warned the tech. She was like, "You should probably have the regular doctor here." The tech was like, "No, I got it." And my mom picks up the cat, and the tech comes back, and her arms like all wrapped up. She's like, "Yeah, she's feisty. She's a lot faster than she looks." My mom's like, "Yeah." So she's like, "Did she take the gabapentin?" She's like, "Yeah, but I don't know."
I
is it
wonder if the
building a
Pokemon
tolerance
aware.
to it?
Probably. She's a big girl. She's big.
It's a bigger dose.
I think she's a part, what are they? They're the big ones.
Maine Coon?
Maine
Yeah,
Coon.
I think she's part Maine Coon for sure.
Yeah, we think that my
Paw,
Poofy is
big one.
part Maine Coon
Yeah.
too, just gigantic.
Well, and she came from the street originally, and she's older, so not older, but like she's not a kitten. So she
Yeah,
lived most of her life on the street, so she's not like full on domesticated like some of our other cats are. She's like half,
just got a little edge to
yeah,
her.
she's a little edgy. So yeah, she's a bit feisty when it comes to the vet, but Tony's a good boy. Tony's a very good boy at the vet.
There was only one vet at the place that I would go to because I don't know. I hate to phrase it this way, but like I'm at the point now where I feel like I can tell if my cats have something wrong. And I can't exactly afford to go to the vet every, 6 months or whatever it is. Um, so I don't necessarily go anymore, unless I know that something's wrong. Um, but there was only one vet tech at the place I would go to who could actually get through to my cats. Everyone else they hated.
Somebody had the touch.
Yeah, it was this guy Lance, and I love him, and I still talk to him. He just doesn't work there anymore. Um, and it's hilarious because I always think I see him um out and about in town, but it's actually his twin brother. They both
Oh,
have full sleeve tattoos, exact same haircut, same style of glasses, only his twin brother owns a record store in my city. Yeah, I always yell out, I'm like, Lance, and it's like, nope, not Lance. Whoops, my bad.
I mean, same haircut, same
That's
they're,
crazy.
glasses,
they're
frames.
making
They've
it
got to
hard.
be. I mean, they're doing that intentionally, aren't
Yeah,
they?
they make it hard.
This girl sounds really freaked out. She's saying false pregnancy test with Vimpat. I'm over here freaking out. I randomly took a pregnancy test and it came back positive. I have an IUD and I'm so confused. Can Vimpat give me a false positive?
Is
Has
she
this ever happened to
sexually
anyone else? What is that?
is she sexually active?
It's making it sound like, I mean, why else would you take the test? But
Yeah,
she
if there's
did say she
cause for
randomly took a pregnancy test.
but why do you randomly take a pregnancy test?
Yeah.
Okay,
Yeah.
so when I was on Kepra, I was having a lot of hormonal problems and I had a lot of rage, and for a second, because the Kepra was messing with my IUD, I was spotting a lot. And I was like, am I pregnant? But I wasn't like sexually active with men at the time. So I was like, unless she's got some and just inseminated me somehow, then I don't know how to hell. So I was like, can we just go and get two dollar store tests? And that was the first time I've ever taken a pregnancy test in my entire life.
Did you ask her to take the second one?
No, she already has a baby. She's got a baby already, which is why I was like, oh hell no. Because then, first of all, who's the father? And then you're also the mother? Because what? That would be really confusing, guys. So I don't even want to that would be a crazy family dynamic.
You,
So I
you
just
basically thought at first, like, did this girl just have like a little puff cum waiting to
well,
go? Sorry, it's
I
from Bright
honestly
Goldstein comedy special. Little puff of cum.
I had no, like, I didn't know if she was like, if she had some leftover like cement in her area of of prospering, and
That's a good pun as
then
well.
that cement somehow
Semen.
cemented in me and then cemented a being, and I wasn't about that. So I was like, we need to go get a test, and I'm gonna take it. Came back negative, and I was like, gosh, this Kepra's really fucking with me. I need to get off this shit. So yeah, no pregnancy scares since then. Just Kepra and her crazy ass trying to get me pregnant.
Well, that's the best Kepler horror story we've had today.
Yeah, that was I forgot that happened. That was that was the first time I've ever taken a pregnancy test. And
We
which
have
is
had
the
a lot of Kepra questions today. Yeah, but
yeah.
so good thing that you came in with that one.
Well, with my history, it's just like crazy that that's the first pregnancy scare I've ever had. Like, I've had a past, and that's the first pregnancy scare. Seriously, is Kepra? Are you?
But you were what, 20 years old?
Yeah.
Mm-hmm.
So that's probably just the first time you gave a fuck to find out if you were actually pregnant.
Well,
I
no,
mean, there's always that.
never had symptoms of where I've been like, am I pregnant? But I think because my hips have grown and because I'm going through that second stage of womanhood, yay. Um, Tony, stop being a bitch. And I don't know, I was just paranoid that maybe somehow she artificially inseminated me somehow with the magic of transfer.
Yeah, Luke was a big
You
girl,
know,
but
they
you're not
say
gonna
the
get
smallest
pregnant by
amount
accident
go
like
the
that.
longest way, and I don't want the longest way, so I don't want anyway. So, yeah.
Go ahead,
So
Jeff.
I want to change my answer to the icebreaker. To the
Yeah.
best thing about this, is
Oh,
loofah.
Right. I gotta get another one-on-one, Lufa. Also, you gotta be sitting down next time.
okay.
All right. I got
Hey,
something.
didn't Angel speak up before? Did Mark and Jeff want to talk to somebody about mushrooms?
Talk to me about mushrooms. Am I gonna
Oh,
Yeah,
Yeah, so somebody put
Mark,
something about mushrooms in the chat.
we were discussing lion's mane mushrooms and the benefits. Annie did come in with a lot of info. I had originally been like, "Oh, we got to talk to Mark," because he was going off about mushrooms the other day. So yeah, it was basically there were some questions about lion's mane mushrooms and the benefits.
Are those psychedelics?
Yes.
and
So
Mark told me
No,
to talk to
no,
you, Brandon.
lion's mane are not psychedelics. No,
okay, I didn't think. Okay,
you can buy them at the grocery store.
there's
Oh,
okay. There's psycho sub. It's you know the word. You know the word.
Neuroprotective.
Psycho sub. There's
psychosomatic?
psychosomatic. Man.
Or do you mean psilocybin?
Yeah, that one too. You guys are so smart. So let's say so I've done some research and um I've looked into people that have tried mushrooms, you know, to help with their mental state, and it has really worked for some people. And for others, it has done the complete opposite and has sent them into psychosis. And I'm just wondering for myself. Well, no, I'm not just wondering for myself. I'm saying in general, so that I wouldn't, in general, um, would it be a good idea if I tried one of those? Because I feel like I might lean on the path of going into psychosis.
Wait, so are you talking? You're talking about like magic mushrooms, correct?
Yeah, because some people say that they help with like if you like microdose them and
Yes. Okay. No, no, no. I know where you're going with this.
shit, but
You're
I'm
good. You're good.
horrified that I'm gonna go into psychosis because I'm susceptible to life.
So what I will suggest is actually, are you on any anti-anxiety meds?
Well, um I'm on Klonopin for my sneezers. And I'm also my doctor just put me on. So I'm super. So here's the thing. The reason that I have been looking for alternative medications
No,
and
I'm
ways to heal my.
sorry. I'm gonna cut you off here. The reason I asked about that is because if you're on an anti-anxiety, mushrooms don't work for you. The medication counteracts
Oh,
the
so the Klonopin would counteract the mushroom.
if it's an anti-anxiety, then yes.
Oh, it's a benzodiazepine, but it works as an anti-anxiety as well.
Okay, yeah. So
It would make sense as to why I never felt anything on mushrooms.
yes,
I've
that would be why.
taken like a bunch of mushrooms before, and I sit there and I'm like, I feel weird and uncomfortable.
Yeah,
But
my
like,
girlfriend and I got some mushrooms a few weeks ago because like I've done them in the past. And like I was sitting there total like I was chill. I was like, yeah. And then she was just kind of like, I don't really feel it. Should I
Yeah,
take more? Because yeah, it's her
well,
anti-anxieties that
yeah.
we found out make it so that the mushrooms don't work.
So I have been looking into alternative treatments because my brain is susceptible to more neurological adverse side effects of medications, and with the genetic testing that we took, turns out I'm a very expensive patient. Who would have thought? All of the medications that my body responds to have a high risk of, they're older medications that have a high risk of tardive dystonia or tardive dyskinesia, which I've already had before. And then the other three that my body responds, so there's six that my body responds to, are also have the side effect of tardive dystonia or tardive dyskinesia. Those are the only ones that my body responds to. The other ones that my body doesn't respond to. So it just doesn't break it down, it doesn't do anything. So I asked my psychiatrist today, I was like, so what do we, I agreed to try this new medication, even though it has the potential side effect of tardive dyskinesia. And I asked him, I'm like, what do we do if it doesn't work? If I have another dystonic reaction, like what do we do then? How are we supposed to, what are we supposed to do then? He's like, I don't know, we'll figure it out at that point. But that's why I'm trying to figure out some alternative medicines, because my body is like highly susceptible to dystonic reactions. But
Yeah, so I would suggest like mushrooms probably won't be the best option just because I think you'd just be throwing your money away. Um, we don't want that. We don't want anyone wasting their money. But if you know you get a good hookup or something, and somebody wants to like I don't know give you a giant stash of mushrooms and you can actually take like a full cap, then fuck yeah, go for it, girl.
I just don't want to go into psychosis like those other people, but I don't know.
You know yourself
Uh,
best. Don't risk it. Be safe.
what I was doing was
This
when I would
isn't,
have the mushrooms, I would take um, a few little strips off, and I would just shove them up in my lip, um, and I would just kind of microdose, um, and it would help just sort of like keep my head level, but I wasn't like taking the mushrooms like all at once to put me at a point of like, whoa, you know what I mean?
yeah, I guess like when
Is
I
that
took
like the
doing it,
actual organic mushroom material itself, the dried mushroom that you had, Brandon?
Well, I mean, oh, I guess
Because
I've
it
never
doesn't
had
sound
like,
like chocolate bars, so like a strip, I'm just wondering.
oh yeah, well, it's more concentrated, and so like, you're basically like your saliva is just absorbing the psilocybins, and then when you like when you're swallowing your saliva, you're getting it.
Right, but is that that's not a chocolate bar, is it? That you're
No,
just sipping?
no, it's just straight mushroom.
So yeah,
have you
the
guys
dried mushroom.
heard about the thing going on with the feel good they're like these little they kind of almost look like shooters, that you take, and they're supposed to be like an alternative to opioids. And I've tried one before. It didn't do anything. I didn't feel anything. But I was also on a heavy amount of other substances at that time, so I didn't think it would make me feel anything. But there's a lawsuit going on or something where they're being told that people are starting to get addicted to it and that it has addictive properties or something. I don't know. But that's been, I don't know, I saw that pop up. I thought that was kind of funny because I remember drinking one and thinking it tasted so horrible and it doing nothing and being really mad at it. And to find out people are addicted to it, I was like, oh, shit. Guess everyone has different experiences.
Alcohol is addictive, and half the time it doesn't taste good.
Well, it's not alcohol. It's
Oh, okay.
it's called Feel Good. It's supposed to be like a alternative for an opioid. It's supposed to be like a mushroom type, like a liquid mushroom thing.
No, never heard of that.
It comes in like these blue bottles. You can get them at like the vape shop or whatever. But I don't know, maybe it'll be the new bath salts. Who knows? Used to be able to buy those in the gas station.
Says, can epilepsy cause you to sleepwalk? I have had sleepwalking accidents for a long time. I get up and walk around or start talking to someone, whoever's in my bed. Yesterday, I got too much. It got too much for my boyfriend. Where I opened the window to smoke, he said I could, I could have fallen out. I live on the third floor apartment on an apartment block. I have German windows, so they open so far out. Can epilepsy make you sleepwalk? First comment says
Yeah.
epilepsy does all kinds of stuff, all kinds of weird stuff to your brain. Sleepwalking might just be a seizure or postictal state. Like maybe you had one while you were sleeping. Another person says, I believe so. Sleepwalk and sleep eat, including non-edible items. And I am currently under investigation for TLE. Things that aren't edible. That's interesting. That's funny. Well, not funny, but
Under investigation for a what?
TLE.
Temporal lobe epilepsy.
Interesting.
Oh,
Putting it.
sorry.
Yeah,
They
it sounded
phrased
like
it.
they were being.
Yeah, I was like, is the law involved?
Yeah.
Okay.
So,
Okay.
I'm
They
sorry,
should have said
detective. I
waiting
swear
on a TLE diagnosis.
Yeah.
Anybody sleepwalking?
The sleepwalking itself could be a seizure. Um, from what I've heard, there's certain types of nocturnal seizures that can be mistaken for sleepwalking. So, yeah, I don't know. I had sleepwalking or a history of sleepwalking when I was a child, but I understand that when that goes away around adolescence, it's usually not anything associated with any neurological issues. So,
Also slept walk when I was a child. A lot. I woke up in the shower one time.
yeah, maybe it wasn't so disconnected as I thought.
Yeah, I don't know. I was fully clothed and the shower was going and I was in the shower sleeping.
That's pretty scary.
Well, no. I mean, it was more just inconvenient because I was drenched and I was uncomfortable.
Well, I mean, just having the water on while asleep is kind of a dangerous situation to be in.
Tony!
I love that your cat has a 4-letter name because that's usually me yelling at Jack. I'm like, Jack.
Yeah, he's like so sassy for what? It's not even time to eat yet.
I was just gonna add, it might not, necessarily be sleepwalking. It's just having a a seizure during the night. Like I've mentioned before with mine, I never remember the seizure. I never remember usually at least 15 to 30 minutes before or after. So, if something like that happens and it's, not one where it's like a grand mal or something and you're flopping around, then you might just be confusing it or, getting it mixed up with sleepwalking, where it actually just is a seizure, a seizure itself. Um, yeah, yeah. I from what I've had and the ones I've had in the middle of the night, and I've had people tell me things like, yeah, we had this full on conversation about this and this, and it had nothing to do with anything we had spoken about within 2 weeks, but for some reason you brought up this subject, and I'm like, oh, okay, if you say so. like, like what else are you supposed to say in that, as a reply to that?
You ever think that was your case, Pookie? Like a sleepwalk?
Sleepwalking? No, I never thought of that because
Like when you went to the other town and stuff?
yeah, but I had left work and I was awake. So when people seen me last, they said I was awake.
Well, I mean, like it's a seizure, but it's also, you know, like
Yeah,
people,
I was thinking maybe focal underwear.
yeah, complex partial, probably.
Yeah, that's what I was kind of trying to say, is like you and I and us here, we're very well aware of our situations. We've had many seizures and everything. If somebody's only had one, two, maybe never had one before, that's what I'm saying, is they may have confused, that's like them having that seizure with, sleepwalking, because that's a more familiar, I guess, term or, stereotype of something that you hear, somebody do in the middle of the night versus, a seizure, right?
Yeah. So we were trying to pick apart how long basically did my seizure last, because I left work and I took 3 buses and a train, and I'm
You
trying to
said it
figure
was
out
like 17 minutes or something, right?
17 miles.
Miles. Okay, there we go. My bad. Damn, so it was even longer time wise. Ooh, damn. Damn, man.
Well, since you're from around here, how about you leave Hayward and you make it to Palo Alto? I don't know how I got over there. I left. I don't remember leaving Hayward, so
How did you get like over the bridge and like every and like that?
I'm assuming a train or a bus.
Yeah, that's crazy. That's crazy, man. Wow. That makes me so like so glad that you were safe after all that, because that's a crazy distance, and to
Yeah,
do
when I
that
got off the bus,
by yourself while out of it, just wow, man. The kind of craziest thing I've done similar to that was I went to a Warriors game with some buddies of mine when I was, I want to say, like young 20s. And so, obviously, where that is. And like I said, I live in Fremont. So I didn't drive. I took Bart there. Some the fuck how I got back home. Like I left the game early on my own, took Bart, somehow got to the Union City BART station, and I randomly called a friend, apparently. This is what he told me the next day, and he drove me from the Union City BART station back to my house in Fremont. I don't remember leaving the game, being on the BART train, like none of it. Like I have no clue how the hell I got home without getting like robbed or just like killed, or there's just something.
yeah, I
And
don't
it
even
was
remember how I paid for the buses. or anything. I cannot remember. But yeah, beyond that, let's move forward. Oh, to the sleepwalking comments. Someone said, I think you can. My son, who got diagnosed a few months ago at 14, sleepwalks, and it was a part of his diagnosis. He once left the house in the middle of the night, so we had to put precautions in place. I used to live in Germany, so I know the windows well. But is this some anything? Is this anything you could buy, like a toddler lock or something they can't open fully? Or those locks unless they have hotels sometimes? Someone else says, I've come to conclusions that epilepsy can do anything. If our brain stops working correctly for even a few seconds, all bets are off. A few more. One says, the thing about epilepsy is I don't see anyone ever have the same story with regards to seizures, warnings, medications, or side effects. We thought that for 30 years I had a sleepwalking issue. It wasn't. It was after seizure behavior, finally diagnosed at 35. Uh, can you give yourself epilepsy? Mom has told me countless of times that my past lifestyle of drinking and weed and my ex-girlfriend moved across the country caused my epilepsy. I had my first seizure I was helping when I was helping her move. Whenever I hear her mention that, it irks me to the point of wanting to hurt someone, if not myself. On top of that, she keeps telling me it's a spiritual attack and with a prayer, it'll go away. I try to ignore her delusion around me, but it's aggravating when your whole life has gone to shit and you have to live with your parents now. Can you give yourself epilepsy? No. Wait, unless you hit yourself in the head or something like that. Thoughts, you
Yeah, I don't
guys?
think anybody could I don't think anybody could intentionally give themselves epilepsy.
Sorry, Kate. Yeah, if drinking and selling weed could give people epilepsy, then like half of the country would be seizing. Um, it's not, those two are not the drugs that really are so seizure inducing. Some of the weirder designer drugs might be getting into some more dangerous territory, but I don't think that's what the poster is talking about. Um, I mean, yeah, a simple answer to the question, no, you can't give yourself epilepsy the way that mother is hypothesizing.
Doing like drugs and like consuming alcohol can definitely lower your threshold, but if it's gonna happen, you you were already going to have a seizure at some point. Like what, like if the circumstances arose, I suppose, but like you already had epilepsy, it just hadn't shown itself. Um, I guess. And it like yeah, we had somebody on somebody asked a question a few weeks ago about like, do you think the fentanyl that I took caused my seizure, not epilepsy, caused my seizure? And it was like, yes, I do believe that this like crazy drug would have caused you to have a seizure, but like unless you have them again, I don't know if it's epilepsy because with drugs that strong, you don't know. Yes, but if it's just alcohol and weed, that didn't cause you to have like continuous seizure. Struck a nerve? What do you mean?
Gotta defend the weed.
Well, yeah, you gotta defend the weed, okay? But yeah, no, that was just me saying like, you know, it, those two things, I don't think were what caused them to have epilepsy at all. They already had it. It was just a matter of time before it showed.
Okay.
I mean, if you're like a super heavy drinker, there have been cases where, people are like heavy alcoholics and then they just like for whatever reason they have to like go cold turkey and they just stop out of nowhere. Then that screws their body up and people have had seizures because of that. But just because you go out and have, a few drinks with some buddies or something after work for like one or two nights during a weekend, that's not going to cause you to have epilepsy like permanently or anything.
Yeah, exactly. Yeah. If you're waking up and you can't get through, the first hour of the day, or you can't get through an hour throughout the day without having a drink, it's like, okay, you have a problem and your body's being
Yeah,
just
and your body's like, shaking, like you're like going through withdrawals and stuff, then yeah, then it can cause it.
that's a totally different
That's a
story.
whole different, yeah, exactly. Thank you. That's a whole different story. That's just what I was gonna say. But yeah, one or two nights out with some friends or something is not gonna
Yeah.
throw off your whole mind.
Anybody
There's some
else
comments.
or next one? Or does anybody else have anything or next one?
I was going to go through some comments.
Oh, okay.
One says yes and no. I triggered onset of my epilepsy with LSD, but it's highly unlikely that alcohol or weed triggered the onset of yours unless you were going wild. Basically, everyone has had a seizure threshold. Those of us with epilepsy have a low seizure threshold, and it's a spectrum within the epilepsy community. Our medications raise our seizure threshold while our triggers lower it. Alcohol is known to lower your threshold, usually during the hangover phase. Weed is known but generally perceived as a helper rather than harmful, but some epileptics have adverse reactions. So while alcohol and weed are unlikely to have caused your epilepsy, the use of them may have lowered your already low threshold, and having seizures make you more likely to have more seizures. Let me know if you need me to rephrase that.
Yeah, that's basically exactly what I was saying. Yeah.
Yeah, me too. Fully agreement or in agreement.
Someone says, I may have given myself epilepsy via head injury, not likely from drinking though. However, alcoholics who quit drinking immediately without tapering off are likely to have an experience seizures and other potentially life-threatening withdrawal symptoms. Life-threatening. One more. Head trauma and abuse of drugs and alcohol can trigger seizures, which may cause damage, which then results in epilepsy. Anyone else feel misunderstood for being too quiet? People often think I'm shy or uninterested just because I don't talk too much, but really, I just process things differently. How do you explain how this makes me? Just how do you explain
Uh,
how this makes me? Does it make
I
me
I don't think that that's a trait of their epilepsy because like I have epilepsy and I heard it described one time as like it was in a show, but my girlfriend agreed with it 100% because she was like walking down the street with you is like walking down the street with someone who is uh trying to get nominated for the mayor of nowhere because because I'm just so nice and so talkative to everyone all the time. And it gets me into trouble because I'll make a funny comment to someone and then they want to fight me. But, you know, um, then other times I have really great interactions. So, yeah, this if they don't want to talk to people, it's not because of their epilepsy. It's just their personality, and that's totally okay. You can be antisocial. It's fine.
That's what the comments were saying. It's all right. You don't have to talk. People say I don't want to talk all the time. I walk past people saying things all the time. Yeah, not the best ones, but yeah. So someone says, when is it time to hire a caregiver? Hire a caregiver. Caregiver. I am lost and so scared. Husband has auras every other week or so on average, usually lasting 1 to 2 days of multiple auras beginning in the morning. They lead to seizures unless he takes emergency nasal spray. He's on daily meds with but no improvement in sight. I'm able to I'm able to be at home now, but in a few months I'll be gone for 12 to 16 hours a day for 6 months. He can't be alone in my opinion. When when he has seizures, he stands up and walks around and breaks things. He could easily hurt himself from falling or broken glass, etc. I'm so worried. I have no idea where to begin.
First
That's
step is, well, clearly this needs to happen in the next, what did they say, 6 months?
yeah.
Yeah, so like first step for them would be to check in with their health insurance, see what their caregiver options are, and what they can afford to do, because it does seem like this guy does need a full-time caregiver if he's having, if he's breaking stuff when he's having seizures, and like he could hurt himself, so we don't want that, you know.
Yeah, I think it's time to get a caregiver now. I wouldn't even risk leaving him alone.
Yeah, I mean, and it could be like a part-time caregiver to sort of get used to him, and he can get used to them.
Or a neighbor.
A neighbor.
Give a neighbor a key every now and then.
I don't know. I wouldn't want to put that on a neighbor, like
Or surveillance.
Get a nanny cam.
No, there's regular surveillance these days.
No, sorry, that
Works
was
even better.
But I mean, like, if you're asking a neighbor to go to your house to check on your husband, who may or may not be having a seizure where he's violent,
Yeah.
I wouldn't want to put someone in that situation. You know what I mean?
Yeah.
I'd feel bad. If they volunteered, it's like, okay, maybe every once in a while, but like I wouldn't want to rely on them, because say they have something to do and they can't be there.
Right.
You don't want to you don't want them guilty for not being able to be there because you don't have anyone else.
Correct.
So
And you
yeah,
always want to keep the patient included. I was just going to say, you always want to keep the patient included on the decision too, so he'd be more likely to be accepting of anybody showing up if he at least got in on the choice.
yeah,
Understand why it's a better way to do it.
And that's why I think going like actual caregiver would be the best option for them. They just need to explore the options, because at least that person is getting paid to be there, and should anything go wrong, SUDEP, choking, whatever. Actually, I shouldn't say SUDEP, because, well, no, actually, you wouldn't want a neighbor to like find you dead. But like they're trained to actually deal with medical problems. So having a neighbor just check in every once in a while would put a lot more stress on my. If I were in that position, I wouldn't be like super confident leaving, knowing that it's just a random neighbor who's helping out. But if it was an actual caregiver, it's like, okay, I can trust this person to keep my partner healthy and safe.
Or there's an open apartment near me, and if we're both neighbors, we're both on here at the same time, we could save one another possibly, know what I mean?
Yeah, until the day comes where both people are having seizures at the same time.
I was gonna say we both
past
have
other
nobody.
in
So
the hallway and sit down in each other's living rooms.
Our
Turn on.
seizure periods are matching up.
yeah.
Oh yeah, I wonder if it's kind of like when women live together and their cycles match up. If like people were living together with epilepsy, if our cycles would match up.
I don't think
Sorry,
your hormones really do shit.
I don't actually think that's a real thing. It was a total joke based on like it being said a million times in media. It's like, oh my god, we're on the same cycle. Like, no, you're really not.
My sister's my caregiver, so there's that. But yeah.
Your
Me and that
sister
guy could be
who
caregivers to each other. He could be like, I need some help. Come look at me real quick.
and to be clear, Pookie, it's your sister who recognizes that you have a disability, right? Yeah.
Yes.
Sorry. That was uncouth. I'm sorry.
It's all right, Brandon. Yeah, so this I say it's time to hire a caregiver because I got a caregiver once that started happening. But then, uh yeah, just got a caregiver.
I didn't realize how many people were into hypnosis now for reducing stress. The original post was just asking, I don't like to go, saying they don't like to go outside ever for any reason, and they do have epilepsy. All the comments are explaining that hypnosis is something that might help ease your stress levels, that could be in turn a trigger of your seizures, but don't get confused that psychological versus the neurological condition of epilepsy is not going to be a long-term solution, basically. And yeah, there's a lot of comments on here of people vouching for hypnosis, saying it addresses behavior problems, and that does help the epilepsy. But
I feel like
yeah,
this
I didn't
would
think people
be
could
a
change.
case of hypnosis to deal with an agoraphobia like problem. You know, like if they don't want to go outside, it might have some connections to agoraphobia, which then the stress is now inducing seizures, I guess.
What's
Agoraphobia
agoraphobia again?
is technically just a complicating factor on a panic disorder. Like, according to the
Is it?
DSM,
Oh,
it's not actually its own um, diagnosis.
oh.
The
You
way
have
the
to,
poster describes it in this one is just saying they're paranoid of everything, thinking like
Okay.
they'll step outside and like a street light will fall on them.
Well, okay, so yeah, that actually makes sense with what Mark just said, where it's involved with a panic disorder. Um,
Or that could
I
also be an obsessive compulsive disorder as well.
isn't that, isn't there a huge panic aspect to that as well?
Yeah,
like panic if things aren't done, or like
it could be having obsessive thoughts about, going outside and whatnot.
hmm,
So
I
uh,
I would I would definitely connect
what
this
was
more
the
to panic
what was
thing.
the original post saying?
Saying that they were really paranoid to go outside and just asking others' opinions on whether hypnosis would help with the epilepsy, but also making point that they were really paranoid.
I think
Paranoid of the people or paranoid of the surroundings?
It sounded more like the surroundings because I think they did mention something about being injured by, yeah, worried about it getting out of hand. He walks into a pub and just sees everybody like start throwing up or something.
yeah, this is an anxiety and panic like issue. I don't want to say issue, but you know what I mean when I say it. Where this person like hypnosis would probably really help them in overcoming that fear of going out. It's not the fear of being out, or it's not the fear of open spaces, which apparently, like now I'm learning from Mark that agoraphobia is more the fear of going out into the open. Um, I think that's where their problem lies, is they need to sort of get past that issue first, and hypnosis would be a really good thing for that, because I mean, hypnosis is good for very direct solves. You know, like you're not going to get over childhood trauma by just being, you know, hypnotized into being like, forget about it. But if it was one singular incident that is causing you, to have a focus on this paranoia and this fear of going out, um, then yeah, hypnosis would be probably very beneficial. I mean, therapy too, but therapy would probably go along with the hypnosis, I think.
The most recent comment is saying, unfortunately, I've undergone hypnosis a few times, and it actually always triggers focal seizures 24 to 48 hours after. Don't know why, but it does.
Whoa.
Understand what
That
the
could be a trigger.
is. Are we talking like EMDR or?
No, they don't get really specific about hypnosis. Is that what you're talking about? Like what specific kind of hypnosis do
Yeah,
they
like
get?
what specific type of hypnosis are? Because I've tried EMDR before.
Yeah.
That didn't do anything.
No, they didn't get any more specific than that.
I've never done any hypnosis. Like, has anybody here had any success with hypnosis?
Nope.
I guess
Never
I should
tried
say,
it.
raise your hand if you have, because having everyone go, nope, 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 and have it all be muffled. Raise your hand if you
You
have.
try to make sure you're not getting scammed, you know.
There's
Well-
that too. Because when you get put under, you don't know what's happening. So you could just be totally getting fucked with.
That's
Well,
if you get
in order that there's been studies done on hypnosis and the effectiveness of hypnosis, and they found that hypnosis is most effective on the people who are already the most receptive to it. So you've got to be kind of
yeah,
already inclined to
I think
believe that
Yeah.
the hypnosis will
I
help.
think you have to like have sort of a placebo effect almost in your mind placed.
Yeah, if
The
you go into it with
work.
like a really strong skeptic, I mean, not
Yeah,
even
because for me, like
just
I'm more
an
of a
anti, like this is not going to do anything, then you can definitely just make it nothing more than sitting in a recliner for an hour with somebody
well,
talking to you.
You need to
I'm very
believe that
open,
it's gonna happen.
very
If
open
you
Yeah,
if you don't
you need
believe it's
that's
gonna
yeah,
happen,
you need
it's
to
not.
I'm
yeah,
very
you need to
open
be
to
receptive to the
things,
to
but I think with hypnosis you have to be a certain type of you just got to be a certain type of person. It just doesn't work on everybody.
Yeah.
Um,
No, that's 100% true.
I I think people who are more like who think more like logically sometimes may not be as receptive to it, but they also could be. But I think that it definitely just it depends on the severity and it depends on the type of person you are and how your brain is already and if you can kind of people effect that it's gonna work.
I never knew there were different like types of it. What are the different type like what's the differences between them and what would work better if there is one that works better for somebody with epilepsy?
I don't know. I did EMDR and I don't know what came out of that. I still have no idea what that
But
is.
what is that? Because
You
like I
just
said
follow
before,
you're just following someone's finger and
what I was gonna say is because like I've mentioned, I
I
can
don't
see in the
know.
back, I collect pocket watches.
There's
So to me, like I just think of like the stereotypical like in a movie, like
yeah, with
watch the watch. Yeah, like that's
well
all I know about it.
I've
I don't
also
want to be disrespectful, but that's yeah, I'm just saying.
I've also done one where this lady took me out into a middle of a cornfield with crystals and horses, and she said that she was gonna burp out all of my negative energy.
Burp out?
That that sounds
Burp out?
interesting.
Burp out, yeah.
God,
And we
Lufa,
said
you listened to a woman who said that she was gonna have you burp out
no,
something.
She was burping it out, not me.
Oh, she was burping. Okay, so
I
you
was,
didn't have to
I
sit
was
there and go.
no, I was just she was like, "Oh yeah, I can feel all of your energy," and I was like, "I have no idea what
And so like, okay, I'm here.
I,
Whatever.
I've tried a lot of different therapies, but there's just they don't. Yeah, I don't know. My brain likes to counteract them.
Only been to
They're snake oil. They're snake oil in a bottle.
Snake venom?
No, you know, like the old like stereotype, like in the 1800s, people would sell like traveling salesmen would sell like
Oh,
snake
I know
oil
what you're talking about. Yeah,
as like
I
a
know what you're talking.
cure for a catch-all cure for everything.
Yeah,
That was just the joke I was playing on. Sorry.
yeah. I definitely believe with like when it comes to like Earth and the different elements and being spiritualistic with that and connecting with the earth and your body. But when it comes to terms of hypnosis or someone else doing that to me, I don't know if it's because I want nobody to be hypnotizing me, because I don't want to be part of a cult at the end of the day or something. Um, but
Yeah, it's almost you want to have like a second person in the room that you trust, right? Just to make sure you're not getting
I,
like taken
mm,
advantage of or something.
I also just don't really, I don't really think it would work for me. I don't have that level of um, placebo in my mind to affect that.
Yeah, I'm not like spiritual or religious either. So I honestly I wouldn't give it a shot,
I mean, I've
to
talked
be
about,
honest.
I,
But
I want to try, uh, what is it called when they take the demons out of you? I want to do one of those.
exorcism.
I want to try an exorcism. Yeah. Just because I'm interested and like I want to experience it, see what, if it works, if something will happen.
If I paid for that, would you do it for real?
I would do it 100%.
That sounds awesome.
That's on my bingo cards. It's on my bingo cards. I want to get an exorcism and I want to go skydiving.
Okay. Yeah.
Sorry, I'm not laughing to be rude, but those are just like two like completely polar opposite like things to like have like on your like life checklist, you know, right?
Yeah,
Like
no, I think I'd be good after that.
no, they're both cool. I'm just
Yeah,
saying it was just like two like
no.
completely opposite things. That's really cool.
I mean, shit, I'll skydive in Italy and then after I'll go and get an exorcism done. Whee! Skydive
I was gonna say have a skydiving priest do the exorcism during the
while I'm in,
skydive.
Mhm.
so I
That
can really
how awesome would that
interact
be,
with all of
right?
the demons. Meanwhile, he's like, the second shoot isn't coming out.
He's like splashing holy water on your face as you guys are like
Yeah.
So,
Did you pull the chute yet? It's like, no, God will tell us when we're at the ground.
oh man, I got one. It says, it says, can I have alcohol? I
No.
recently, about a week ago, got on lamotrigine. It's about 25 milligrams. I was wondering if I'm able to drink on it as it's my friend's B-day and I have social anxiety that doesn't allow me to loosen up. I want to be able to drink a moderate amount, say maybe 3 drinks.
Tony.
Is that possible? First comment says, yes, I'm drunk right now. Second one says, I've had an issue of having a ridiculously high tolerance to alcohol, but tonight I've had 3 times triple, maybe quadruple gins and cider, a cocktail, and I'm at a social level.
I think that if you're moderating yourself, you're not really at a super high dose of Mecto, honestly. It really just depends on your body and if you think you can handle it. Me personally, I would have to prep myself days in advance so that I could train. But if it's just like a one-time thing, I wouldn't say it's like the worst no in the world, but
Yeah. A couple more comments. One says alcohol can worsen the side effects of the medication. And since nobody on this sub is a doctor, take everything as an anecdotal experience.
most medications, if not all, are going to have interactions with alcohol.
Mm-hmm.
So anyone can ask that about any medication. Zoloft to something with their blood sugar, whatever, I don't know. But even even vitamins, even vitamins, like anything can interact with alcohol. It just depends on your body. You just really have to know your body. And if you can handle it and how much you can handle and if you can safely do it. But not in a mean way, but don't ruin your friend's birthday party by having too much to drink and having a seizure because that's just kind of lame.
Yeah. Yeah. Have a seizure, that is lame. So, yeah, especially if you have one at my birthday and we could have prevented this.
Having seizures are lame.
Yes, very much. Says my son passed away from a seizure. We lost my son Wednesday. He was 29 years old. He was diagnosed less than 2 years ago, and this was his fourth seizure. He was overweight, and we were told that it contributed to his passing. He was diligent about taking his meds. He had an alarm on his phone. He would feel an aura before they happened. This one was sometime very early in the morning, so he may not have recognized it. He may not have recognized it and woken up to go to the bathroom or being half asleep. He was found by his brother that morning, and it was too late. We don't know when it had happened or when the seizure had happened. He never remembered anything from his seizures. It is my hope that he did not feel anything and did not suffer. I wish I could have been there for him more. Maybe if I would have heard him. I could have helped him, or at least been there with him instead of him passing alone. How do I deal with this? He was always a healthy growing up. We don't know why this developed so late in life. Please take care of yourself and for your loved ones. Before all that, the person said, how do I deal with this? I haven't lost anyone due to a seizure, and that is one of my worst fears. I don't want to leave my family due to my epilepsy.
Especially a child, an adult child. That's
Person
gotta be
was
so hard.
I think, yeah, you deal with this the same way you deal with any loss, you know? You have to grieve and go through the process of losing someone you love so much, you know?
Yeah, especially because of Sudat. Other than that, I didn't think about that.
Yeah, I think something that people don't take into account a lot is the SUDEP is like there's nothing you can really do to prevent that if it just happens, it's not anyone's fault. It just happens to be something that can happen, you know.
I wonder why the doctor suggested too that his weight contributed.
There's
Maybe they think
something
any extra stress.
Go ahead, Jeff.
There's something totally different about losing a child. It's not like grieving for a parent. You expect to lose a parent. When you're grieving for a child, a piece of your heart is gone. It's gone. And it's something that you think you grieve and you think you get over, but you never get over.
Well, yeah, you see a lot of those parents get divorced after they lose a child, and it's you don't see siblings divorce or anything usually after a parent dies, so I could definitely see what you mean. It's a different type of unexpectedness.
A void.
Yeah. Especially like I would feel for unless the father was the sole provider, I would definitely feel for the mother after carrying a child for in your body for 9 months and then losing them at any age would be gut wrenching, because they were a part of you at one point.
So a question here for us, Lufa. Contraception and epilepsy. This goes out to you lovely womb-having epilepsy havers. What contraceptives do you use? Because I'm about to go insane over here. My gynecologist is like, I don't know, ask your neurologist what works for you or doesn't. And my neurologist is like, go ask your GYN. So last year I did my research, figured that next to some IUDs, which my GYN refers to insert due to reasons, only gestogen, so some kind of hormone pill, works. I take lamotrigine and levetiracetam. I had some bad reactions to the hormone pill and basically suffered for a year. I had to stop taking it. Now that my partner and I are ready to take things a step further, I decided to try again. A month in, things are going south again. Looking back on how things went last time, I don't think it'll get better anytime soon. So here's my questions. What contraceptives do you use? I'm so scared of pregnancy that only using condoms just doesn't work for me, since as far as I'm aware, emergency pills also don't work properly when you're on anticonvulsants. And they already said they're planning on getting another GYN involved. They're looking for another OB. So Lufa, has any of your specialists given their opinion on this thing?
Well, my neurologist wouldn't know anything, but for me, I started with the Nexplanon, because I never had a regular period, so it was kind of hard to track with the pills. I started with the Nexplanon, which just goes in your arm, so she could try that out. And that lasts for a few years. I think 3 to 5 years it lasts, and it's just you don't even feel it going. It's very painless, easy. And then it just sits in your arm, and you don't have to worry about anything. There's not a ton of side effects. If you're looking for something a step further, if that doesn't work, then I would recommend the Mirena IUD, which goes inside of your uterus, I think. I found that really painful, but I think that's because I have something wrong with my uterus area, which is why it was 10 times more painful for me than it is for most women. But from what I've heard, it's either really painful or not painful at all. It just depends on your recruiter. But yeah, I would start off, try the Nexplanon. If not, you can have it removed at any time. And then you could try the Mirena. But I prefer, because you also have to make sure that the brand that you're using matters. Because when adding on a pill contraceptive to my daily routine, my OBGYN made sure that it was a certain brand, because different brands have different levels and different, types of product in them. I would just go for anything. But yeah, that would be my advice.
I got one here for Brandon.
Right on.
Brendan's
He,
AFK.
Yeah.
he went to go shopping real quick.
Okay, we can come back to it. Got one for everyone else. It says, does anyone else get myoclonic jerks from focusing too much or on new, complicated, stressful activity or tasks? I have tonic-clonic epilepsy, and this happens to me often at work, playing cards, video games, or when I do tasks that require a lot of cognitive effort on my
Yeah.
part. I never asked if it was something normal, and I would like to know the truth. Thank you very much for answering.
It's the myoclonic epilepsy. Anything cognitive would send my myoclonic jerks spiraling. So, which is why I use the example of any type of like quick routine, like a dance routine or something, would send me into a myoclonic episode. So yes, that is a very common, I think, trigger for myoclonic seizures in epileptics.
First comment says, yes. That's my main trigger. Totally sucks. Card games really do it for me. I don't play them anymore. What? A card game?
Yeah. Because Tony, do you literally like chill out, dude? You're fine. You're fine. You have a pouch. You're a big boy. When I would play some video games or uh anything that would require quick thinking or anything, like I'm sure if I had to play chess, that would kill me. I'm pretty sure chess would literally abolish me. But like pickleball, you gotta think real quickly where that ball's going, because they're hitting it right back at you. And then that means I'm a seize. And sometimes with card games, if you're just thinking too hard, depends on the card game. I like Uno, but if you're playing like something where you gotta like quickly grab something or whatever, then count me out, I'm good. I'd rather not. Sometimes the adrenaline kind of
Oh yeah, like
sets it off in a way.
some of the comments here. One says I have grand mal seizure disorder. Anything too stressful or that requires too much cognitive effort has triggered a seizure multiple times in the past. Unfortunately, I've also had seizure triggered from something that made me too excited, good or bad. Stress is one of my triggers. Someone else said maybe I try to change my way that I think sometimes because of even some things that might hint of a bad stressful for epilepsy. Change of posture or just grounding where I am and what is going on and what I'm doing. And then to think through thin layers of what I'm doing. So I might see the in quote lazy way to do it, but it might just be the right way. I guess the point is not to forget to think and just be. Painting my nails. If I do it quickly with a thin, dry varnish, it's fine. Anything else, I'm stuffed, and I'm too I'm too scant to keep trying to get them on because they grow too fast. Okay, so yeah, she can't do nails if she doesn't do them fast. Is it that hard doing nails, Lufa? She basically said one swipes. You're on mute.
Yeah, especially if she's doing tips. If you don't put those tips on the right way the first time, then you have to start all over. And sometimes of the nail polish, if you don't let that first layer dry all the way and then try to put even like a cover up on it, you're screwed up.
I just get mine done. I don't know how it is to do my own. I'm too lazy. I just I just get my pedicures done at a local salon.
Says ambulatory EEG on a roller coaster. I kid, but seriously, I might be one of the rare folks who have a proprioceptive, proprioceptive, or
Proprioceptive.
proprioceptus. Yeah, you said it. Or vestibular motion as a reflex trigger. I've had tonic-clonics after playing Rocket League and after go-karting. Gonna ask my spouse to take me to a mountainous car ride instead and play a lot of Rocket League badly, of course. I will ask the tech about roller coasters, though. Wish me luck. I don't wish to go back to the EMU. It says it's a question.
Was there a question? I didn't.
It said ambulatory EEG on a roller coaster.
Oh,
It didn't really seem like it had any
I
questions.
wouldn't suggest that.
yeah, it just sounded like a few sentences. I didn't hear a question mark in there. Was there any information they needed, or were they just describing an upcoming?
Sounds like they wanted everybody else's opinion on whether it's suggested that an ambulatory EEG on a roller coaster would be any good, and then they went into all that detail about their vestibular system issues. So that being the inner ear, it detects head movement and orientation. It's a lot about
Proprioceptive
balance.
vestibular. Okay, yeah. So I guess if they're the proprioceptive vestibular, if that's a trigger, then the roller coaster. I wonder if they have a history of going to theme parks and going on a roller coaster and coming off in the middle of a seizure. If that's what they're trying to do to trigger their seizures with this, as opposed to going back to the EMU again. Um, I would definitely prefer to go ride roller coasters over going back to the EMU personally. I think that's a great idea.
But with the
Uh,
ambulatory EEG on you?
yeah, I don't know
If
if
those
the
electrodes
doctors
come
would be
off,
so
though,
thrilled
it's a
about
total
it.
Yeah.
waste.
Yeah.
And not to mention, I don't know about anybody else, but you have to sign like a waiver and everything. And if it breaks or anything, you're pretty much
Yeah.
paying for the whole thing.
If they're comfortable with all of that stuff, right, and waiving all of those rights and paying for anything, and then still going on a roller coaster, then
It sounds like the arcade would be safe, but maybe not a full roller coaster.
yeah, I mean, I doubt the doctors would agree to roller coasters anyway, but it's worth asking.
Yeah.
Kind of a little side note on that. Do any of you guys have really bad motion sickness as well? Like, for example, any roller coaster that has a loop, I can't do it. I have a headache, nausea, I'll throw up a bunch of times. For example, like roller coasters that, go up and down really quickly, motion sickness, like the teacups at Disneyland that spin constantly, same thing. I can't do it. I don't know if that's just a me problem, or is that somebody that like a lot of got people with epilepsy have, or
I love stuff like that personally. So it isn't
okay.
it
That's
isn't
that's a
a
me that's
thing.
a me problem.
No, I've heard people who get sick from moving around and spinning and stuff like that. So you aren't the only one, but yeah, could be the medication, could be anything.
Yeah, because I've
I
been on
get
roller
like
coasters
the
before.
head spinning stuff a lot more easily, like just riding in a car going up, approaching a stop sign, and then when the driver is kind of abrupt with the stop, like the jerking head back and forth from that can kind of give me a little like twisty, spinny head feeling thing. Like,
Yeah, even being a passenger in a car through like kind of like a twisty, windy canyon can get me, a little nauseous. I was just wondering, yeah, if anybody else had it that like specific as well.
yeah, I think that in my case, it's due to the medications. I never had that before I started any of the AED meds.
Okay, yeah, I've had it ever since I was like a little kid, like years before I had my first seizure. So yeah, that's why I was thinking it might be something just separate, or if that was kind of like a precursor to me knowing I should have been keeping an eye out for having epilepsy or something. So
Hmm.
So this one says, ignorance is bliss. My half sister just told me I was kicked. No, my half sister just told me she was kicked out after being accused of abusing her frail mother. Totally feasible knowing her. And that this is much worse than my very recent epilepsy diagnosis. When I tried to explain that these two items shouldn't be compared and we should be there for each other, especially when we're both falling apart, she flipped out. Yesterday, when I answered my boyfriend asking how I'm feeling, terrible, he asked if I had anything to eat or water, as if I'm poorly due to neglecting myself, which is definitely not the case. He immediately tried to change the subject. I explained how that question made me feel dismissed and proceeded to argue and even yell at me. He said he asked that because he cares. I countered this with, did you care enough to read about epilepsy and educate yourself about what I'm going through? The answer was no, so I yelled back that maybe if he took time to read about it, he'd know I can't drink myself out of epilepsy. I'm not speaking to either of them at the moment. I'm only on week 2 of this, but I'm reflecting on treatment by those closest to me. I can only imagine heartbreaking dismissal everyone in this community is subject to, and I wonder what else is in store for me. How much worse can this get? So I'm assuming this person is fresh into epilepsy. That's what it sounds like.
I don't know if like I don't know the dynamic between her and her boyfriend, but I mean sometimes just asking if, are you hydrated and stuff is just I don't know, maybe he didn't mean it like you've dehydrated yourself into being epileptic. I don't know if he meant it like that. Maybe this person's just having a hard time like accepting it. And therefore is maybe pushing away what other people are trying to be supportive. I can see a little bit where I would be kind of annoyed with the sister, but I mean, I also just come from a family of you don't put your problems onto other people, and unfortunately, epilepsy is a problem, and so therefore, I would never expect someone right away to have all of the understanding that I do of my diagnosis and stuff like that. So, um, sometimes people just ask, have you drank? Have you ate today? Maybe he was gonna order you some food. Who knows?
And if she's just starting on medication, she might not be totally used to it yet. And mood changes, mood swings
Mm-hmm.
happen in the beginning.
Yeah, the mood
So she
swings.
might not even realize that she's just being way too sensitive.
Yeah, which is not, her fault, and is something that she, should, take a step back and kind of approach,
Learn what she's actually going through.
yeah, approach that and approach that with her boyfriend as well, so that he understands why she's acting the way she'll be acting. And if he's going to be a good support system during, because the med trials are not fun at all,
Right.
and probably, like, in my opinion, just as bad as the epilepsy. It can be just
And
as bad
if
as.
more neurologists actually approached a patient with this information, then I think a lot of people would have a much easier transition if they understood that learning about
Yeah,
all the effects are going to
really,
be like, yeah, not optional.
I'm really thankful that the younger, I don't know what he was, but he was like a step below my doctor, but above like the kids that he's teaching, I guess. And then maybe he's like what do they call it in med school or whatever, teacher. Tony. Um,
Internist or something.
yeah. He's definitely getting paid though, because he was teaching some of them like how to do some stuff, and like, because it was also like
Is he the
it's a
doctor's
school.
like grad student?
It might be because it's also like a school, downtown Chicago. So it's also they use it as a way to teach med students um how to read EEGs and stuff like that. So he was showing them my EEG and teaching them how to read my EEG. But he was very, and I wish, sometimes I just wish that my doctors were a little bit younger, because some of these older doctors really get on my nerves. Um, but he was very like straight up with me about the side effects. He was like, "You have a long history of mental health issues, so you need to be very aware." And he told my mom as well that we need to be very aware of the um, emotional challenges that it's gonna bring, and if it becomes too much, then I need to bring it up as soon as possible. And even with that clarification in mind, I think that my mom still didn't quite, and I still didn't quite expect how aggressive the medication can be towards your mental health, because I've been on a lot of medications, specifically for your mental health. But I've never had any affect my mental health the way that Keppra has. Um, that one's just a beast eater. That guy's a fucking beast. Kepra's a beast. So
Yeah, they never even tried me on Keppra because of my mental health history. They went to Lamictal first, and so there's like
I started
only a handful that they would even consider.
with
So
Lamictal, but it didn't work. It actually caused me to have more seizures. But when I was diagnosed, he kind of hinted in a way, like you could hear it in the undertone of his voice, that he was saying like, you just have to start with the Keppra in order for us to move you on to something else to show the insurance that you tried the Keppra. So it's basically just showing the insurance that I have been trying these lesser medications or whatever, which is why it's also helpful to get you know, in other aspects of life to get a genetic testing or whatever for medications, because that can really narrow it down quickly with when it comes to insurance. And so they can't really be like no, because it's shown that it doesn't um it doesn't process in your body properly the way it's supposed to.
So somebody else here is trying to come to terms with a lobectomy. When I first met the team at Krembil Brain Institute at UHN, I was told I'm only likely to get up to 20% further reduction in seizures for medication, and that I'd most likely be looking at surgery. At the time, I thought that was kind of crazy and brushed it off. My recent 3-hour sleep-deprived EEG showed near constant sharp inclines and even new activity coming from my right temporal lobe, previously only left and generalized, whereas the one in January only showed occasional mild waves. The recent one also showed focal slowing and worsening during sleep. I've gone from one full tonic-clonic seizure every 3 or 4 months to one every 3 to 5 weeks, and numerous partials, whatever you like to call them, a day. I can't babysit my nephew. I started therapy to help me process this reality and help me deal with the guilt. I've already feel like such a burden to my husband. He's in the peak of his career, and when I do have surgery, he'll have to take a leave of absence to help care for me afterwards. I know the typical, he married you for sickness and health, he loves you, etc., but I believe that he still think he deserves more. I had depression before epilepsy, so it's a battle. Anyway, needed to get this off my chest. Miss my independence so much. Thanks for listening. Maybe the surgery isn't worth it. If they're talking about lobectomy and it's not guaranteeing a fix, then messing with the meds and talking about every other surgery that's out there might don't go under the knife unless you're positive that's the right thing, unless you're both positive that's the right thing.
Yeah, I was gonna say that too.
Anything that's like internal or like really getting in there, definitely, unless it's life-threatening emergency, definitely take a moment to, you know, make sure everything's, because you also don't want to get the surgery when everyone's going to be stressed out, because that's not going to help your healing process. That's just going to make it harder. And if you're stressed out that your husband's taking a leave of absence and he's stressed out, you know, because you're stressed out, and it's just back and forth type of thing. That it's not either one of the person's fault, but definitely do a little research beforehand, or try a little something else beforehand, or maybe if you could, I don't want to say stick it out until his peak ends. I don't know if his peak is gonna end, or if his peak is gonna keep going. If his peak's gonna keep going, then just get the surgery. You don't know what to tell him.
Yeah, make arrangements. Those surgeries take a long time to plan.
I find that it's a little hard to. It's different from, you know, an epilepsy surgery, but with the ECT, I find that it's a little hard to heal when you're in an environment where people are, like, you can just feel the stress
How
radiating.
invasive is the ECT?
I would say that it's not a surgery, it's a procedure.
Okay, so it's not an inpatient.
No, it's, so you go in, you get put under, you don't need a lot because you don't need to be under for a long time. They target the area, they put on all little things, and then they force you into a seizure. And then you come out of it and you feel like shit. And then you keep going and you pray that it works.
That's rough. So do they go ECG when your EEGs just don't pick up enough?
Well, ECT is for
Oh, okay.
ECT is the forcing you into a seizure to kind of fix your mental health.
Okay.
Basically like kind of like shock therapy, but not shock therapy. It's but it's not a it's weird. It's because my thing is I think that so my therapist and my psychiatrist have been saying that it takes about like a year to get your memory back and to kind of get cognitive function back and to, properly heal from the ECT treatments because it is very invasive. They're forcing you into a seizure several times a week. And for me, it was
That's a lot.
yeah, especially with the underlying diagnosis of epilepsy that they had not diagnosed me with yet. And one of it's actually funny because I saw the guy today. He was wearing the exact same outfit he was wearing when he was doing my ECT treatment. He was the one that as I was going under, he was like, yeah, last time it didn't go so well. She was seizing too long. And he's like, we got to turn down a notch. I was like, what? As I'm going under. So that was a little traumatizing, but it I forgot what I was saying, but it was it the doctors are saying that I'm gonna get because I keep explaining to my therapist that like my memory is just not there, like my brain just doesn't work very well. She's like, oh no, the ECT is it's gonna and I'm like it's not the ECT, girl, like it's a mixture of the ECT and the epilepsy. I'm not, this isn't gonna go away. Stop telling me that. Stop telling me that my memory is going to get better because my memory is literally jacked. I had ECT done, and then you want to put me in this epilepsy game on top of it with these medications that give me serious brain fog. And you're gonna tell me that my memory is gonna get better in a couple months? No, baby, we're just gonna have to look at it straight up. It's not gonna get better. And it's been really frustrating me because I hate when people say that shit. Like, something that isn't gonna, like, it can, sure, my memory can improve, but it's not going to be better in the way that they're talking about it because they're dealing with a different type of patient here. I have epilepsy as well, not just the ECT. So you have just zapped out a large portion of my memory and my personality, and now I have epilepsy as well, and you're just expecting me to possess after a year I have my memory back. No, it does not work like that. I cannot remember jack shit, and it's been 8 months. We're almost at a year. It's been almost 9 months. I don't even know how many months it's been. But it's almost been a year and my memory is jack shit. It's gotten worse. So
There's definitely a difference between being optimistic and being realistic.
I got a question for Brandon.
being like a Debbie Downer, I'm just keeping it real with her. Like, you don't gotta lie to me. Why would I lie to myself? My memories. I basically have dementia. And Alzheimer's and dementia in my family.
Don't say that.
Same here.
It's not looking good here. I've got Alzheimer's and dementia that runs in my family. Both.
But we're doing our best. We're all doing our best, and that's what counts.
We're hanging in there. I got some memory while I still do.
We do what we can.
In 40s, who knows?
Exactly. We don't have to think about future us. Come on.
Exactly. She's like, where do you see yourself in the future? I'm like, I don't know. Hopefully I don't have a seizure and die, but I don't know.
If it happens, it happens.
Oh, girl.
That's
I stand by.
my reaction.
I know I already brought up Ted Lasso, I think, but I live by the Roy Kent. You live, you die, you're done.
T plus 5 minutes and 45 seconds.
Doesn't matter.
We just heard flight commentator Daniel Brunson confirm the successful
Yeah,
completion
so
of
Brandon,
milestones in today's flight. And
Sorry,
also,
Mark. Thank you, Mark. What's up, Poopy?
It says, my mom says I can get an electric bike. My brother and my dad disagree. Me and my brother go to the same school. We both ride bikes, but I figured it'd be faster if I get an electric bike. My mom says sure. My dad and brother said no. What's the difference between an electric bike and a regular bike? Either way, I'll get there. Just one is faster.
So it depends on the classification of the electric bike, because some are just pedal assist. But then you get up to the other categories where they are full throttle. That's more like having an electric motorcycle, that is in the gray area when it comes to
a lot of debate about that.
Yeah, exactly. So like
They're not
obviously
on the bike lanes, they're not allowed in the car lanes, and they're not allowed on the sidewalk.
Yeah, I mean, it's because if they're in the road, then they should be riding like, well, okay, so in
they need
the
a separate for them.
hang on. All right, now I'm gonna get all into it as a League of American Bicyclists certified instructor. So when a bicycle is in the road, it is considered the exact same as any other vehicle on the road. Any car, any truck, any motorcycle, we all have to follow the same rules. Obviously, a lot of cyclists are people who ride bikes. I shouldn't call them cyclists because, like, if you say cyclist, then you kind of get into like, all right, they're experienced, they probably understand, but you get some
the guys in the tidy whities.
Hey,
bike, sorry.
Hey, okay. It is called a cycling kit. What was that?
My grandpa used to do the runs and the marathon, the Boston marathons, in those really tiny shorts. So,
well, that's running stuff. That's different from cycling. That's way different. There's padding in cycling. Also, there's like
little butt pads,
shoulder straps, and shoulder straps, butt pads. Yeah, the triple pockets in the jersey. Anyway, shit. Where was I going with this? Fuck. Oh yeah. So you have the people who cycle, like who ride and they do the group rides, and a lot of times those people don't follow the rules because it's harder when you're in a group for everyone to come to a stop. I am not condoning this, but when you are on the road on a bike, you are supposed to follow every single rule and law that all the other vehicles follow. But when you start getting into the e-bike thing, they start swapping between, oh, I can ride in the road and the sidewalk and the bike lane, but also I can go 35 miles an hour. That does not connect. That doesn't work. So it's a lot of people who are very like uninformed about the rules,
It also depends on what area of land you're in, because it's different for every state as well.
That's true too. Yeah, it's like where I live.
Universal laws, but then there's also like state laws where, because I know in some states it's like they're more strict about some things, and some states they're less strict about some things, and
Yeah,
but I think
and also there's only like two
Because it's also with the scooters as well. They got the e-bikes and the e-scooters. Like those things fly as well. Those
So
they
the
go
scooters are actually more in the gray area. There's more laws around e-bikes than there are around the e-scooters. And the
e-scooters
e-scooters
fly.
are so fast, but also the wheel size it's so small that people crash on them all the time because they'll go to turn and they forget how
Yeah.
small the wheel is, and it's immediate jackknife over the
Yeah.
handlebar.
We have a ton of those little green scooters in
The
Chicago.
lime scooters.
Yes, and they go up to like 40 miles, I think. But
I don't think it's 40. It wouldn't go up
30?
to
40? I don't know. I see some people. I don't know. Some people have like some fancy ass bikes.
I'd say 25 max, but regardless.
I don't know. I've never ridden one, so I wouldn't know. But there are some that in my area that I'm in right now, where I live now, there are a lot of e-scooters. I don't see a lot of e-bikes, but more a lot of e-scooters. And when I tell you those kids are fucking whipping that shit, like 60 miles an hour. That shit's got a booster on it. And I'm like, whoa, where did you get that? I can't, that's, whoa, you can kill someone going that speed. Holy shit.
So
These people
thing I
like mob
guess
shit.
last thing I guess we can talk about with this before we move on is I will say this. It was 5 years ago. I was working as a bike messenger. I was downtown, and one day, me and my coworkers, we were chilling at our downtown hangout spot, waiting for like law firms to call us and like want us to deliver something, whatever. And we see this giant horde of kids, like teenagers, on bikes. Okay. Now, some of them were on their own personal bikes, but a lot of them were on the spin bikes. We were kind of like laughing about it. We were like, oh wow, that's wild. A bunch of kids on bikes, like just taking over the street. Oh, it's it's basically a Lime bike.
Oh, okay. Okay.
Yeah. Just one of those, app-based electric bikes. Yeah. And so we were like, oh, that seems fun, I guess. Cool. Next day, I see the news articles. It was basically a giant riot of teenagers on bikes where I'm not saying riot and teenagers on bikes lightly. They actually were surrounding people who were in their cars, not letting them move, and then yanking them out of their cars and beating them.
It's not like domestic terror. That would kind of fall into a form of planned domestic.
It's straight up assault. It's straight up assault.
You want to really get into the law.
And so for 3 years, the spin bikes and scooters were banned because of what those teenagers did. Yeah, it was absolutely wild. But they pulled a woman out of her car and beat her for just trying to leave her parking spot.
They have these kids out here.
Can I guess a few of the areas that might have gone down in?
What was that?
Can I guess the areas that might have gone down in?
Well, if you're gonna guess downtown in front of City Hall, then yes.
Okay.
You were not gonna guess that, were you?
They do this all over the area.
I was gonna say it was
probably
gonna be in like a major city, like in a major.
Oh, I'm in a minor league city. So Providence, Rhode Island is
okay.
we're in between Boston and New York in terms of like size. So we're not a
Yeah.
major city, we're a minor league city. You know what I mean?
So I've seen things like that happen. But in bigger cities, of course, like
New York
Let's
City.
go.
New York,
The,
yeah. New
the
York,
Wheelie Boys.
very,
The
yes.
Wheelie Boys
New
in New
York
York.
is notorious for stealing bike parts, the electric bikes,
I have a
people
bunch of friends in New York.
just fucking with you. Like in New York, it is a free for all. So you kind of gotta be prepared when you go down there.
Now let's hear about it in Cali.
You gotta lock your bike up in a cage and then lock
Well,
it.
I was just about to say, Pookie, you're in what? Not
Yeah, they aren't exactly stealing bikes. They're just going crazy with the bikes. They're on
Or
freeways.
they'll take the parts. They'll take parts off the bikes. They'll take
Oh yeah,
bridges.
They'll take
they strip them.
batteries. They'll take the engines off the. They'll take any parts they can get, and they will salvage it.
I
They
had a
will-
in Europe, what they're
$9,000
doing-
e-bike
Like-
stolen from me about 3 years ago.
Around here, what they're doing is they're going like thousands of kids just on bikes, and they're going on bridges and making videos and going on freeway exits and all kinds of stuff. In San Francisco, they just like take over thousands of bikes, like 5 minutes just worth them going by with just bikes, just kids on bikes.
I
And
got some really good friends in San
Like,
Francisco who ride, but they're in the fixed gear scene. So it's a little bit more like the skateboarder scene, and less like the wheelie boy scene, I guess. Where the wheelie boys will actually like take over a highway. Those kids are nuts.
something like that.
I never want to be in a ride with the
something in the
wheelie
water.
because they don't care about going like fast through traffic. They just care about holding up everybody.
Yeah.
I just want to go fast through traffic and make it so people will look and be like, was that a bicycle? It's already gone. I don't care.
Yeah, they were always doing that in San Francisco and Oakland on the freeway exits and stuff. Big cities. Yeah, just
Chicago's
careless.
much different from that. They're like everyone's flying at a rapid pace. Everyone is just like the second you're starting to head down to the city, like I just fear for my life because of the other drivers. The second I see any sort of like I hear any sort of engine rev or anything, I'm like, this is it. This is it. Because there's so much street racing and so many car meets and shit that happens down here, and the car meets down here are impeccable. Like people will get onto the cars, they'll do like full donuts.
Fast and Furious 1.
It's insane. It's literally insane. I'm like, what? They have bottles of Hennessy and Don Julio. They're like everywhere. Everyone's got a bottle. Everywhere. And
What is that?
people are just
Pookie's like,
going
hang on, where? What?
crowds
Where?
everywhere. And you gotta like, it's almost like
I need actual
it's almost
addresses.
playing a game of like trying to
Get the
dodge.
zip code.
It's insane. It's insane. It's like it's literally like it's insane.
What zip code is that?
Literally just Chicago. Just Chicago.
I've been meaning to get out to Chicago recently. My uncle lives there. I've never met him, and he has 3 adult daughters that are like all like around my age. I'm like, I've got to meet my family. What the fuck?
Do I want McDonald's or Wendy's? I know that's not great options, but that's what I'm feeling right now. So I don't know what to tell you guys.
I just had tacos and I'm still hungry.
Are we feeling McDonald's or Wendy's?
It's Taco Tuesday.
Wendy's.
I was just about to say, Angel, like when I was younger, I would always have gone Wendy's over McDonald's. Yeah.
I actually never knew Wendy's existed until I moved out to Illinois.
What the fuck?
There wasn't, I don't know, there wasn't a ton where I lived in New Jersey.
And
There
if you're going for
wasn't
burger,
any in
bacon
Jersey.
cheeseburgers.
Where I lived in Jersey, it was mostly like family-owned restaurants and diners.
Diners, yep.
Pizza,
Wait,
you know, the pizza
hang on.
place, you
You're
got your,
from Jersey, but you didn't know what a Wendy's was?
they didn't have
She's
any.
talking more rural Jersey, probably
Yeah, I
like
was
north
rural
or
Jersey, like in the trees, like in like
Oh, I
the
didn't
bay.
even know that there was an in the trees part of Jersey. Huh.
Yeah, no, there's we were by my grandparents had about 20 something acres of land because my grandfather's father used to he actually owned a private airport the some it's a private airport that people, I don't know, I think it's still open, but he opened it or whatever, so like any famous people would land there. But
Oh, okay. So it's like the 100 square mile of
it's like
Jersey that is trees.
yeah, but he had like his own area where he would like land. And my great aunt, Carol, she actually wrote because they have like those history books on each part of the USA, and she actually wrote the one for Mahwah, New Jersey. So she
That's
did.
really cool.
Yeah, she did all the information for that, because that's where they grew up. But it's super like I actually have the layout. You can't really see it, but right there is the entire layout of the process of it being built back.
I love
Grandpa.
connections like that. That's always like
Yeah,
great information, you know? Or
yeah.
no, it's that well, it's
But
great information, but it's fun information.
it was right off of this road, Route 20, I think. And you would go down, and they actually got robbed 3 times because of how quiet of an area, like how
Oh, they would
cut
just
off,
like
closed off. It
people
was,
would just hang
yeah,
out
it
waiting
was
for a
such,
car. Yeah.
especially in like the from like the um especially from the like 70s to 90s, like it was the perfect place to rob. Um,
Yeah.
so they had 3 robberies go down there, but they survived. Yay. But yeah, I grew up in rural Jersey for half my life, a little bit. Yeah.
You
Okay.
like rural Jersey girl.
Yeah, with
If I could,
The rural Jerser.
the diners,
Sorry.
the
If anybody
people
who
came
knows
out
30
north,
Rock,
where's the
rural
diners?
juror.
anybody can love the Appalachians.
I got something. Because I feel like my parents resent me. 19-year-old male came back from university 2 months ago. Ever since, it seems like they dislike that I can't live a normal life. They constantly mention about how I spend all my days in my room until at least 10. Don't have my life planned out and not doing anything. I spend all day in my room because I have nothing to do as my university is finished. I don't get up until 10 because I need as much sleep as possible. Otherwise, my seizures are worsened. I don't have my days planned in advance because I can't do anything unless someone will take me places as I can't drive. The other day, they started to make as much noise as possible at 8:30 because I wasn't awake yet, such as vacuuming, cleaning, and generally making a lot of noise, which woke me up. I, however, am lectured if if I wake someone up when they're gone to bed, it feels like, as a result, the fact I don't live a similar life to my brothers, male 27 and male 24, who have both had jobs since they were 17 and can drive. They consistently tell me to get a job, disregarding the fact that I'm having absence seizures at least 4 times a day. And when I was going to work, in a pub where my mom works at. They didn't let me, as if it was danger to myself and customers. Any ideas on what to do? This sounds like it's in the UK when they say pub and then they say university a lot.
Tell your brothers to fuck off.
Um,
Agree
yeah.
with you on that, Brandon.
Hey, brothers know their little brother.
Yeah, if they know you're having absence seizures, it's like they know you're like it's going to be very, very hard to keep a job with that if you're having them 4 times a day. So
Yeah.
the first thing I would advise is getting them under control.
Yeah, have a fully just like no holds barred conversation with your brothers, being like, you do actually realize what I'm going through, right? And if you don't, please let me explain it to you, because this is not something that I can just get over. You know, I have a problem, or I have a condition. There's nothing I can do about
Exactly.
it. You need to understand my like place in this as well.
Like they may look minor, but if it's still happening too many times a day, they can open up your neural pathways to lead to a tonic-clonic or grand mal.
Yeah, we were talking about that the other day. How, once it starts, it doesn't get better necessarily. It can be controlled, but it doesn't get better on its own. It can only get worse because your brain is actively, I don't want to say destroying itself, but I mean,
Short circuiting.
and
Actively
it
fucking up.
and when the short circuits and the fucking up happens, you know, our brains pathways are frying themselves. So our brain is working harder to replace that. It's like every seizure we have is making it worse, even if it's just a small focal throughout the day or whatever. But if you're having 4 focals throughout the day, that's a lot. And they should definitely check in with a neurologist. If it was like one every couple of days and maybe a TC every couple of weeks or whatever, then it'd be like, okay, yeah, this seems normal. Your meds seem to be working as best they can. But if you're having 4 focals a day, that's not normal.
They said 4 absence, right?
Oh, sorry, absence, not
Yeah.
focals.
Still seizures.
Yeah,
Still
still,
seizures, and
still, still a
they
seizure.
can be focal. So
Now, this person, I think we've talked about issues like this before. The title reads Using Epilepsy to Get Out of Stuff, but it doesn't exactly sound like they're doing that. It says, does anyone else do this? Now I've done this multiple times and I feel like an asshole for doing that. It's mostly to not have to go outside when it's scorching hot, to stop the why don't you get a license talk and when are you going to have children talk. Get people to stop trying to get me to learn how to swim. Or when I feel sick and sit in the bus and an older lady, not old, just older, tries to force me to get up. All right, so this one definitely sounds young. And this response sounds like they address every point. They're saying, not sure what country you're in, but in many, and especially the US, driving is an easy one because anybody with uncontrolled seizures can't have a license. Swimming is another one. You're having seizures, especially if you have the tonic-clonics. You don't feel safe. You can't feel safe. That's the only reason you need. Like, none of these things are resonating as like they're bad for not wanting to do it. And then the bus, oh, these people. I lived alone in NYC for some years and had fights on the subway with people when I'm like, dude, I already have 2 seizures this morning. If you don't have a leg, I'll get up. But if you're healthy, this is my seat. I don't care how old you may be, unless it's impairing your balance. And then peer pressure sucks. Ultimately, you have a health condition, need to make decisions to keep yourself safe while treating it. And even more so, epilepsy or not, who cares? If you say no, it's no. That's all the reason you need. Yeah, that one sounds like they it struck personal with them because they're saying they need to respect your boundaries, and that's what it comes down to, respect. You guys ever had family members or friends or somebody try to talk you into doing more, even though you know the seizures are too risky?
Over here, over here. Yeah. Try to use my age too. You are 36 years old.
You're the only mother those children are ever gonna have. Don't you want to be a better example?
She took me back from trauma.
Yeah, I wasn't looking to trauma dump, so I was hoping somebody else would jump in just then.
um,
Wait, hang on. What was the? I guess if you could do a quick summary, real quick on that one.
Yeah, the issue was on that last poster was somebody who they posted saying, has anybody ever used epilepsy as an excuse? But then the reasons that they give didn't rationalize as excuses at all. It was legitimate activities like driving and swimming that
Yeah,
epilepsy
that's
can obviously prevent you
Yeah.
from doing.
okay.
yeah,
Yeah, that's where I got
Agree.
confused because, like at first I was like, okay, one one time I did, but it was to get out of a haircut that I literally didn't have like the money to pay for, so I just tech and if I skipped out on it, I was gonna get charged like a cancellation fee. And so I
okay.
texted my barber to be like, hey, health wise, I'm not feeling great. I'm so sorry. This came out of nowhere. And she was like, it's okay, I won't charge you the cancellation fee. I was like, that's the only time I've ever done it.
Yeah, it sounds like the title, it makes me think that like uh an issue of like reading and emphasis, what they listed off. I think if anything, it sounds like it excuses, it's not an excuse.
So
You
they
know, they're
gave the
not,
examples of uh,
yeah.
they put quotes around do more with your life or something like that. So it sounded more of like a family influence and like peer pressure situation where if they say it's
Yeah,
too
like
hot, I don't want to
legit,
go out. Yeah.
like they've got legit reasons and their family are being kind of
Too
unreasonable.
pushy.
Like the way that the title was written out, it sounds like, are you using it to weasel out of stuff? Like Brandon had said, like, that doesn't sound like what I don't know. It's, the, I've got an extremely understanding family, parents that I live with, and my sister is an ER nurse. I think I mentioned that. So, in my case, they're all,
Pretty honest.
I don't really have any excuse. They all understand. My mom watches the podcast. So, um, yeah, I have no excuses. Um, they
Also,
all,
Angel, I'm with you. Where when he said that his sister was an ER nurse, I was like, wait, what? I don't know if you heard that, Mark, but Angel was like, wait, what?
oh yeah, and I stepped out on the patio here. I'm about to roll one up, so I kind of I have the volume lower.
Um, I've had a I've had a couple of long-term relationships since then. One, she was actually a nurse for a local school, so she kind of understood it. We had our separate issues and went our separate ways. The other really good friend of mine that was always there for me and understood it, she unfortunately had to move out to Texas for her job. Um, so basically, ever since then, I've just kind of given up on really having a close relationship. It's just too hard to explain the lack of work, lack of funds, being my age, living with my parents, not driving. So it just, yeah, kind of single. And if something happens, something happens. If not, then so be it. That's just life.
Okay, that's a way to go about it. How about you, Annie?
It definitely interrupted my career. Um, but for me, my divorce was the best thing that happened to me. As hard as that was, recognizing later that he was taking advantage of the epilepsy, and I don't know how to explain that. I'm with you, James. It's like too hard to explain, basics being taken advantage of during a seizure and married to the guy. That was the best thing. But I know the hardest thing for me was that I had to drop out of school. And I was so close to having my associates that I was able to get my LPN, but I never got my RN. And I was on my way. My plan was to get my DNP and to be a nurse practitioner on the doctorate level. So, yeah, the epilepsy definitely interrupted that. But over time, and especially here, you guys, I appreciate you so much um, for reminding me that I am a badass. Okay. I don't stop the fight until I win. And if I have to crawl through the flames, I'll get to you. I will get it. I will get there. And I didn't realize how tenacious I was until finally we got things working out. But yeah, it was my nursing career that I'm most sad about, but I still have some of it in my head. I have a lot of friends who are nurses, DNPs, other medical professionals, a couple of surgeons. I can say it now because he hasn't been my doctor for 5 years. Um, my doctor that I had in Buffalo that literally saved my life is one of my best friends because we worked together to get access in New York State um, because they legalized medical marijuana, but they wouldn't allow any dispensaries to open. And for 4 years, we're shaking the cages in DC.
So did you
So
have to do home grow then? Was that it? That it
yeah,
wasn't.
we did a lot of stuff. I'm part of what we call ourselves the grassroots underground. It's over. They can't get us for that now. But we did what we had to do, especially for kids. Little Charlotte was our biggest project, and um, that was the result of the grassroots underground. We knew that this worked, and we wanted to get it to people who needed it. And now that's a lot easier. But I was being reminded, it's like, how did you know that? I'm like, oh, um, I still pull my books out every now and then. Um, but I mean, we know more about our condition than our doctors do. And when you finally get one that admits that says you have to tell me what's going on so I can figure out how to help you. And I think that was a statement that totally turned my head. And it's like, I'm still feeling sick. I couldn't eat dinner. I was just like, the first bite, I'm like, no. I'll try some chicken soup later if I'm not sleeping, but I can't eat. I'm so nauseous. And, thankfully, this doctor is like, oh, I know what that means. That means we have to drop the Vimpat. And he didn't waste any time. It 20 minutes. Like if I look at my chart, if it was 20 minutes, that was a long time. I have never had a doctor respond that quickly. And he made it about this shoulder surgery because it is such a trigger for me. And he's like, I don't want anything to So I feel like he's taking care of me, but I would have rather had a career, but that's not what the universe had planned for me. Um, I'm right where I'm supposed to be. I just haven't figured it all out, But yeah, that definitely ruined things. I mean, passing tools over an open cervical spine, and I go over backwards in the operating room. That was the end, and it was like, oh shit, you know. And no better doctors to see that than neurosurgeons, and still didn't get that diagnosis for another 15 years. So that sucked. But definitely had to drop out of school. Looking back now, I probably would have had a lot of problems. I mean, I don't think I would have stayed on the dean's list. I would have passed, but I wouldn't have been where I wanted to be. And as far as working, we all know
But
how hard it
if
can be.
if you had insisted on staying on, you think you would have been able to push through with the epilepsy? Is that what you're saying there?
I
I just
don't
want to
think
make
I
sure I
could.
understand.
Yeah, I don't think I could have because that seizure changed a lot for me right there. And I literally forgot how to get home.
Oh
And
wow.
I sat in my car for like 15 minutes and then it hit me. And I'm like, instead of driving home, I'm going to go right to the registrar and talk to the dean. And she was like, I'm really sorry. I already got the notification. Um, you have to be alert, ready, and capable at all times. And I couldn't. But maybe a school nurse, maybe, but I had to finish school, but I couldn't. And that was in like 92, 93. But I didn't have that really bad seizure until 2007. So it took me a while, but still, I mean, I can let myself get really depressed over that, or I can say, I'm still using this. I'm still using that knowledge, and I want to be able to use it more, but it takes a lot out of me, and I have to be careful, um, especially now. Man, yeah, I'm feeling some side effects, and my daughter just gave me, I don't know if you guys have ever heard of cupping. Um, it's kind of a holistic technique where they take these cups and attach them to your skin and like suck the air out of them to create
The little,
pressure.
yeah, like
Yeah,
suction, like little
yeah,
shot glasses that and it
kind of, yeah.
basically,
Yeah,
yeah, I think
it's
I
the closest
remember
thing
seeing
to
something.
acupuncture. So we call them cupperonis because they look like a, a pepperoni hickey. So we call them cupperonis. And oh my gosh, she found trigger points that were giving me that headache. The headache is still there, but I can tolerate it. But she is amazing. Okay. I am so proud of this woman. And I know all I can say is I brought her here. She did the rest. I brought her here. And she is absolutely amazing. I can't put that gratitude into words, and she'll be poking around and working, and she's like, oh my God, mom. Yeah, yeah, it's that bad. And she wouldn't touch my arm. She's like, I'm not touching that. So she worked in the back of my shoulder and my neck, and it's really sore back there because trying to hold my shoulder out, it's like I'm worn out. And just before we did that, it was after I figured that I couldn't eat. And now I know why, because she ended up giving me a lorazepam. The dog started going a little crazy, just staring at me and like kind of whining and showing her bottom teeth. And I just looked at her and I was like, oh shit. I need something. And I knew CBD wasn't going to do it. So I took some lorazepam, so I'm feeling it. But that headache just keeps, yeah, it's my shoulder, it's all that crap. But
It just
she gave
keeps
me a good
coming.
beating. Yeah, it works. It works. But yeah, I miss it. I look at her and I'm like, you are completing my mission to care for others. So I can look at her and her career and appreciate how she's helping people and just kind of translate that and say, yeah, that's my girl. That's what I wanted to do. So she's finishing what I started, just in a very different way.
I think you shouldn't underestimate your own achievements with the activism and raising awareness. There's a lot to be said for that. The cannabis through the 90s and now with the epilepsy, hopefully we can really get some more people to watch this and understand what it's like. But
Mhm.
yeah, don't not all help needs to be hands-on with a nursing
Right,
degree. So
right. And
yeah.
I think by now I would have been disappointed because the way the system is working. I watch my friends and yeah, they're disappointed. I got a story today that a friend of mine is working on her internship for her doctorate, and she's a wound care nurse, and her supervisor made a huge mistake, and I don't want to describe it because it's very graphic. So basically, she has to go in on her day off and spend the time with the director to help this patient and write up the exit letter for the nurse that did that. It was an egregious act of neglect. I mean, I didn't finish school and I was like, wait, what happened? No, 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 no. She did that all wrong. And like, she's been there 45 years. And this nurse completely screwed up a dressing on a sternum. And yeah, the patient is in ICU on life support right now. So I don't know if I could have survived. I probably would have hurt somebody and got arrested if I saw stuff like that. Um, I don't know. My emotional control changed. Sometimes with each seizure, it got harder for me to stay regulated. I don't know if you guys experienced any of that, where those mood swings and medication changes. And yeah, I don't know if I could have done it. But thank you, Mark. You're absolutely right. What I do now is an offshoot of what I wanted to do. And we're still helping people. We're still getting them to the medicine or the medicine to them, and educating people. But I just, yeah, I literally have a spine of metal. I do. My cervical spine, 5 through 7, it's all titanium. Um, but yeah, I really don't want to waste any more time feeling sorry for myself because I didn't finish school. Because look what I have. I don't need the degree to do this. So yeah, I love it. And you guys reignited that for me. And I'm like, oh, just to be able to relax and know everybody here understands. We don't have to explain ourselves. It's like, no, I get it. I get it. And it's like, I can't believe I was boiling pasta 10 minutes before I had a seizure tonight. And I'm like, all right, we gotta talk. I can't do this stuff. But it's temporary, right? This is temporary. We're gonna remove a trigger. Should be all right. But yeah, that was it. It's disappointing, but medicine has changed, and I'm disappointed with that. So I'm actually, I'm right where I'm supposed to be, and I've accepted that. But yeah, my daughter definitely, she's amazing. She absolutely, and she was not just the cupping, but some really deep tissue release. And she was even like squawking. She's like, "Oh my God," yeah, this is really tangled up in here. So doing our best to get things moving, get the inflammation out. But my back is covered with cupperonis right now. And the Ativan is making my head swim. So I'll be all right. I'll be all right.
We'll be here.
Mhm.
You will be all right because you've proven it so many times before.
Yeah. Talking about some of the seizures.
You're my hero, Annie. And my
What's up?
I said you're my hero, Annie.
Oh, thank you. And you are mine because you're showing me what to expect. Those giant pills. I'm going to be cutting those because they won't fit in my pill case. So, yeah. But I just
Wait, the
thank you for that.
extopry pills?
Yeah, the
Oh,
150s are
okay.
they're
Give me a
huge.
moment. You'll see the 200s in just one moment.
Oh boy.
They're they're not circular,
No. So they go down easier, huh?
but they're still big. Yeah.
Oh wow. Yeah, that's kind of like the vitamin B pills that they give us. Have you ever had those? The prescription vitamin B? They're giant, and it's like swallowing a piece of chalk.
Yeah.
So,
I
yeah,
had to
Or you
take
can
it's,
put
them.
it in some warm water.
I don't know. I don't know. Um, that would be bitter. I like our B12 better. Okay. I'd rather have a gummy or a quick dissolve. But yeah, those pills, I'm like, it isn't. He's convinced it isn't the Xcopri that's bothering me right now. It's actually the Vimpat. So I'm not going to disagree because I started getting what I called Vimpat vertigo about 90 minutes after I took my pill. I was guaranteed to have an hour of vertigo. And I would just be like, okay, just sit down, stay down, you know. And I'm hoping that goes away because right now it's like exponential right now. I hate it.
The vertigo, that is a perfect word to describe what I was trying to describe earlier at the stop signs. When I'm riding in the car with somebody and they come up and they're approaching the stop sign and then they come to a full stop and like that jerk, that kind of makes my head kind of swirl. Is that kind of what you were describing there or what you were feeling? Or is it just, I think you're on mute, Annie?
Yeah. Thanks, Mark. Um, are you saying that when your head moves, you get that vertigo feeling?
Yeah,
Because
like
that's
when it moves abruptly, um, I don't know. When I was driving, I was always really gentle on the brakes and the stop coming to a gentle stop. I was kind of almost obsessive about it. So maybe it's just having to ride along with other people. I'm noticing that others have different styles and that's bothering me, but I'm wondering if on Vimpat you're feeling a similar sort of exaggerated
Yeah, it does.
slowing?
It does kind of feel like that. It's more like a double vision, dizzy, off balance feeling. I also have what's called BPPV. It's
I'm so,
benign proximal positional vertigo. I have that problem in my ear,
oh,
and so we have to fix that. Hopefully, we can. Um, and the way the
turning
crystals,
your head too
oh yeah,
quickly
turning my head,
causes
putting a dish up on the second shelf, I could literally fall over backwards sometimes. And now with all the inflammation in that shoulder, all I have to do is literally touch my shoulder, and I'm like, whoa, just moving my arm is enough to throw me off because there's so much swelling in here. And that's why I just took the beating with the cups, you know. It's like we got to get that out of there because I'm so dizzy. I don't feel safe. You know, when I'm afraid I'm going to fall kind of thing. But that is I think BPPV is more common than we give it credit for. So whenever you have a fall where you've either bumped your head or you know you've gone flat down on the floor or your neck got suddenly moved and you start having vertigo, you should most definitely talk to your doctor. I've lived with this most of my life and I didn't know that there was treatment to take care of it.
people just
So
assume it's normal and don't
yeah, I'm
mention
like,
it.
okay, I had a head injury. I figured it was just from a TBI, you know, but it is, but it's easier to fix than I thought. It doesn't require surgery. It doesn't, yeah, it's just positioning and yeah, I have a physical therapist that's going to do that for me. But the
Is
vertigo
it
that I
not
have right
something
now,
you can do yourself? Does the
you
positioning
can,
require like manipulation?
yeah, yeah, it's best to start with a therapist that does that. Um, because they have to move the crystals that are in the inner ear that are out of place and they can see what's happening better than I can. Like they literally watch eye movements, facial expressions, and that gives them little clues about what's happening. And we did it once. And when she brought my head back and then like tilted my head, I thought I was going to fall off the table and I jumped. And she said, okay, that's one. And that's basically the feeling that you get when it goes back into position. It's kind of the same feeling. But most of my vertigo right now is from the Vimpat. I've had that for quite a while. I don't even have to move. And I'm like, yeah, space cadet. But yeah, looking forward to getting this all fixed. It's like, okay, let's just stop arguing about lawsuits and give me the medical treatment I need. Yeah, Space Cadet Annie for sure. Man, I can't even begin to tell you the crazy shit that I've experienced because of that. And I'm talking throughout my life. So this isn't new, but they can still fix it or at least make an attempt. And yes, I will have exercises at home where you basically hang your head off the end of your bed. So it's like, I just want to make sure I'm doing it right. And I can't do it until she gets all of this back into position. So that should be easier after the shoulder surgery. Um, we'll see. We'll see.
I got something. Anybody on clobazam?
I was.
Maybe you can relate to this. It says, are there 20 milligram clobazam tablets unusual? My doctor increased me to a dosage of 20 milligrams a couple weeks ago. So I've been using up the 10 milligram tabs I have. Last week, when I saw that I would be out of this by the end of this week, I called Kroger and asked them if they could fill the prescription she had sent me, 20 milligram tabs. The pharmacist said they had to order, and check them out, with Saturday. Oh damn, she's not gonna have pills. Well, time got away from me, and when I called today, since the app has been showing awaiting restock, the person I spoke with, not the pharmacy manager, looked into it and said their small supplier doesn't get 20 milligram tabs. So it seems the only customer there has been prescribed the 20 milligram tabs. And now I'm wondering if those are maybe not prescribed as much as the 10 milligram tabs. Surely I'm not the one here taking 20 milligrams. How can you take yours, 2 10s or 120?
I
Yeah.
had a similar issue with my pregabalin. I don't know if you want to discuss that, but I was trying to get onto a 300 milligrams of pregabalin daily, and the controlled release was something that the pharmacy did not have. They did not order, could not order. They were in the middle of switching between two different suppliers, and neither supplier would order it for them. They wouldn't even try to get it, the controlled release. So it's definitely not as uncommon as they might think to be in a situation where the pharmacy is not providing the medication. It might not necessarily be that they don't have any other patients that are on a dosage that high. They might just not want to go through the effort of getting something that's a bit more unusual. So my doctor switched me to taking the pregabalin 3 times a day instead of the pharmacy actually going through the effort of ordering the 300 milligram controlled release. So yeah, it's my problem. So, adventures.
With clobazam too, that was one where I only had to miss 1 or 2 doses. I had to miss less dose before I actually had a bad one.
Anyone ever have a normal EEG but still have seizures or develop them in adulthood? It is, oh my. I'm gonna not go through the long ones right now.
Was that the full question?
No,
Or
sorry. That
huh?
was just me saying. Is having epilepsy considered as good health? I want to ask if being epileptic is considered good health. I don't want to be if anyone, because I'm trying to apply for a fully funded scholarship overseas, and I just want to ask the eligibility requires good health, and I'm epileptic, and I don't know if I cannot apply for the scholarship. Does epileptic mean good health? I'm not sure.
What country? I mean, it depends on how that particular country defines good health. That I don't know. Probably not. Just if it's for the purposes of a scholarship and it's for international students and they want international students who are in good health. I think that epilepsy would probably be a disqualifying condition, and foreign universities and scholarship entities do not necessarily need to abide by American, disability laws. The ADA does not apply to if it's a Chinese university. They don't care about American discrimination laws. So I would be surprised if they qualify, but I hope they can.
Think of it as if your doctor would write a note. Would your doctor write a note saying that you're well controlled or healthy in that sense?
Yeah, I mean, if they've got it really well controlled, then it's not likely that they're gonna have any breakthroughs, and they might be able to get the doctor to say something to that effect, that aside from, or that they're in good health now that it's controlled, or I don't know,
The same thing you're asking, Mark, is what somebody else asked, and the person responded, I just wanted to ask if being epileptic, but my seizures are under control, which means I rarely have seizures and on medication. Is being epileptic still considered good health? Or no, because that's the only health condition I have. I have good mental health and good physical health. And they're both, good mental health and physical health are perfectly okay. So I guess the seizures are under control. Yeah. Just the label of epilepsy, they can be like, no, you think so? They would think eventually they'd have to worry about taking care of you.
I'm wondering if possibly she said, yes, I have epilepsy, then they'd find a different reason to actually say no. Because that's happened for jobs for me lots of times where they give me a completely different reason, but we all know it's because I said I had seizures.
if you say no and then they find out after the fact that you knew that you did have seizures going into it and something happened, God forbid, then they might go after you for like reimbursement for whatever tuition that you've availed yourself to that point. Um, it's complicated. Knowledge should be easy to get. Why is it locked behind all of these stupid doors?
Someone in the comments says, I guess as long as you have controlled your seizures and don't experience side effects to your meds, then you're good. I wouldn't consider myself in good health because of how my brain fogged. Someone else said, is it just a checkbox? Yes or no? With no additional information? No required health form? That sounds way too subjective. Does scholarship mean something different? Like, is it funding for your regular studies? Something you can do without the scholarship or a specific program? I can't see a scholarship being allowed to discriminate on having epilepsy if it doesn't affect your ability to complete the task. Probably depends on where overseas it is. Would you be able to get your medication overseas is the question. You say it's under control, but if you're applying to some charity program in a developing nation with limited health care, then they could accommodate your needs. They can't accommodate your needs.
What was the the icebreaker again. Sia joined.
Yeah, Sia, what's going on?
Hello.
First time I seen your hair down.
Oh yeah, I just took a shower because apparently I threw up in my hair after a seizure, so
Sounds like fun.
yeah, it was.
The icebreaker today was
That was totally intended as a compliment, by the way.
Kate knows the icebreaker. It is
What's
What do you
what's
like?
the
Yeah, there you go.
best or most productive thing you've found about like the group chat or the stream?
I would say like when um yeah, I would say probably when we're asking, these questions and answering them and realizing what other people's experiences are. Um, we learn a lot. There's a lot of things that I did not know about beforehand that I've learned being on here and just listening to people's stories and their own experiences based on the questions that we ask. So I'd say that.
I think that's kind of the general consensus. Like everyone is sort of on the same wavelength when it comes to that. It's like knowing that you're not alone, that there are people who share the same experiences and, are there to help as much as we possibly can. We can only do so much, but we're always there for each other.
That's exactly right. And like reminds me of when I first joined on here, crying with everybody because I had been through a bad month and everybody knew what it was like. It was very healing.
I don't know.
Yeah,
I guess
exactly. See, I feel the same. I've only been on here like what couple few weeks now, and I already feel like I get more kind of I don't know understanding and respect from you guys out of explaining situations than friends I've known for like 5 years or so that know my situation, and I tell them about it, and they're like, "Oh, sorry that happened again, buddy. Okay, anyway, you want to go grab a coffee?" And then and then here with you guys, we can spend like 8 hours a day on a live stream talking about all of our issues and everything. So it's yeah, very very comforting to be part of this and have you guys around. I appreciate it always.
Yeah, that's what we're here for.
yeah. So I got something here. It says advice. So I'm just writing this as I need advice. So moving to after moving to Devon, I finally saw a neurologist for my epilepsy. I saw a male doctor who said to me that if he changes me from Epilum onto something else, that he would take my license off me for 3 months. I personally have never had to do that when trying new medication. Is this a thing? He didn't have any he didn't have any of my hospital or doctor notes for me, even though I waited 10 months to finally see him. And he also told me that I have to do pregnancy tests in my appointments. Is this true? He made me feel so uncomfortable as he did for the last 5 to 10 minutes is stare at me without saying a word. I didn't even know the appointment had finished. So I left. Now my partner has said he will go with me to the next appointment. Do I change someone to someone else or do I go with my partner to the next one to see if he acts the same? Any advice would be helpful.
Is this a neurologist or an OB?
Uh I remember just as much as you remember. I
yeah,
read it all.
we need more context on this one.
Oh, it does say I finally saw a neurologist for my epilepsy.
Okay, so
I
they
saw
were
a
seeing
male
a
doctor.
neurologist originally. Okay.
Okay, yeah. So a neurologist, I wouldn't understand why they would want you to do pregnancy tests every appointment. Like
Yeah.
for an OB, that makes sense. But for a neurologist, that makes absolutely zero sense.
Yeah.
The only thing I can think of is because of um epileptic medications can cause birth defects. So that's the only thing I can think of.
I mean, yeah, but even then, like,
It sounds weird.
yeah, if you ask your patient, are you going to be trying for pregnancy anytime soon, or are you actively trying with a partner? Then maybe I could understand that. But if they aren't asking that question and just saying straight up off the bat, you have to do a pregnancy test every time you come in here, then that's when it gets weird, I feel.
That's what weirded me out, I guess, too, is mainly the whole like they didn't even say that they were trying to have a kid. Why are they being pregnancy tested? That's
And
weird.
what reason would the doctor have to disbelieve just her word?
Yeah, it's like just at that. I mean, I don't know. It's a weird thing to distrust. Like, no, I'm lying to you about having a baby. Like, no, I would want you to know this information. You don't have to check me every time.
Well, and from what I heard from it, it sounds like she's uncomfortable with the male doctor, and this guy is giving off uncomfortable vibes without her partner there. So,
That's a good point. Yeah, I
yeah,
that part. Yeah.
I would say, I mean, whenever I'm uncomfortable with any type of doctor, no matter who it is, and this is why I specifically only choose female OBs, is because male doctors are just like this. I would switch doctors. But before you switch, because you waited 10 months to get to this point, take your partner in with you and see if that kind of fixes things. And if it doesn't, and he's still being a D word, then I would switch. Find a different doctor, because uncomfortableness with a doctor is any type of doctor is not it's not comfortable, and it doesn't make you feel like you're in a safe place.
So by D word, do you mean dick or douchebag?
Both, either one, both work.
Basically, don't you don't
No
you
need
don't
to
be
hide the
afraid to
words. Come on.
don't be afraid to shop for doctors. That was
Exactly,
a really good
yes.
point about keeping the next appointment, at least until you find a new one.
Yeah. Find the person who works best for you personally, because everyone's different, just like every doctor is different, because they're people and everyone's different.
Something I've learned too about doctors is that you can't go based off of their reviews. Some people will absolutely adore the doctor, and some people absolutely will not, because not every single doctor is going to work.
It's like finding a
Plus,
therapist.
yeah, right. Yeah, I'm hoping mine will be joining us next month. Um, I'm looking at Epilum. It's also known as Depakote. Um, Depakote is known for causing birth defects. So I can't be completely mad at the doctor. Um, because if you get pregnant and you're taking Depakote, you almost guarantee yourself either a miscarriage or birth defects. So his concern is appropriate, but maybe his words weren't quite right to make her feel comfortable. Maybe she doesn't understand exactly why. Because we know that these drugs can be dangerous, especially for women who are in their childbearing years. So, yeah, I mean, Epilim is that one drug you don't want to take when you're pregnant. So there's that. But like you said, Saya, we have to be comfortable with our doctors or we do not make progress. And it could just be a personality glitch or it can be outright D word. And yeah, I don't do D word doctors anymore. Doctor do nothings. Um, yeah, those are in my past. Hopefully. But yeah, I'm more concerned. that maybe she doesn't understand the effects of that drug if she were to get pregnant. And that might be why he's checking her, because he would take her off that drug immediately. So,
That's a really good point, and that can lead into, for all of us, and especially people who are new to this, that is something that, I'm sorry for the noise, that is something that needs to be asked for every medication. Even if you're not an epileptic, if you are on a medication, ask your doctor about the side effects and what it might do to you in the future, long term, short term, all of that. Because it's important for us to all know what we're putting into our bodies and how we can counteract the effects it might have on us.
100%. Yeah.
Well, and ask why they're asking for the test every time. I mean, don't be afraid to ask a doctor why they're making you do something. They should be able to justify it to the patient who's going through the procedures, you know. If he had said, you know, concerns about birth defects and something like that and had a good reason, then that's, you know, like you said, completely different. But you should be able to say, you know, justify it with the patient in the room right there.
Yeah. And I think too many of us are afraid to ask questions, you know. But yeah, I mean, usually with a neurologist or even an epileptologist, I don't know how often you guys see your doctor. There's that headache again. But it's usually like every 6 months, 3 months kind of thing. So even if he did catch a pregnancy, it would be too late to terminate, which raises another concern. That's why the doctor would most likely change her medication immediately. So instead of dealing with that, he said, if you're taking this medication, I don't want you getting pregnant. So, and we weren't there in the room, you know, so we don't know how he said that. And apply the emotions, you know what I mean. But yeah, it's kind of a funky question. There's another way to ask it that we don't always like to hear either, especially as women. Are you sexually active? I don't know if you guys get that from your doctors, but we get that all the time.
Oh yeah,
You
do
know?
Every single
question?
time, yep.
Do you guys get that
Yep.
question when you go to the doctor?
Oh yeah.
Yep,
No,
Yeah.
I get
not
it.
the women, then the men.
But
Do they ask you if you're sexually active?
Yes, they do.
Like on every visit?
no,
Yep.
Oh,
Yeah.
okay.
Oh wow.
Every time
Yeah.
I've gotten that question.
Okay.
Yeah.
I just had a
Before
physical and they didn't ask.
before each ECT treatment, they would have to they would have to do a pregnancy test on each of the females, even if they were in their 80s, to make sure that you weren't pregnant. One time, a lady came up to me and she was like, "Good news, you're not pregnant." I was like, "Okay, I'm not sexually active." I wasn't worried about it. But thank you.
Yeah, I'm gonna be
What is the
65 and he's
sex
still
life you
asking.
talk about?
I got something that says, am I wrong for thinking I shouldn't get treated like this? I had a tonic-clonic seizure and I was hospitalized in early 2025. I called for transportation to arrange getting myself to the ER ahead of time for my physical health, knowing I was going to have a serious health effects from prepping for another medical procedure, one being severe dehydration. On the way to the ER, I had severe tonic-clonic seizure. I didn't even realize I made it into the hospital until I was partially restored consciousness hours later, and I was in a hospital bed. Now, apparently, my father decided to call my brother and sister-in-law to have them come visit me while I was inpatient. I wouldn't have wanted this, but my family makes some irrational decisions regarding my health anyways. My father being an alcoholic doesn't help. After I got authorized to leave the hospital, I was still not fully aware and in postictal state. I guess according to my brother, I said, end quote, rude things to my what's it called, sister-in-law. Is that what SIL means, sister-in-law? I think
Yes.
so. Okay. It said I said some rude things to my sister-in-law. No idea what I said. I have no memory of what I could have said. They didn't even tell me what I told them. In any case, I told my brother recently I didn't even realize I'd said anything during the episode until he had said so. He requested I apologize to my sister-in-law. I felt no need to, given that I was given what I was going through and how I had no awareness of it or at any time remember anything doing or saying at that time. I apologize anyway. My sister-in-law decided to get very grouchy to me about it. She was telling me about her PTSD and brother's bipolar and everything they have going through. I hung up the phone after she was getting into her feelings, like belittling me and deciding I needed to go read her tone, end quote, read her tone and be empathetic to her. She sounded harsh. I have no words for that other than that I just was treated very unfairly given what I went through and what happened in my seizure. And neither my brother or sister-in-law seem to care. It impacts my state of consciousness, emotions, feelings, and everything. I'm not talking to them now, and I don't have real desire to. Am I at fault for feeling like I shouldn't be compelled to apologize for something I said I have no memory of saying while recovering from a loss of consciousness episode?
No, they sound like a problem to begin with. They sound like
You're
they sound like the worst. You that probably did you justice, if anything.
your brother and sister-in-law. Sorry, this is to the
They
OP,
sound awful.
not to you. But the brother and the sister-in-law suck so
Yeah,
hard.
yeah,
Holy
I
shit.
get that.
They can recognize that it came from a place of having a seizure and still not
Don't
forgive
think
you.
about them.
They're still going, oh, well, you hurt my feelings. Fuck you. Fuck your feelings. Sorry.
Right? No,
Sorry.
seriously,
Well,
I'm gonna bounce right off of that when I'm sorry, Lufa, but
okay.
when people say you need to read the room and check my tone, check my mood before you say something like that to me. And I had that done to me so many times that I'm like, you need to remember that I have epilepsy and you need to understand the type of epilepsy I have before I remember anything about you from now on. Don't ask me to do something that you already are not doing for me. And I know how that sounds, but there are different ways to say it, but that's my way. It's like, wait a minute, you're wanting me to make you feel better and notice you and remember these things about you when I just had a medical emergency?
She wants to make the moment about her because she sounds like a narcissist.
Oh, yeah. I mean, I'm careful with that word because I have them in my family, real diagnosed
The main
NPD.
character syndrome
Oh
Wait,
my
I
gosh.
has been
feel like
real.
if you don't have a narcissist in your family,
You
you
don't have a family.
you don't have a family. Yeah, like my dad is he is an Olympic level narcissist.
Olympic level, huh?
But it was the
Like my
best
ex.
it
Yeah,
was the
sounds
best phrase I could use to describe it. Where I was like,
Love it.
this really describes it perfectly. Olympic level, you
one
know.
time someone's like, oh, well, have I ever been around a narcissist before? I'm like, haven't we all? Like,
Yeah,
haven't we
yeah,
all grown up around like, wasn't that just wasn't that part of the plan? Isn't that how we
right.
learn?
And they're usually the bullies, right?
Yeah, they pop up
And
anywhere.
yeah,
life has probably met more than 1 to 5 narcissists. You probably met more than 5. Maybe just at the 5 you live in a small town. But maybe more if you do live in a small town, because that could also mean
I have that many in my family. Okay.
yeah.
No small town. Yeah. Yeah.
Today, today I actually texted my father to be like, "Hey, I applied for a new job. I sent my resume and my cover letter and
Good
everything."
job.
And it's to be a student service coordinator at a mortuary college.
I hope that goes well.
$60,000 to $70,000 a year, and it's completely remote. I hope it goes well as well.
Yeah. Go Brandon.
But I texted my biological father to be like, "Hey, I applied for a new thing." You know what he sent me back?
Fucking
"Oh,
loser.
that's awesome. Guess who I did jujitsu with the other day? My good friend Forrest Griffin, who I know who he is, and if any of you who know MMA, like, or if any of you know MMA, he was a very like notable fighter, like 15 years ago." And he's like, "Oh, I was just rolling jujitsu with my good friend Forrest Griffin, the MMA fighter." I'm like, "Yeah, that's not what I was." Okay. Olympic level narcissists.
You're like, okay, yeah. So
about them Lakers.
When you've been through enough of that shit, you start to stop mincing words with them, and then you realize that nothing that you can say or do will ever be anything but trash compared to them.
They will always one up you. We've had some people try and join we've had some people be on our chats or our streams that have been that way, where they just want to one up people all the time. Right, Jack? Yeah, my buddy Jack over here agrees.
I think that anytime someone tries to compare and one up, or especially when it comes to an illness, it's just kind of like, what are you doing?
It's more showing of their own personality.
Yeah, it's like
that
It
point
usually makes me
where
wonder too if they have it as bad as they claim.
yeah, or if they're just looking for the sort of sympathy, attention aspect.
yeah, there could be
Yeah,
several.
with invisible
As, like,
disabilities.
do they have the
Well,
proper
yeah, there's that
support
too,
in
Mark.
their
Yeah,
life?
the visible aspect.
They may also be. Some people do also push it because they don't have that kind of support in real life, so they tend to not realize that when they've taken it too far and made it too much about themselves, because they're looking so much for that comfort, and they might find a place where they're like, yeah, this is it. But then they end up going too far, and then it kind of shows like, all right, you still have some work to do on yourself. And
I think that's really what it shows, is like they're looking for the validation, but what they really need, the people who this happens to, and it's not just, in our chat, in our, streams and stuff, it happens with everybody. When people are
Any
looking for
community,
validation
for sure.
for their, like, their problems so hard, it's like, okay, you need to see a therapist, because they are the only person who's actually going to help you be able to work through this internalized issue that you have, which is not just about what you're going through. It's clearly something else as well.
does anybody's tip of their nose get really itchy sometimes?
Yeah, all
Mine
the time.
does, right here. I actually
Yeah.
have like a couple scabs on there right now.
Yeah, mine kind of has a scab from itching it so much.
Yeah,
It gets like the tip of my nose gets super itchy. Brandon, yours does too?
Tip of your
Yeah, it's
nose
like
is like it's
I've been right
prime,
there.
like the sun is gonna hit that so much, so the tip of your nose is gonna get dry as shit.
That's you know what, that's probably what the little thing is. It's probably like a little blister on my nose since I'm so
Yep.
see-through.
Also,
Throw
too,
some aloe on there.
for women, you
Yeah.
can get
I figured it out.
if anybody doesn't know, for women, if you have endometriosis, you can get endometriosis of the skin, and it can be very itchy. And I have it on my cheek and my nose.
Yeah, sometimes I get, although I think part of that might just be the cat fur. So, I don't know. But the tip of my nose gets like super itchy and I can never get it fully itched. I just keep, so it looks like I kind of look like a Coca-Cola addict, but I swear it's just the tip of my nose is really itchy for no
Just be
reason.
careful if you try to lotion it, because regular lotion for the face never worked well
Well,
for me. I always had to get actual face lotion.
don't get me started on my face routine.
Dude, there's actually, if you can buy, there's stuff on Amazon. It's called, this is gonna sound hilarious, but it's called nipple butter.
Nipple butter.
It's for a reason, because it's for pregnant mothers usually,
It's
but
made from breast milk.
if you use it on your skin, on your face, oh my God, it heals everything so fast. It
Oh
is
my,
amazing.
write down that. What is it called? Nipple milk?
It's called nipple butter.
Nipple butter.
Yeah.
Same thing. Nipple butter.
Who hasn't searched for nipple butter before? I mean, right?
Right? That's like the
Pull
most
up search history.
search
You
history.
gotta do it.
Yeah, while you're there, look for
It's
lid lube.
totally
I
normal.
mean, lid lube. That's a
Yeah.
stoner's dream. Yeah,
Tony,
it sounds crazy, but
you're
yeah.
not today. You're a naughty.
I use saline on a Q-tip. I have a scar inside my nose that my dermatologist is going to, he can't completely remove it, but he's going to take some of it off. But he's got to knock me out. And I can only do so many of those. But I'm going to try that nipple butter, man. I
I,
know what it did for the other parts that I needed it for. Yeah,
I saw
lanolin, shea butter, and magic.
I
But
saw that
yeah,
Yeah,
woman.
it's so good. It's exactly like breast milk almost.
Oh,
It's so healing.
Wait, Annie, did you say you were using saline?
yeah, just salt water and a Q-tip.
Oh, okay, yeah. The last time I had saline in my body was because I got maced.
Oh shoot. Oh shoot.
this
Ouch.
woman was using like 91% alcohol on her to clean her face, like
Ah,
every day to clean her face. And she's like, "Look how clear my skin is, guys." And all the comments are like, "Probably because it's scarred." Like,
yeah.
it's
Wait,
probably scarred and burnt because she doesn't wear sunscreen and she uses alcohol to clean her face and she's got tattooed on makeup. And so I'm gonna stick with the comments too that don't follow her routine, and her skin is definitely scarred because there's no way that, or like she's got skin of steel because
Dude, just using hand sanitizer dries my skin out. Like, what
bleach.
the hell?
Well, and then she's like, I just use whatever dollar store lotion I can find. Sometimes I use, she's like, sometimes to wash her face, either uses hand soap or if she runs out of hand soap, which, like, how are you running out of hand soap? She uses shampoo. Like, babe, come on. Come on. Come on.
Hand soap
I
and
mean,
shampoo are not the same.
I can't talk crap on that because I do just wash my face in the shower, but
I mean, I've washed my face in the shower, but I've never washed my face with shampoo being the base, like my base. Like I'm going into it with the intent of washing my face with. There's been times where I've had to wash my face with products that I've not wanted to, but I'm bougie when it comes to my skincare routine. That's just how I am.
Gotta be.
But the face soap mixed with the alcohol,
Mm-mm,
uh,
mm-mm.
it's just like my skin's
She's
so
gonna
clear.
have
Like your skin is soft.
creepy, wrinkly skin is what she's gonna have before
Oh
she
my
hits
god, it's
40.
like a burn victim.
Yeah,
Yeah.
that's.
And when she
I
goes
mean, witch
like
hazel is.
ages,
Oh God,
it's gonna be freaky.
no. I mean, I'm still faithful to the Dove bar, and my dermatologist is fine with that. But it's the other stuff I put on my face after I wash it that's making the difference. And you can buy stuff on Amazon that does this stuff. So why use, I mean, I clean my pipe with 91%. Okay. I would never put that on my face. Have you ever gotten that on a cut or a brush burn?
I
Stick
try
the
I try
seasoning.
to I soak my bongs in like
Yeah. 91 and kosher salt. That's how
yeah,
I clean my stuff. Or
yeah.
if I want to go real cheap, I go to the dollar store and I buy
Like,
awesome. Okay. Just don't dump that stuff down the drain unless you want to pay a plumber every couple of years to take that trap out and get the resin out of your trap. I learned
I'm
that.
like, here's a gift for you, by the way.
Oh yeah.
Go take it
And
when you get home.
I'm sitting there and the plumber's taking my bathroom sink apart because that's where I cleaned my stuff. And he shows me the trap and he starts dumping it. And I'm like, what the heck? And he's like, come on, I can smell the weed. Just don't dump it down the drain. If you're cleaning your stuff, dump it in the trap
Yeah.
because it that resin stays in the drain
Mm-hmm.
and
Fix
creates its
all the
yeah.
stuff.
Oh yeah. And I'm like, man, too bad it's not reclaim. I can't smoke it again, can I?
No, right? That's
You
every
know? Right. It's like, oh, let me add some
wait,
ISO to that. See.
use that at all. It's trying to reduce
But
reuse.
no, I would not put that on my face. No.
No, there's probably chemicals in that now.
God.
But that I would never put that on my face. It's literally burning. That's awful for your skin. That's
Yeah. No.
again.
I would not.
I
No.
feel bad for her skin. I'm glad I'm not her skin. I would hate to be her nose.
All right, I got something. It says 30. I'm a 32-year-old and I was admitted to a hospital when I was 22 due to status epilepticus on an absence. I started feeling weird one day at work, went to the ER and they told me it was just vertigo. Went again the next day and they told me it was vertigo again and gave me vertigo meds. On the third day, I went for a nap and when I woke up, I couldn't talk normally, just very slow. My mom rushed me to another ER thinking I was having a stroke. And when we arrived, my pupils were not moving, so they admitted me to the EEG. Admitted me, and the EEG revealed that I was having epileptic activity. Woke up a couple days later. I was diagnosed with epilepsy, despite of not having previous known episodes. Due to severity, I took Xebanix and Briviac for 5 years or so. So after trying around with 6 meds due to bad side effects, to be honest, I don't even remember or know if any of them worked or not. Since then, I have little moments of absence, but nothing else. I don't even realize I have them until somebody clicks their fingers. My EEG that I have every 6 months is usually normal and says interictal epileptiform paroxysmal. Somebody please know this word. Paroxysmal.
You got it.
Paroxysm.
Paroxysmal.
Yeah.
Somebody look it up. please, because no one knows that word.
Something that occurs suddenly and
Intellectual
intensely.
epileptiform, paradoxal activity in bilateral temporal regions, predominantly left-sided, with mild diffusion to frontal areas. That's one type of epilepsy. And sometimes says that there is no epileptiform activity. It depends a bit on where they go to take it. The neurologist told me this means that there are little currents that should be there but are not bad per se. When I asked if I should go take my meds, even if it doesn't affect me consciously, she told me probably, but it's your choice. And I chose not to because I fear the side effects, especially when I don't really have side effects apart from falling out of things falling out of my hands random moments. I think that just might be me clumsy or having little absences. What would you do? Is it bad? Is it bad for the brain to live without meds, without these test results? If not, taking meds is bad for my brain long term, I will take them, but I don't want to if it's needed, as sometimes the EEG says I'm okay.
I mean, there's the whole argument that you could say here that if you're seizing, then your brain is going to learn new ways to seize. I think I'm saying it right. I don't know if I am, but we've talked about it before that if you're not being treated, then you're probably only going to get worse.
Progressive.
The brain is just, it's degenerative, you know, like the more seizures that we have, the worse our brain is going to get. That's not something that we can deny.
And then also too, if you are only having like one specific type, I think this person said that they were having absences, then, you know, who's to say that you're not gonna have one day where you start having a new type? And you never know.
Yeah, we were talking about that earlier, exact like the exact same situation. Someone was like, "Oh, I only have focals. I should be fine." But we were like, "No, that could lead to eventually being TCs."
Well, yeah, because one part of the brain, then both sides. I mean, that's what happened to me, and I didn't even realize it. I had no idea that I was having focals, and then, you know, surgery happened, and now I have TCs. So you never know.
Exactly.
One of the comments here says, I've only had focal seizures, but I strongly recommend to be on medication. These absences are still localized seizures. These can spread to TC seizures. I was very, very reluctant starting medication, but I found I'm actually a lot better on meds. The doctor also said it's up to her. So do you think, like, if he says that, that means you could possibly go without? Or does that
I
just
mean,
mean
that
he
just sounds
thinks
like a
that's the end?
bad doctor, I feel like. They
So the
found,
doctor said that it's up to them, or
Yeah.
the doctor said that it's up to them, the doctor.
It said, when I asked, should I take my meds, even if it doesn't affect me consciously, she told me, probably, but it's your choice.
I mean, that just sounds like she's saying you should take your meds, but you can legally decide not to if you wanted to. But like that doesn't mean that you are being actually given the choice not to. You're just deciding to live with it rather than have the possibility of getting better on medication.
That sounds like a weird response from the doctor.
Well,
Like
it's
Sia was saying, you know, it sounds like you need a new doctor.
it's important to remember that's what she remembers the doctor saying. That's not necessarily what the doctor said. So I don't know. If the
We could
doctor
start weaning
did
you
not
off if you
drill it
want.
into her head enough that, you know,
Another comment says, so
I
the
don't,
brain gets good at having the seizures and they can develop into a tonic-clonic if you just let it go. Plus, you never know when it'll happen. It's like having a bomb in your head. I would just take the meds and keep getting EEGs. If I stopped having abnormal EEGs, then I would wean off the seizure meds.
Who's to say that the seizure meds aren't stopping? You can wean off, but if the seizures start up again, then was it worth it? I don't know.
If you find the right dosages and the right medications, I think that it's more worthwhile to, I mean, we all hate being on medications. All of us do. We all have bad side effects, but it's better to be, in my opinion, on a medication that you may not fully like than to be seizing all the time. If you can find that right combination, then you should stay on it.
I won't discount also the weaning off, like, or not weaning off. I should say weaning down. Like, if you need, 1,000 milligrams twice a day of your pills, but you can wean down to 500 milligrams and feel better, like head wise, um, and not have the side effects be as harsh. It's like you're still safe from having a seizure, but also you're not feeling the side effects of meds as much. Yeah, it's like work with the meds as much as you can and do the best you can to cut down, but you need the meds.
I actually met someone, well, I didn't meet someone, but my husband met someone who has epilepsy, lives nearby us. And he's had it for 40 plus years. And I shared his book on here. He reached an age where his kids were grown up, his his wife passed away, and he no longer wanted to deal with the bullshit of taking the medications. So he got off. And in his situation, he was having TCs, but the medications, having been on them for so long, they did actually stop. And once he got off the medications, he was only having absence and focal seizures. So he told my husband that at the age that I'm at, I'd rather sit here in my chair, have a seizure, and then smoke a bowl afterwards than be on the medication still. Like in that kind of situation, I feel like it makes sense, you know? You don't have anything that you have to keep up with. You are older in your years, you may not want to keep going with all of the side effects. But if you're young and you still have things that like, responsibilities, I mean, in that kind of situation, I think it's better to let your brain rest with the medications if they are helping than to get off and decide not to take them. So you have so many years where something could go wrong.
That's actually a really interesting point. That I don't know how many of us like would be able to I don't know, see the effects of because it would mean just basically hopping off your meds, and like I wonder because I know when we are on the meds, not taking our meds can cause a seizure, but it's due to not taking your meds. It's not because that like a seizure was going to happen anyway. It's because you didn't take your meds. So obviously, like weaning off and stuff is hard, but I wonder like how many of us would be better or worse off if we went like no meds. You know what I mean? I'm just curious. It's not something we should experiment with at all. Just a curious thought.
I think we should
I wouldn't have
experiment with
tried
you
it
first.
myself.
No, I'm not gonna.
I was gonna say get an RNS first.
Well, actually, I've already kind of been in that I've only been taking my 750 in the morning, and I don't feel great at night. So, like right now, don't feel amazing. But when I go to sleep in like an hour, I'm gonna wake up at like 5:40. I'll take my pill and I'll feel good for the rest of the day.
I got you for the wake up call today. 5:40.
Oh,
See, Pookie, you gotta stop joking about that because I swear to God, if you call me at 5:40, some punches are gonna start getting thrown. They're not gonna hit you because you're on the other side of the country, but do not call me that early.
5:42. Gotcha.
I started my see-through log in 2022 and I started medications in 2024. So it is possible to see what I was like, what I was doing on no medication. And I have not logged any of that information into anything that would allow me to
and it's like
analyze that further. But
there's what you were like when you
yeah,
first started seizing and on no medication. But now
yeah.
I be
How much that period of time? I mean,
yeah,
it's
like
only been 2 years,
well,
one
yeah,
and a half.
that's the other thing. Well, we have people like Kevin, who's 8 years seizure free, and like, is Kevin still on meds?
I believe
Yeah.
he is. Yeah.
And he's a
Yeah, so like
VNS.
He wants to
well, yeah, he
work
is the
on weaning
VNS,
off the last of his meds.
but like, I'd be curious to see, and I'm not going to ask him to do this. What like Kevin would be like if he weaned off his meds but kept the VNS sort of thing, like no meds, just VNS. And I don't know, it would be like a cool marker, I guess, for us because Kate, you have the INS, RNS,
RNS.
RNS, yeah.
RNS, yes. And like I don't actually know what the difference is, but that's just because I'm uninformed.
The VNS is just it emits those pulses on a regular basis, and the RNS is supposed to pick up a fuck up and then zap me.
Oh, okay.
So it's supposed to be responsive.
Oh, okay.
And
So yeah,
when I weaned off the meds, it ended up just RNS helped the tonic the TCs, and I'm staying on a fraction of the Keppra just for the focals. So that's
that
how
makes
far down
sense.
I went. I got rid of the benzo, and then I was just
Oh
having too many focals. So
no,
I went back on half of
actually
one pill.
that's actually exactly the sort of answer I was looking for. It's like you were able to cut down on the meds. Obviously it was different because you had the VNS, wait, RNS, yeah, RNS. Um, but still, I'm just interested in sort of seeing the connection between the amount of time people have had epilepsy and been on meds and then cutting down.
And the
It's
next part of the
purely
experiment is going to be like meds versus BMI kind of ratio. If I can drop like another 50 pounds or so, then maybe I can cut this pill in half.
oh yeah,
So we'll
that's a
see.
good point too. I never thought about that because um the amount of meds that you take is based on weight. Yeah. I
Yeah.
never thought about that. There's so much to it.
Wait,
Wow.
it is?
Well, yeah, I mean,
It affects the half-life on some of them.
Oh.
yeah, it with most medications and stuff, it's like, if you're rail thin, you're not going to need as much as someone who has like a healthy, BMI sort of situation. You're,
Tell that to my doctor about Kepra.
I'm I'm on 750 2 times a day. What do you want?
Uh, I I was up until 2 weeks ago. I was on 3,000 a day. I'm 5'8" and about 120 pounds.
Yeah,
Oh,
I'm 5'9" and 130.
So
So
yeah, we're
very,
roughly the same. So thankfully they just stepped me down to 2,000 on the Kepra, but that's because I switched from Vimpat over to the clobazam here. So that's what I was mentioning the other day. I was on multiple different medications at once as I was weaning off one and going on the other and changing a different dosage of another, and um that was kind of my zombie couple of weeks, and that was when I basically laid in bed and did nothing, and then found you guys, found this group.
yeah, 3,000 seems a little wild, I guess. But
Yeah, and
yeah,
I
I
was
mean,
begging him to take them off, because as soon as I started stepping that up a couple years ago, I definitely noticed my me was changing, myself.
yeah.
So I wanted to get back down. So thankfully I've done that. I don't know if the clobazam's doing anything to help, at least with the personality stuff. I still feel like I'm a weirdo. And plus I've had 2 seizures just in the about 2-3 weeks since I started taking the clobazam. So I don't know if it's really helping much, but like we all said, we're all trying pretty much anything at this point, right? After we've had them for so long. So
Yeah, and I will say this: we're all weirdos. I I hate this also because I forgot what I was totally gonna like just about to say. So I guess I'll send it to Pokey for the next. So we can, yeah, that's usually the easiest way to do it. Is if we forget what we're doing, we just send it to Pokey for the next question. Sorry, again, Pokey. For me, I am directly to your right, and you are top left. So for me, I'm pointing directly at you.
Okay, for
thank
you,
you,
you're
Vanna
in
White.
top middle. So anyhow, got one that says middle-aged guy who has been told he has epilepsy. Can I question? Can I ask a question? I started having seizures in 2021, but wasn't about until 6 months ago that I discovered it was seizures when I was taking a nap during the day at my parents, and it happened in front of them, traumatizing everyone. It had always been in my sleep, and I live alone. It wasn't until this event that we realized all the times that I bit my tongue and my cheeks while I was asleep was likely seizures. I have no family history of epilepsy. It happens so infrequently, though though that no one has found the cause. I've taken multiple CAT scans, EEGs, MRI, and did sleep studies. So far, it's been shrugs all around. Still waiting on the sleep study results. I'm in an I'm on an update dose of Keppra, and for the past 5 weeks has been nothing. Up to 3,000 milligrams per day from 2,000 milligrams. Last night I bit my cheek again. I did have a much larger dinner than I'm wondering. Could that be? Could high blood pressure be the cause? I've also had a diet and lost 20 pounds in the last night I ate more than normal. I'm also grasping at straws because I spent a lot of money on tests and know as much as I did 6 months ago. The question I seen was, could it be high blood pressure that's doing this? I don't know. You never heard of high blood pressure causing
I mean,
anybody of
I've
anything?
never heard of high blood pressure causing seizures, but I mean, taking care of your body is a good step towards, finding finding something that might work for you. Because it could be maybe a trigger, but I wouldn't say that it has anything to do with your actual brain activity. Um, yeah, I'm not sure.
The top comment says most people have idiopathic epilepsy, which means there's no clear cause of it. So don't get your hopes up when it comes to finding one. Basically, anything can trigger a seizure, so it isn't totally crazy to think a big carb meal could be a trigger. Keep an eye on it and see if the pattern emerges. Also, sounds like Keppra isn't working for you, so probably best to discuss other options with your prescribing doctor.
Kepra's not for everyone, that's for sure.
It's still not helping me.
And
Hopefully one
luckily,
day.
luckily there are a ton of other, anti-seizure medications that can be, I don't want to say experimented with, but, tested to see how they react with this person specifically.
Another comment says, jumping in just to empathize. I'm a woman in my 50s diagnosed last year and also know just as much as I did 6 months ago. I am surprised it's this hard to find information, but I'm beginning to appreciate it and appreciate it's different for everyone.
It definitely is different for everyone. That is
I
for sure.
think I think one thing is for sure too is that carbs, um, from what I've noticed at least, talking with other people that have tried out the diet that I'm on, is that carbs do mess with the system a lot, and that can have an effect on the amount of seizures that you're having. So lowering those, Brandon, lowering those can make difference. Although just like, it's different for everybody. It can have a mild difference. For some people, it can have a major difference. So
Yeah, sorry, I was waving red in the camera.
I wish I could
I was
still
wondering
eat that.
why. Got someone here. It says it could not be necessarily high blood pressure, but it could be a specific thing you ate too much as well. Epilepsy has many triggers, and for everyone it is different. Also, sometimes we can never find the cause, and well, that is okay.
Was there a question, or was it just sort of a? Oh, was that a comment?
Person was asking, could it be high blood pressure because of what
Oh,
he just ate?
yeah, no, I'm with you. I've never heard of high blood pressure like causing that, but also, as we know, there are many different like causes and reasons for seizures. So I wouldn't be surprised if it was something that could cause a seizure. I just have never heard of it. That's all.
You guys are
This
gonna love
thing
this
with,
one. Okay, go ahead.
oh, sorry, go ahead, Kate.
It's a totally different post. Go ahead.
Oh, there's something called transient ischemic attacks, and that can happen with people who have high blood pressure, and it can look very similar to a seizure, especially like an absence focal aware. So it's hard to say. I mean, but if they were diagnosed with epilepsy, you have epilepsy. And like the other replies, it's like we don't always find out, what the cause is. We just have to deal with the fact that we have it. But a TIA it's actually a mini stroke. So, it robs the brain of enough oxygen for things to kind of shut down. And it's very common with high blood pressure. So it could be that. But yeah, they need a diagnosis or at least accept the one that they've got,
Yeah, I feel like there's really no way to not like we're not self-diagnosing, but they can't self-diagnose. Like they need a real
Right.
diagnosis in this situation because this seems like it could come from several different medical conditions. Like they do have epilepsy, but also they have other issues that could have potentially just led to a seizure in that specific instance, but wasn't related to their epilepsy. We don't know.
Yeah, yeah, but it can be a lot of different things, and unless you get an actual clinical diagnosis, it's really hard to support a diagnosis of epilepsy. So, because there are other things that can do that. There's vasovagal um, events that can cause something that looks like a seizure. And of course, our favorite thing, there's always psychogenic non epileptic seizures. They are real, but don't tell me that's all I'm having. Yeah, I have psychogenic epilepsy.
Well,
That
Angel made the
was
point too that high blood pressure can lead to strokes, and then strokes can lead to epilepsy.
lead to the epilepsy. Exactly. Yeah,
And
Yeah,
this is
that
a
but
good
we're not the
point
doctors.
that
to
was why I
make.
was saying it, about the like. There's other health factors here because you, if this person had a stroke, it's like okay, their brain is already traumatized. Like one of the
Yeah,
highest. Their brain has gone through one of the worst things.
And that's why it's important to not just have a seizure log, but a symptom log of everything that was done beforehand that you can remember before a seizure happened, especially if you're undiagnosed, because that can help you lead your way towards a diagnosis,
And
whatever it may
convince the
be.
doctor that nobody but a patient would have felt that.
Exactly.
Yeah. So this one is titled Epilepsy and Higher Power. A friend of mine has epilepsy, and recently we were discussing human existence and the concept of a higher power. She was describing her experience with seizures and suggested a theory that there's a sort of glitch in the matrix going on in the moments immediately before a seizure. She told me that she feels like she's discovered the secrets of the universe, something we as humans can't really process. Then she's out. When she comes around, it's like her brain has been reset. Of course, neither of us are science deniers, and we understand the neurological explanation for all of this. But she wonders if maybe her epilepsy is a gift. As horrible as it is, she feels like she gains a greater enlightenment. Does anyone have a similar experience?
I definitely don't feel enlightened afterwards. I don't know about you guys.
I
I was
I
gonna say that I
Me.
don't feel enlightened.
I feel like I just ran through a wall head first. How is this enlightened?
A sense of spirituality is not entirely uncommon in temporal lobe epilepsy. I don't know if any of you are familiar with the sci-fi writer Philip K. Dick, but he had a spiritual experience in his life where there was this missionary, like door to door missionary. I think she was um I don't know, I forget, but she was going and um he saw this pink beam of light reflect off of her gold cross and felt a sense of a higher power, and it has been hypothesized or proposed that his experience there may have been due to um, undiagnosed temporal lobe epilepsy as one of the scientific medical explanations for his experience there. So, but he felt that his experience was life-changing enough that he He quit doing drugs. He was a um, uh, speed addict. It's not a meth head, but amphetamine. So they're cousins. They're kind of the same thing, just you know. But um, among other, many other substances of abuse. So it was a spiritual religious experiment or experience that was significant enough to change him for the rest of his life. And um, yeah, these medical professionals, some of them at least, have posited that epilepsy could explain, such a significant experience. So I wouldn't be so quick to dismiss it necessarily. Uh, I don't know. I wouldn't be so quick to dismiss it necessarily on either side of,
Brandon,
the
you got a
coin.
book by that Phil Dick Mark talking about?
No, this is Kurt Vonnegut, but it's Slaughterhouse
Oh,
Five, and
yes,
it's
that's
it's
incredible.
it's totally like one where you read it and you're like, this main character is, I don't want to say epileptic, but like they're experiencing some weird shit. And yeah, I feel like
So
some
it goes.
epileptic could relate. I don't, but I feel like some could.
Yeah.
But yeah,
Well, one of the comments to the yeah, go ahead.
Mark, you know Slaughterhouse Five? Great fucking book, right?
Yes, I just read it just just a couple months ago. It's incredible.
It's one of my
Yeah,
favorite books. Yeah, it actually is my favorite book right now.
really. Very cool.
I got something, guys. It says, is it still considered refractory epilepsy if you didn't max out your dosage? I need to ask my doctor this on Friday because I wanted to hear everyone's experiences. Lamictal did not work for me. I'm on 25 milligrams twice a day of Briviact, and it's not working either. I know I could still increase the Briviact, but I'm not sure if I'm supposed to already be feeling better. It's hard to tell sometimes if I made any improvement from the start because I feel good but in bad waves, but bad in waves. I still have small focals about every day and sometimes more. Did anyone end up increasing their dose on their med? And it went from not working to not working at all.
Yeah, you don't have to max it out. Sometimes if you're taking a medication that the side effects end up being worse than anything else, then they'll shake you off before they max out the dose, and after you've gone through 2 or 3 of those, that's refractory. Some people are just really sensitive to these medications.
So that's like drug resistant. Just eventually you just can't take it anymore, is what this person is saying.
Yep. And then they start talking surgery or some other treatments. Hopefully.
I like to say goodbye to everybody in person or over voice instead of over chat because I love all you folks. So I want you to all hear me say good night. I hope you all have a wonderful night.
I'm still expecting more people.
Huh?
So I'm still expecting some newbies. I'm getting
I
messages
don't
about
know.
new people coming.
Are there going to be people coming? Jesus Christ, they're late. Wow.
Yeah, but
Westies. Yeah, West Coast.
yeah,
Oh,
I'll
those
see. I'll let you know
Westies.
how that goes.
Yeah, give me some updates if there's anything interesting. Um, Mark, Kate, Annie, Sia, Lufa, Toaster, Angel, all have a great rest of your night.
You
You too.
too. See you Friday, Brandon. I'm gonna do the same thing. I'm gonna bail. I just remembered I have 2 appointments tomorrow, and one is with my favorite primary care provider who's trying to block my surgery next week. And she can't, so she's mad. So I have to go in and see her. But anyway, yeah, I've got 2 appointments. I'm tired. My allergies are driving me nuts. So I gotta go to sleep. I miss you guys. I'm glad I decided to come in and join you all again. And I don't know if I can't sleep, I might pop in here again and see what's going on
Well,
with the
glad to
meetings.
see you. Now think about that argument, how that's gonna go. Any rebuttal she has for you, you're gonna be prepared.
Yeah, we're prepared
Got this.
because we don't
Good.
need her to release me for outpatient surgery.
Okay.
And she is successfully making a fool of herself, and I'm letting her. So tomorrow's going
Feel
to be a
free.
fun. Yeah, it's like, hey, that's on you. But yeah, so yeah, I've got 2 appointments, and who knows? I only slept 4 hours last night, so maybe this will be better. But all right, guys. Well, I will see you. I might pop in on our private Zoom. Haven't been there yet. But I'll definitely, most definitely, maybe most definitely see you Friday. I don't think I have anything going on. All right, love you guys. Take care of yourselves.
Later. All right, Pookie, you got the next one?
Yep.
All right, my husband's epilepsy diagnosis has changed who he is, and he's not the person I married anymore. My husband and I have been together for a total of 10 years. Last year, he got in a car accident due to having a seizure. He didn't get hurt. He was combative and confused. They didn't know what was wrong, so they drugged him, put him on a ventilator, and ran many, many tests. It was scary, as they told me it could be a brain bleed. They diagnosed him with having a provoked seizure. After that, however, the seizures continued and took a year to get any sort of control. He's not the person I married. I'm struggling with it. Used to be fun, goofy. We had an amazing sex life. All of that about him is gone. I feel so unwanted now, and that we're just passing bodies, barely functioning to take care of our kids, trying to understand as much as I can and can't take it personally, and not take it personally. He told me he doesn't know that person anymore, can't be that for me. I love him to the deepest part of my soul, not going anywhere, but how do I deal with this new person? And then just asking, has any other spouse with epilepsy gone through something similar? And I would agree with that first comment, talking about counseling. She's saying she still loves him.
She's still being there, still being a wife. That's love.
Yeah. And this one is, it's not for, okay, let me post it to you.
And now I got one. You guys there? Anybody there? I read it out. It says, I've been taking CBD pills for the last 9 years, and it's helped me a lot with managing my epilepsy. I've also been smoking THC for the last 2 years with no issues. But not too long ago, I had a seizure because I missed my meds and didn't get enough sleep. I smoked that day. So I'm just wondering if THC had anything to do with it, or if it was just missing my medication and not sleeping enough. I'd like to smoke again, but I'm scared. I know that CBD is beneficial for my epilepsy, but is THC okay for epileptics too?
Okay, for some, it's seizure provoking. For others, it's been found to actually cause problems for some people. So it's entirely case dependent, like so many things with epilepsy. Um, there was another sentence in that thought.
Yeah.
I lost it. It got away from me.
One of the comments says, I stopped consuming THC after I had it 2 years. My neurologist at the time wasn't using the word epilepsy, but stating I had two seizures that we didn't understand where they came from. I had sepsis at the end. I had sepsis at the time, and I have hydrocephalus. So I felt like I knew where they were coming from. So I thought smoking and partaking in gummies would be fine once once I was cured and stabilized. I don't know how, if I greened out or seized. I genuinely cannot tell the difference because it felt so similar. to my first grand mal seizure, leaning towards greened out, but it spooked me so bad anyway. I put it down and never picked it up again. Greened out, is that like
I mean,
going to sleep because you smoke too much?
that's like someone who can't handle their bud. Um,
How do you OD on
um,
weed?
if they had a grand mal or tonic clonic, their muscles will let them know about it. A greening out doesn't cause the same sort of physical soreness like working out. At least from my experience, but all of the tonic clonics that I've had have been longer, like 10 minutes or more. So I don't know, maybe if they're shorter, if they're, if there's intervention and they don't last that long. If the muscle soreness might not be as much of an issue, and you still get the neurological, the significant neurological impact of the seizure. Uh, do do you have any insight on that from the
Um,
uh,
I read it all.
um,
But
I forgot the question already. Man, I should just leave. I feel like I'm useless. I'm just, um,
um,
but I don't know. It's great
Never
talking to
just
you.
useless.
asking, they're just
Your
asking if
insight is
THC.
always valuable.
That was the main
To,
question. Is THC okay for epileptics?
oh, oh, oh yeah. Okay, that makes sense. Um, yeah, case dependent. Um, I'm not seizing right now.
I said the same
I'm
thing.
not greened
So I'm gonna
out
read a couple
though.
of these comments before you come back. I'll read a couple of these comments. One says THC has no impact on my epilepsy. It does not cause nor prevent me from having seizures. Another one say I only just got diagnosed and didn't even realize I was having seizures. But looking back to my stoner days, the times I smoked the times I smoked were the times I had most seizure activity episodes, one actually convulsing as well. Um, yeah, I don't remember any seizures being caused by epilepsy. I mean, seizures being caused by smoking or edibles or any of that.
I have had
Public
one
health.
because I had way too much one night. My pen was stuck and because it was the ones with the liquid. I don't remember what it's called, but it
Yeah.
was stuck because I hadn't used it in a little while, and so I kept trying to puff it so that it would get unstuck. And it was a little different than that one, Mark. It was the little it was like a little rectangle basically, and it didn't have like a good processor in it, so it got stuck very often. And I took in too much thinking that it wasn't working, and then I got so bad that I ended up having like 2 or 3 TCs that night, and I had no idea what was going on when I woke up.
I wonder how clean some of those like distillate cartridges are in those uh, damn it, I already said goodnight, didn't I? Yeah. Um
But you couldn't fight the compliment on us praising your opinions.
Do what?
We got you to stick around because we were talking about how valuable everything you say is.
Oh, yeah. Yeah. Well, I mean, my ego is tied up in my intelligence, so that's all you got to do to get me to do something for you.
Well, we still love it. We love it.
All right. Good night.
Good night,
Good
Lord.
night.
See you Friday.
Um, this one says, is anyone else sensitive to light? Well, not having photosensitive epilepsy. My epilepsy is photosensitive, not triggered by particular frequencies or light or flashing light effects, but I am photosensitive and have lots of strobe lighting, very bright lighting, flicker lights, and etc. It's very uncomfortable and usually causes a migraine for me, which can then lower my seizure tolerance. I also find anything bright light, especially sunlight, quite painfully, and pretty much always have to wear sunglasses outside. Although I know this can be linked to meds. Anyway, I was just interested to hear if anyone else has any kind of intolerance to flashing lights or sensitivity without actually having photosensitive as a trigger. Lights
Um,
don't bother me.
oh, go ahead.
Oh, lights don't bother me. I'm gonna post a video soon to show you how much lights I was in at that concert. And yeah, went to
I
see the
remember not being able to watch the videos that you posted because of how many lights there were.
Yeah,
Oh, okay.
there's
So,
there's some videos that are just like there's some that are flash that I'm fine with. Like I watch a lot of true crime and they have a lot of times where they'll have like the police car lights flashing and I hate that shit. I'm always like, can we leave? I already know that they're getting arrested. Let's leave the flashing lights out. But it just kind of more bothers my eyes and my head and my migraines, my big ass cranium. But
Oh yeah, I'm like they haven't labeled me as photosensitive, but the brain waves when they were at the higher levels on the photosensitive test slowed down drastically. So they told me that it could be like kind of a I'm not sensitive to lights that are slow. Um, and if it's flashing really fast, like if there's like a whole row of trees and the sunlight's flickering like crazy, or like with that test, when they get to the higher levels of the photosensitive test where it's like almost constant, that's when it affects me pretty badly and I'll end up going into a seizure.
very interesting.
when they did the flashlight test on me or whatever, it didn't bother me, and I think because it wasn't different colors. Um, if it's just like a strobe light, I don't really mind it. But when it comes to like a bunch of different rotating colors, um, it starts to kind of bother me. And then that's when I start to feel kind of wonky. But I don't think I have photosensitive things. But I don't like if they would have used like a colorful one, then I would have spazzed out on them and probably hit them. So
Well, yeah, I think that's the thing is that photosensitive pho words photosensitivity is on so many different levels. Some people are affected by different colors, some people are affected by different speeds. I saw one person a long time ago say something about how they were only ever affected by the sunlight behind the trees, not any other type of light. So there's like so many different levels to it that it's kind of hard to like say, because their expectations with photosensitivity is a specific kind of light, but there's so many other different types that I don't think people really know about.
Have you guys ever heard of sounds being a trigger for some people? And you know how many different sound spectrums there are.
Yes, actually, and that is a big one for me as well. And I thought it was because of autism, because I get very easily overstimulated. Um, but it's certain types of sounds that do it. And for me, it's like deep, heavy vibrational things. So I don't know if that is autism or not.
This one is talking about agoraphobic epilepsy. I know we heard this word before, but I still don't really know what it means. The title is a two-word summary of what's been bothering me over the last few years. I've lived with epilepsy all of my life since I was born. Has it bothered me before, like it does now? Before I was okay with going outside because my seizures were so small, I could hide them by pretending to tie my shoes. Now they're much more noticeable. I don't like to be noticed when I go outside or to some places with people. I'm always afraid of having a seizure and attracting attention. I wish to be able to go outside without being so afraid so I can go wherever I want. For example, I want to go to work out at a gym in the future. Until then, I'm stuck inside my house because it's the only place I feel comfortable. Any advice to remain calm? Okay, so this is another one of those like scared of the out or anxious about the outside world. And that's what it sounds like, more of an anxiety issue that's triggering seizures.
I keep hearing that, and as someone who is afraid of the outside world, um, it can definitely. I think it's more of a stress thing. Um, like I think because of how stressed out the person gets leaving the house, or just the thought of leaving the house and then being out. I know for me, when I get outside, immediately my head goes to everyone's looking at me, everyone's looking at me, everyone can see me, everyone's watching me, and they're like, that's just the first thing that my mind, and it's just like on repeat, which is why earlier I said that it's almost can be kind of like OCD because it's these obsessive thoughts that everyone is watching you, and not in a paranoid way, but in a way of like maybe it is paranoid. Yeah, maybe it is paranoid. But just like you're constantly having to be wary of your surroundings, and I think being epileptic then plays another part into that because you're like, holy shit, what if I have a seizure out here? Then I don't know if everyone's looking at me. I don't know who's around me. I don't know who's, because then you're completely at the mercy of others. And that is a horrifying thought. So, unless you're dead. So, and that's literally what the mind inside of mine looks like. Like, unless I'm dead, then that's horrifying. Um, but it can kind of lead into like the obsessive thoughts. Because at some point, anxiety, you can be anxious about things. And have different anxieties, but anxiety and OCD can kind of mesh over into each other in wanting control because OCD you want control. And I think with a lot of people, they want control over their epilepsy, which can lead to obsessive thinking and compulsions, even sometimes. Um, but it can be a little scary. My biggest life hack is old people. I do a lot better around elderly people that have no idea what's going on. And like, because people my age, I just feel so judged. Like, they're so scary. They're horrifying.
Exactly. Old
They're,
people don't judge.
they're so scary. Old people are like, they're just fucking old. And they've been through life. They're feeling shit. They're hurting. They're probably in either a bad mood or they want to love all up on you. It's one or the other. So, old people, you know, Sometimes they're annoying as fuck and they think they know everything. But at the end of the day, you sit back and you're like, motherfucker, if this place were on fire right now, who's getting out first? Me! Loser! Sorry. But, that's just for when they're mean to me. If they were nice to me, obviously I help them get out, throw them in a wheelchair or something. But, old people, best. That's when I like to go to the gym. So when all the old people are there. Because there's no judgment. They're old and they look up to you. They're like, wow, you're an Olympic swimmer. I'm like, hell yeah, I am. Meanwhile, I have epilepsy written all over my body in Sharpie.
What did I miss? Because I came back to Lufa talking about old people and I couldn't stop laughing.
Yeah, it was the old people.
I don't remember. I don't remember anymore. I think she was saying like definitely less judged around old people than like younger.
Which sounds weird because you might be like, oh, hell no, they're judging the fuck out of me, which they probably are, but in a different way, in a different time zone.
No, I totally understand what you mean.
They can't
Yeah,
judge.
especially living in a retirement community here.
Yeah,
I do too.
Girl, you don't know what's going on in my Gen Z era. You don't know.
My neighbor, she's like in her 70s or 80s, and she's always so sweet, even though she's like the most gossipy woman in the entire area. She is so sweet when she comes and asks, "Are you doing okay?" after she sees an ambulance in our driveway. Old people are so much nicer.
Bless your heart. And I'm like, yes, God bless my heart.
And then they get all curious asking about dog's vest and, basically what's wrong with you. But they ask it so polite. I told the neighbor that we know what's up. And same deal. She's always like, hey, how you doing? Like actually genuinely concerned about it and comes over sometimes just talking about like the most random things. If I met this one whose son has epilepsy and their grandson didn't. She just always looking for some kind of like bright side punchline to make.
That's the cute thing too, is they love the silver linings.
Yeah, like
yes.
I think because they've been through life that they just react better to it. I found that I get a lot better reactions out of old people and they understand my epilepsy a lot more or are able to empathize with it a lot more than people my age.
Well, not to mention you trust somebody who's lived well enough to make it into their 80s.
Yeah. And they're so uplifting. They're just so uplifting. They're like, you look so good out there. I would have never known. You are such a fighter, young girl. You listen to your body. You're such a. I'm like, yes. Oh my god. You are. Love you.
What is this best? Oh my gosh.
And then they're like, I'll be seeing you around and I'll be keeping you in my thoughts. I'll be praying for you. I'm like, yes, I love you.
Yes, you gotta do acting or theater one of these days. Please.
My mom
Do the live action of Toaster Stories.
Please take your medication as prescribed or whatever works for you. We're not doctors.